any questions at all about anything in the summit, find people with orange name tags. These are the organizers who can help you out. And we'd love to keep the conversation going online. So please keep tweeting and use the hashtag. It's up there. It's a little bit hard to see, but it's hashtag 2022 Africa Evidence Summit. So please tweet, please keep engaged. So without further ado, I'd love to reintroduce you to Janine, who's going to be our MC for this morning. I think we all know Janine Chondo. She's the director of CECIN, which is one of our core partners on the event. So I will pass it to her to start us off for day 2. So thank you so much.
Good morning, everyone. Did you get your breakfast? Not yet? I can go quickly grab coffee there. But you all are okay, and welcome again to our day 2 session on Africa Evidence Summit. I think we learned a lot. I would like to ask those who are on the back there to either sit or come closer here so we can all enjoy our day 2. I think day 1 we learned a lot, from different presenters, speakers, and I think this is a place where you receive a lot of knowledge, skills, and how other countries are doing, how other PhD are doing. So today I was asked to introduce myself. I'm pleased to be here to present myself and the company. So my name is Janine Chondo. I am a medical doctor by background, and also I was privileged to do my master's and PhD in public health, and more importantly, nutrition. So just before when I finished, I was privileged to join SIGA. I am the first fellow to join SIGA. That was back in 2012. Thank you. We enjoyed a lot working under the leadership of Ted Meagher. We learned a lot in terms of how to navigate, how to do robust modeling, how to work, and how to actually bring it back to the country and help our policymakers. Just after that, actually during that time, I also privileged to serve as the Dean of School of Public Health here in Rwanda. And a few months later, again, I was appointed as a principal of the College of Medicine and Health Sciences. So I know a little bit of the academic world. And then after that, I was called to serve as a Director General of Rwanda Biomedical Center, which you know today. Rwanda Biomedical Center is an institution that is in charge of implementing all intervention from the Ministry of Health. So and I served from 2016 to 2019, just before COVID. So the point here, why I'm here, I think it's important to take advantage of this summit, to take advantage of opportunities that are given to us by SIGA. That's where you understand what you need to do as a person, as a researcher, as an academician, but also as a policymaker. What yesterday the minister said was really resonating to me. And when I left RBC, we thought that there is a gap between how we academicians do research, and most of the time we do research for our promotion, right? Unfortunately, it's to pile how many articles were you able. I remember when I started being, junior lecturer, and today I'm an associate professor. It was about papers published, and it was about impact factor. Back at RBC, I learned that we don't give much to policymakers, and they need us a lot. They just need people who want to be with them, who will guide them with evidence. And I think this is the community. If we are back to our countries or we're here, we need to see and start approaching our policymakers. They're dying of evidence, but they don't know how to approach, they don't have time. And we need to be able to synthesize what we have from our p-values and logistic regression modeling that we learned yesterday to use a simple language to inform our policymakers. So that's how Seeking was born. Seeking is a center for impact and innovation for capacity building. The idea was to link up both researchers, academicians, and policymakers. So what we do is very simple. We started in 2020, actually, during COVID, and we were so busy with the demand from the ministry as well as from partners. Today, we have around 14 projects that we are running, and all are coming from you, from founders, and also from the ministries. So what do we do, and how do we do it? We first hear the voice of the policymakers. We start hearing them. During COVID, we asked the Minister of Health, especially the different divisions, what do you have? What is bothering you? That's where we start. We start, but what is bothering you? What is the problem that you are facing? And then from there, for example, I was approached by the Maternal and Child Health Division. They say, we don't know what is happening with ANC, antenatal care. You know, for some reason, we have our delivery, women delivering at the health facility, is very high, 90%. But still, when you look at antenatal care, and this is everywhere, in Rwanda, in Uganda, in Kenya, antenatal care is very low, like maximum is probably 40%. Then something is there wrong. So we started looking at those data. They say, okay, can we have the data? So they give us access to the data. We sign the NDAs and so forth. And when we started looking at the data, they're actually right. Even during COVID, some of these indicators went down. So we look at the data and present to them, do you guys have time to, have a, so it's a long journey that you do, probably 3 to 6 months. When they understand the issue, we draft solution together. Then we turn to the partners, and this is the case of Agency Fund. Termina, do you know Termina? Termina was also my boss under SIGA. She was, in charge of, helping us when we was there. So Termina now is the boss of Agency Fund. And we look at different partners, Agency Fund, the World Bank, USAID, and most of these funders. We presented our fundings with the Minister of Health, not without them, always with them. We presented our funding to them. We got an initial 100,000 this year, and the World Bank is actually looking after us to help them understand the data that are supporting the country. I don't know if you heard about SPRP. It's a project of probably around 150 million that the World Bank is investing in Rwanda, and they would like a third part to understand the data and to connect the dots, to see, are the data okay? What are we missing? What are we missing in terms of integration? So we are now all talking about the same language, both the partners and us, but also the Minister of Health. So today, I think we try to do that dot, to link those different dots. And so this is how Seeking was born. And please feel free to Google website, and you see us what we do. And very privileged when SIGA is around. I'm here 2 days to learn and to see what other people are doing, to see if anything that can be replicated in Rwanda or in the region, and explore more opportunities. I think I'd like just to say that today is a day where I have 2 minutes left to share my experience, and I think it's a long journey, but it's worth it. It's worth it serving. It's worth it serving both angles. It's worth it working with people like SIGA, where you have the knowledge, and sometimes also you have the means. If your idea is novel, they are there to support. There are many calls that are out there. I think yesterday we heard about one of them. And please visit the website, see what we can do to connect, what is in here in Africa, what is at US and other places where we can connect professors, students, and those are the big networking that we do to advance the agenda of the government, to advance the agenda of the world. So I'll pause here, and thank you so much. And if you have any question, I'm very happy to respond. So I was also tasked to introduce our next keynote speaker, Dean Carlin. My phone is blocked. Thank you so much. Thank you. There are many computers here. Yeah, thank you so much. So we are fortunate today to have another keynote speaker, Professor Dean Carlin. Dean Carlin is a Frederick S. Nemers Distinguished Professor of Economics and Finance at Northwestern University, and also he's co-director with Christopher Adry of the Global Poverty Research Lab at Northwestern University, and the founder and president of Innovation for Poverty Action, a nonprofit organization dedicated to discovering and promoting solutions to global poverty problem. Please help me to welcome Dr. Dean Carlin. Oh, he's there. Welcome, Doctor.
Hi. Oh, yes, great, I am on. Hello, everybody. It's a real pleasure to be here with everybody. This has been really exciting for me for the past 24 hours, and hopefully the rest of today as well. It's a big honor to be here with all of you, and I look forward to many, many conversations that further some of the things we've been hearing up front. And it's just really exciting to see a conference with the word evidence in it. Not to say that this is unique these days, but it is really just exhilarating to see the energy that abounds across many domains: economics, social policy, health, corruption, education, across the space. And that is so critical to everything that I know everybody here is passionate about, as well as we are, is helping to build that culture of demand for evidence and use of evidence. So I'm going to share what hopefully comes across as a connected set of ideas and thoughts, but I'm basically going to share four things that we're working on that we think are hopefully helpful for improving the evidence landscape, both from a researcher perspective as well as from a policy perspective. And so, Mike, okay. And there's two broad themes, and hence the title about economies of scale and economies of scope. One is that there's a lot that is happening in research where I think we can be more efficient. And I'm going to give you an example of an effort that we've been doing now for about 10 years that does have a window for people to get involved. And so it's really also, it's telling you about something we're doing, but really you should be hearing that as an invitation to get involved. If there's something that we're doing that you can use, we want that. We want people to be using what we're doing in Ghana. And the second is an overall message. You know, so much of this conversation is both about evidence, but at the same time policy. And I think a lot of times we think too much of our research. I don't mean us personally necessarily, but you know, all research at the end of the day is incremental. Every research study I've ever done is just standing on somebody else's shoulders, building on what they learned, taking it a step further, trying to fill in some holes. And you know, another way of saying that is no one study should really change the world, right? We put up a study, we learn something, you update. You think, oh, I thought it was 12. You showed me it was 20. Now I think it's 13. You don't say, okay, oh, now I know it's 20, right? You shift and you learn and you kind of triangulate. And that actually has important implications for a lot of the types of studies that we do, and how we can make that incremental knowledge better by creating more commonality across studies so that they can speak to each other even better. Another way of saying that, in a very practical way, is what I'm going to show you is some examples of multi-site studies that we've been involved in and helping to lead, where very similar interventions, not exactly the same because context matters, are tested across multiple sites. And then when we have some common measurement and some common design and methodological structure to what we're doing, we think we can learn more. So there's four things I'm going to talk about. The first is this Ghana panel survey, which, like I said, is an invitation. The second is actually every one of these is an invitation, to be clear. The second is a multi-site impact evaluation. This is what I was just referring to with how we're trying to learn more by having broader scope for research studies. And these are huge enterprises that require lots of people engaged from each country that we work in. The third and fourth are shorter. I'll speak briefly, but one is a structured ethics appendix. That is something that we believe is potentially very helpful for this space for kind of reasons I'll explain. And this comes out of a paper we wrote with 2 scholars from University of Ghana. And the last is a Northwestern feedback project, which is in its beta pilot phase right now. And it's a process for getting feedback on working papers. Okay, so the panel survey. Wow, I can't read my own slides. I have to look over here. Okay, I mean, I know the content, but still. So the Ghana Socioeconomic Panel Survey is something that we started, we're about to do our 4th wave, and it's a large, nationally representative panel survey with about 5,000 households. It's a cross-university collaboration. It's ISER at University of Ghana is the heart. They're the ones who actually implement the survey, and their enumerators and their survey team manages the survey. We started this when Chris Udry and I were professors at Yale University, and so the Economic Growth Center at Yale has been integral in creating this and keeping it going, and they're still part of that partnership. And the Global Poverty Research Lab at Northwestern, where Chris and I are now professors, are championing its continuation. The goals overall is, first of all, to have really good long-term representative panel data. It's to also promote more exploration, more hypothesis forming in a representative way that can help then inspire further research. And I'll give you an example of that exact process in 2 slides. And the other is that this recognition that we could learn a lot more by overlaying policy evaluations on top of pre-existing data. That right now there's a lot of inefficiency. Think about all the data that are collected for individual projects and how many of those projects probably could have used the same data had they coordinated. But it's hard to coordinate. It's hard to get 2 organizations to do things in the same area in the same way. So it's not as easy as saying, like, let's just share data. So that one of the ideas behind this panel data is that the data are there, and then people can run evaluations of policies that are run by nonprofits and government on top of that. We're actually starting up, I realize this is focused on Africa, but just so you know, we are starting a new one in the Philippines as well for any people here who are working outside of Africa. So the basic design here, it's a 2-stage representative sample where we have 334 clusters throughout the country, some in across, so some of it is urban, some of it is rural. It's not just ultra poor or poor households, it is representative. And there's 15 households per cluster. We were very diligent in following households. So if the household moved, we moved with them. If they split up, children grew up, had kids, we kept following everything. Every split up family, by split up, I don't mean that in a bad way. I just mean, children growing up. Data started in 2009, 2010, and we're about to do the 4th wave of the study. Surveyors are actually training right now. We're making final revisions to the survey instrument. We ask a lot of stuff. It's 18 hours of surveying per household. Several visits. That's not in one sitting. And so that's just, I'm not going to go through the list, but it's, it's not to say that everything that everybody always wants is in there, but there's a lot in there. And there's also room to add, although at this very moment, like if someone emailed today to say, we'd like this one question, we could probably get it in there, but it would have to be today or tomorrow. The surveys are all up on our website too, so if you want to see. So let me give you a very brief example of what I think this creates for us. So one of the earlier papers that came out of this was a diagnostic paper, a descriptive paper that documented that there was a lot of mental health depression in rural areas, more so than we expected from what was seen. And by we, I'm including local Ministry of Health. There's a psychologist, Oforiata at University of Ghana, who we had working with, and it was, it kind of surprised her as well, so that there was this really high level of depression. Actually, I'm not sure that's true. I surprised her. She was, but it was able to document at the very minimum what she perceived to be a problem. And so this motivated us to set up a cognitive behavioral therapy evaluation. It was a program that, Angela Ofori-Atta had been already coordinating with the Ministry of Health, training students who had psychology degrees to conduct group-based cognitive behavioral therapy. It was a modification and adaptation of a program that had been successfully rolled out and tested in other parts of the world. And so we set up a randomized control trial of that program as a precedent in terms of sequencing before a different program that was a more economic-based program that I'm going to share with you in just a moment. One of the most striking things we found, this paper, we have this evaluation is now forthcoming and in AR Insight, and one of the most important things that we learned from this is that this cognitive behavioral therapy program, which was designed to address the diagnostics that came out of that long-term panel of high levels of depression, it worked really well for even those who were not identified as depressed beforehand. That it just turned out to be a good program. And there's a lot in the science of cognitive behavioral therapy that supports that basic idea, that it's a tool for helping to achieve goals, deal better with difficult environments, take responsibility for what you're responsible for and not for what you're not responsible for. And in some, those are lessons which I think, I could benefit from those lessons sometimes too, and I don't consider myself depressed. So these are the kinds of things that can help regardless, and that's basically what we found, that individuals who were not clinically depressed prior were less likely to become depressed because of this program. And likewise, people who were less likely to be depressed afterwards. A second paper which came out that's related to depression, also using these data, was more historical in nature. It used cocoa prices as a shock to income when children were children, and then looked later life to see how did that income shock that happened to them when they were young, how did that manifest itself later in life? And this study was possible because of all the rich data that was in our survey, and because it was representative of the country, we were able to use that variation that took place across the country. And so the uniqueness of that, the richness of the data combined with the representativeness of the country enabled them to work on this paper that found these long-run impacts from basically income shocks when you're a child on mental health status when you're an adult. A second example came out of this, it came because of COVID. So, and this is exactly the kind of quick speed reaction that we're hoping to be able to do with this. Because, obviously we're all familiar with all the issues that took place because of COVID or are still taking place. Food security, things of this nature that were rampant in the early stages. Ted Miguel shared some of those results that were documented from across the world. And so we took our panel survey, identified the 1,500 poorest households, and rolled out rapid fire a cash transfer program that was about $42 US PPP of weekly transfers. And from this, we find that 40% of that money got spent on food, so it was directly leading to food security improvements. Food expenditure was up 8%, income was up 20%. So some of the money did get invested and helped generate income-generating activity in tough times. Social distancing also went up 0.08 standard deviation, so it's important to figure out how to balance these things. What's the income that was being generated that allowed that to happen. And the income effects are persisting at 8 months. A new study that we're also rolling out is on smartphones, where we have randomly supplied smartphones to people in the panel, and then we will be able to use that. So these are the kinds of things that one can do with an infrastructure that's in place, where you don't have to set up new data collection for every idea that somebody brings to you and says, hey, can we test this, can we test that? It's not to say that we can do everything, but there's an ability to test out various ideas. And so that's very much an invitation. If there's things where that feeding off of that kind of infrastructure would help you answer a question that you think is helpful and important, that's part of your agenda, please email us and bring it to us. And if we can make it fit, we want to make it fit. So the second content is about multi-site studies. So here, clearly, I think, some cliches in our world that are, cliches are often true. They're not just cliches. Context matters. We get that. We all get that as researchers, that you can do a similar evaluation in two places and get different results, and it's because of something about the local context. It might also be because of implementation differences. But it's not to say that there's no generalizability. If there was no generalizability, I think a lot of us might not be doing what we're doing today. I wouldn't be if I didn't think there was some lessons to be learned from one place to take to another. We certainly wouldn't spend as much money as we do on research. We spend money on research not to look backwards and say, how did we do? We spend money on research to be able to guide the next dollar, $1 million, $10 million, $100 million to help make that future resource allocation more efficient. That's why we all do what we do. So if we didn't think there were lessons that could be carried forward, we wouldn't do that. Having said that, context does matter. So we do understand that there's some balance here that needs to take place. And so one of the ways of trying to deal with that is perhaps a little obvious, right? Is to try to understand more about the variation of results across sites, right? So like, why is it that we get different, we see 10 job training programs, 10 cash transfer programs, and we get 10 different results, right? But sometimes they're similar, and sometimes they're not. And understanding more about those differences is absolutely critical to this journey that we're all on. And there's many ways of doing it. Sometimes someone can sit back and take the data that others have collected and set up, and there are going to be differences. So Rachel Meager is a professor at London School of Economics who's been doing some fabulous work in this domain. But she's always, her hands are tied because she's using the data that others have collected, and sometimes it doesn't line up so well. And now it's just adding a wrinkle. Now when you get two different results from two different sites, you say to yourself, well, was it the country and the macroeconomic conditions? Was it the implementer? Or could it be that the survey team, they asked that question differently? Instead of household income, or consumption in an aggregate, you asked about food, this survey over here went item by item through things. Or whatever the difference might be about the way the data were collected, the way the data were asked. And now that was just adding complications to make that an extra thing that could explain differences across studies. And similarly methodological. Methodological differences in how one is tackling that classic identification problem that motivates the randomized control trial when appropriate. That can vary over time. Like I know yesterday there was talk about spillovers in one of the questions that was in one of the sessions, right? And spillovers, when they happen, and if they're measured, that's great. That's one of Ted Miguel's perhaps most famous paper, is a paper that directly tackles that problem, not by saying, well, I guess we can't do a randomized trial. Instead said, well, no, let's use the randomized trial to measure the spillover. That's the right way to think about this. Now, you have to have some idea as to how that spillover is going to happen in order to do that. But, that could be differences across sites where because, maybe one site was more dense and the other was more sparse. And so we had more spillovers in one versus the other, and you just get two different point estimates and you don't know what's happening, right? So these are all reasons why some common thinking and common methodology can go a long way to helping the sum of individual studies help us learn more. So basically, in a nutshell, what we're talking about here is don't put too much weight on any one study. We learn, everything's incremental. We can get a lot more when we start pooling studies and seeing patterns across. But it's even better when we can do that coordination up front, because then we can tackle some of these methodological issues and remove some of the differences across sites as the possible explanation for why we got 12 here and 20 there. So here's an example of one. This is a series of projects that go by a few different names under social protection. Historically, they were called graduation programs, which is, I thought, always a horrible name because most people immediately think of education and it has nothing to do with education. The term also at some point meant graduating into microcredit, which I think is a horrible name too, because that's not a goal. A goal is to increase income, increase consumption, increase well-being. Microcredit might or might not be a tool to get there. At some point, it was converted to referring to it as graduating out of poverty, which I also thought made me kind of nervous because even programs that work, taking someone and literally moving them into a socioeconomic status that would help us, we would label as not poor, that's a big leap, right? And so you're setting yourself up for disappointment even if you succeed in increasing income by 30%, which is a big move. And then you say, oh, but they're still poor, so we failed. And like, no, 30% is important. That's a big change. And if the benefits better than the cost, then proceed. The basic premise of these projects is that the cause of poverty is complicated. That seems obvious, right? But yet, some reason it sometimes doesn't feel like it's obvious in the way policy gets written, because a lot of policies are very scalpel-like, saying we're going to give microcredit, we're going to give cash transfers, that's all we're going to do. We're going to give training, that's all we're going to do. We're a training program. And the basic idea behind this set of programs is that if the problem is multifaceted, maybe the solution needs to be multifaceted too. If you give an entrepreneur money without training, then maybe the money does not get invested well. Maybe it doesn't even get invested at all because they don't have the confidence to invest it, and instead they consume it. So that's fine. I don't have a personally problem if it's just a cash transfer for consumption, but it's not hitting the goal of increasing income. And similarly, if you give someone training without money, they might say, well, that's great. What am I going to do with that information? If they have no resources, no access to capital, then that could be an exercise in frustration as well. So this is a program which does a series of things sorry, I realize you can't see that very well, but it's five different components, but there's really three that are the linchpin to talk about. There's a large asset transfer that usually is about $200 to $300 to $400 that in many cases is intended to be like the equivalent of 4 goats or the equivalent of startup capital to start a buy-sell operation. There's training in that, but there's also life coaching that in some cases, think of it like what I was referring to with cognitive behavioral therapy, where there's someone who goes to their house once a week, once a month, once every other month, programs differ in terms of how frequently, and provide basically life skills coaching, trying to help them solve problems that they're facing. That varies across sites, obviously, in terms of what that means and how that's done. And so these are implemented as this kind of coordinated program. There's also, in many cases, an underlying cash transfer program for food. We originally tested this in 8 sites. This was, and by we, this is a large collection of researchers in 2 different collections. There's one collection from Bangladesh, and then a different set of us that worked on the other 7, of which I'm a part of. The yellow stars were pooled all together as 6 sites and published in Science magazine about 6 years ago. Yemen was intended to be, but the civil war there prevented it from being published together. The thing that was striking is, I know many of you probably dealt with the problem of multiple hypothesis correction. What do you do when you're testing for 20 things and your theory doesn't cleanly say, well, the primary outcome is one thing, and then from that we expect some other things to happen? Right? Instead, you just say, well, no, we're really, this is multifaceted. We're expecting a lot of things to move, so we're going to test these 10 things or 20 things. And then you get like 2 to move. And then, you know, we all know enough instinctually to say, well, we probably shouldn't conclude from that, well, 1 out of 20 outcomes went up. So let's just write a paper and write a report and say, well, outcome number 3, that's where the magic happened. Instead, we might want to think, maybe there's some randomness and some noise to this process, and when only 1 out of 20 outcome gets better, then maybe that means this didn't actually work so well. And so we correct our hypothesis, we correct the, you know, our inference from that. We didn't have that problem. This is the first time I've had a project where we didn't have that problem, where every single thing we tested got, quote, better. We see, I'm sorry, I'm seeing now that you can't see on the left. Oh, that screen is somehow better. But consumption, these are all 2 and 3 years after the program, and these are standard deviation shifts. And the standard deviation shifts are all in the range of 0.15 to 0.3 standard deviation shifts, which is a very big move as a standard deviation shift for income, consumption, labor supply, mental health, physical health, female power in the household, political involvement. It had nothing to do with politics, but people felt more engaged to speak in a community meeting. So across the board, we saw these impacts and very much motivated a second wave of studies. So the newest one that is released is in Niger. This is a 4-country study, but we've just released the first one in Niger. With the other 3 countries are Burkina Faso, Senegal, and Mauritania. And this is built on top of an existing cash transfer program that the government was running, implemented by the government, and found to be cost-effective after 18 months. There was a really strong psychosocial component of this program, much stronger than the sites, the 6 sites that I just shared a moment ago with you. There was a film that was made that was intended to help build hope and aspirations and give people a sense of a role model and someone's path that they can relate to and say, I can do that. There was also an interesting aspect, there was a lot of interesting aspects from the qualitative work that was done prior to the design of the psychosocial component to help understand what are some of the issues to bring out. So I'll give you one example of one. Very traditional to respect your elder by following, and one of the ways of respecting an elder traditionally is to follow in their occupation. But a lot of times, as we're well aware, there's a lot of work that goes into trying to figure out how to help people choose more profitable occupations, right? And that goes at, that cuts against that instinct of that respect your elder and follow in their occupational choice and pick up what they do and continue. So one of the things that was taught that was discussed in this interactive film plus Q&A discussion was to say, identify things that your elders did where they adapted to the world around them, where they figured out how to improve, how to adapt what they were doing. And now show respect to your elders by similarly taking that philosophy and that value of adaptation and applying it to your life, right? And so that turns on its head this idea that, no, following their occupational choice is not necessarily the way to respect them. Following their instinct to adapt and maximize welfare for them and their household, that's the respect. Right? And that's a very different mindset, leads to a very different calculation where you're no longer kind of shackled into what may be not the optimal occupational choice for you. That's just one example. There was a lot that went into this four-month psychosocial program that was both about individual as well as community. So this was published in Nature in 2022. In each of these 4 countries, we have different researchers from the country, as well as from the World Bank, as well as us dorky academics from the United States, all pooling together, collaborating across the sites with people with special expertise in the country, as well as for the full set. So in this program, we have 3 treatment arms and a control. We have the full package. Then we also had individuals who got the full package but no capital. They didn't get the large cash transfer to help start a business. They got the psychosocial components and the savings group aspect and training. We had others that got the capital but not the psychosocial. So what do we find here? The control is white. It's on the left, if you can see it. It's a little shaded. It's a little hard to see, but it's the left bar. The blue is the full package, so that always performs the best, but you got to think about cost effectiveness, not just which gets the biggest bar, right? And so one of the striking things here is that the social, which does really well compared to control, there was no capital provided as part of this program. It was just training and psychosocial components and access, and then promotion of a savings group where the community came together and the women saved together. And even that created really noticeable changes in business revenue, food security, and consumption. I didn't include it here because of time, but mental health also went up a lot across all 3 of these treatment arms. When we provide the capital, we also see improvements in mental health. And obviously the full package, I shouldn't say it's obvious, this is when we did the research to find out, the full package does do the best in terms of creating the most benefit, but on a cost effectiveness perspective, does not. Okay, the third topic. These are briefer, and again, these are continued invitations. The invitation on that second one is that these are projects which are flourishing and now expanding to lots of different countries. And we are always excited and eager to have local input from local researchers with strong local contextual information, wanting to participate in these kinds of multi-site evaluations. So if it excites you, that kind of randomized control trial working on social protection, please reach out. We are working earnestly with the World Bank and others on more of these kinds of multi-site coordinations where there's customization to the country, to whatever the needs are and the realities are in that country, while at the same time paying attention to the multi-site aspects for some as much commonality as possible. Okay, third and fourth. So the third is an invitation to add something to our discussions and our papers. I wrote with Edward Ashiedu and Monica Lamon Kayafio from the University of Ghana a paper that we put out in PNAS about 1.5 years ago. And it was basically a call to our community to say, you know, there's a lot that we don't talk about that we're doing when it comes to the ethical conduct of field work and field research. And maybe we ought to write about it a little bit more in a structured appendix kind of way that's not too onerous to put together, but that helps establish some practices, some norms, answer some questions that may arise. One unfortunate reality, I think, that happens in our space as field researchers is that there's too much reliance on the IRB. It's not to say that we shouldn't rely on an IRB for what they do, but we shouldn't rely on them as the ethics guidepost, because the IRB only looks at the documents that are presented to them. They're not on the ground. So much of the ethics of fieldwork comes through the staff training, enumerator training. That's where, if there's going to be ethical transgressions, that's where it's going to happen. IRBs never see that. They don't observe that. They don't train. They don't have anything to do with that, really. So this is very important to us at Innovations for Poverty Action and the Jameel Poverty Action Lab, is that staff training of teaching enumerators how to be empathetic, how to read what's happening for someone, so that when you're conducting a survey, when you're inviting someone to participate in a program, you can actually genuinely feel comfortable that informed consent is real. They didn't just put their fingerprint on something, which is all the IRB is asking for. Right? And that's important, and that comes from staff training. That does not come from filing papers with some board that sits somewhere. So that's the first observation. The second observation is that more discussion of these issues would be very fruitful. They might improve management of ethics issues. They might improve adherence to standards. They might improve those standards. And they can also avoid misunderstandings that sometimes happens when people, when a paper is written in a kind of terse way, and sometimes it doesn't explain some of the ethics issues that underlie it because it's not the nature of a discipline to do that. But having a brief structured appendix that helps answer some of those questions, I think could go a long way, particularly as we as researchers are working with non-researchers or even just researchers in other disciplines that have different standards for what to report. And that can help create better lines of communication. So we're really excited by this, and if someone does choose to add this to a paper, by all means, please let us know, because we're trying to create some momentum, and so we want to be able to have a website where we list them and try to help promote papers that are doing that. The last thing, and here's just a list of the categories. I'll leave this up. I'm hoping the slides are made available to the audience, so I put this in here at the categories, but the paper is also available on our website. The last thing is also another invitation. This is very much in our pilot beta phase. One of the things that's striking, I'm a co-editor of Journal of Development Economics, and one of the things that's always very frustrating as an editor, because I realized it's frustrating as an author, is that a lot of times we're not able to provide the feedback that we'd like to be able to provide. It's just not part of the process, particularly when a paper is desk rejected. Then that's just not possible to do, really. And there's a lot of times that we're able to see a paper and think, you know, this might be a scholar who has, you know, we can see that there's interesting ideas that excite us, but that it's not put together, you know, proximate enough to get published. But that some feedback might be really helpful, and that the normal refereeing process does not actually really well suited for that. And if someone is a scholar in a setting where there's not a constant flow of research seminars and exposure to the style of writing and the style of putting papers together that leads to publications in the international journals, that it's a disadvantage. And so how can we try to do something about that? So we started this project at Northwestern called the Northwestern Feedback Project, and it's really simple. Submit a paper. We try to then pair the person up with a scholar who works in that area, who has expertise in that. And then rather than an anonymous referee report, we try to just set up a 30-minute, 1-hour Zoom where the person's read the paper and then have a discussion. And if it leads to multiple discussions, great. It could lead to collaboration, even better. But that's, you know, right now we're just trying to do that first step of getting people feedback on papers. Just to be clear, this is not it's not a on step to then getting published in JDE. Our link with JDE is simply that when a paper is rejected, they're told, hey, there's this thing over here at Northwestern. But it's not that that's an invitation to then go back and resubmit it to JDE. Just I want to be clear about that. As otherwise the lead editor would get mad at me. That's no official link in that way. But the hope is that it can help improve the paper, might inspire another paper that's different. And then that paper can get submitted to JDE. And so very much invite people to submit it. It's structured, it kind of looks like a website where you submit a journal paper because it's, you put up the paper and then we try to match you to a scholar. We don't always succeed. So apologies if you try and submit and do not get matched. But we're doing our best, and we're very much in pilot phase. So we want to hear feedback, actually, a lot. So if you go and you think it's not the right thing for you, but something close to it would be, email us, please, and tell us why. So we'd like to hear that. We're still figuring out how to do this. We've only done about a dozen so far. That's it. So we're still in a kind of learning phase. And I just. That was my last slide. I got the signal. There we go. Thank you, everybody.
Thank you so much, Professor Dean Curlin. I think it was so inspiring. I don't know, I was feeling like I need to go there and say, hey, how did you do this? We have many questions, I'm sure. We would like to, again, give a round of applause to Dean Curlin. IPA is doing really big difference in terms of understanding the data. We'd like to open up for questions. We can only take up to two to three questions. Please raise your hand if you have a question. To Dean Curlin. Yeah, we have one there. Constantine.
Thank you so much, Dean, for the presentation. I have a very simple question on the feedback project. In terms of the LMIC researchers that will be submitting, must it be university-based or NGO researchers and government researchers as well who periodically publish in academic journals? Are they also eligible to be matched?
Yes, although that's one of those things we're trying to figure out too. So we're happy to kind of push our comfort zone there. What we do want is that it is an academic exercise, right? So we don't want to do that, for instance, if the goal is to just put out a NGO report on something, then it's hard to know, but that's not, the mindset is about preparing it for publication in an international peer-reviewed economics journal. We could actually, just for the record, handle non-economics too if someone had. The intent of the project is to go beyond. In fact, the person at Northwestern who came to us and kind of inspired us to do this collaboratively is a physicist who works on the science of science. And so he's also looking to, once we figure out this pilot, he's looking to expand it into physics and chemistry and other fields. So, obviously that's less relevant here, but I'm guessing political science is not, I'm guessing public health is not. And so please don't see that as limited to economics. We're happy to, try to do that matching on anything. It is a requirement that we have had some submissions where it is collaborative with someone, the paper is co-authored with someone from a US university, and that is disqualifying. Because we feel like if that's the case, then that's maybe the kind of person we'd be pairing up with, and then we're not interested in subsidizing Stanford. We want to help researchers who don't have that link. Yes.
Oh, can I go quickly? Okay. So, Dean, thanks a lot for sharing about these panel data sets, and I'm wondering if you could. I'm over here.
Thank you. Okay. It's helpful to see. I realize I still can't see you because of the mask, but.
I'm here. It's me. Okay. Wondering if you had unlimited capacity, what are some projects that you would love to do with these panel data sets that you're creating that might give some of the folks in the audience ideas?
So one example right now is we are about to set up an experiment where we're handing out smartphones to I think about 2/3 of the sample, and so then with a smartphone comes the opportunity to provide apps, or even just text messages that include links to videos or links to something that you can't get with a feature phone, right? So if someone has an idea of something that they would like to see rolled out in that kind of representative way with lots of rich information of who people are and information that goes back 10 years about their history and life that might lead to some important hypotheses or even more targeted messaging in some way, that's a perfect example of something that if you propose something like that, I think there's a decent chance that we could make that work. I mean, we obviously need to hear the details, but that's a channel that where the implementation can easily be rolled out on top of what we're doing.
Thank you, Dean, for the interesting presentation. My question is related to the FORCE project, the Northwestern Feedback Project. And my question is just on the feasibility of this project, because this project may be somehow just demanding in terms of resource and also logistics. Like, for example, unlike the journals, which have also some sort of incentives to do the reviews, all this kind of stuff, because you may pay just a kind of publication fee. So my question is just, do you think that this would be feasible, particularly in terms of resource and also logistics?
So I want to make sure I understand. By resource, what you mean is, will we get referees, basically, to agree to do this? Will they say no?
Exactly, just the referees and all.
So far,
and also just the selection criteria. Who is going to just to apply just to get a feedback from this project? Thank you.
So, I mean, you're asking exactly the right question, and this is why we're piloting it, and this is why when we say we're getting feedback on our feedback, we're getting that both from the scholar who wrote the paper as well as debriefing with the referee. Or referee is the wrong term, but the person who is giving the feedback, and we're getting feedback from them to find out what was this process like, how can we make this smoother. So far, we're getting decent response, though. And actually, I would say the proportion of yeses actually has been higher than the proportion of yeses I get as an editor of JDE asking for a referee report. I think there's something about the, there's actually a reward. You do a referee report, and you don't get. It's actually less rewarding, I think, as a scholar. I would say it would be less rewarding to write a referee report than it is to give feedback directly to someone where you're interacting, you're engaging, and you feel like you're actually helping more. Whereas a referee report, you feel like you're helping the journal maybe, or something. So for what it's worth, it's a small sample, but we're having a higher hit rate. Not to say it's 100%. We've had people that never respond to our email. So I don't know. But I'm optimistic. This is an issue which is important to a lot of people too, about how to extend networks, how to expand access, how to make it so that research is not is more egalitarian. And this is an issue that a lot of people are thinking about, and and those people will participate. The people who don't care about them, well, screw them. They won't participate. But no.
Thank you so much, Professor Dan Carlin. I think we have many questions here. Please catch him during coffee break and ask all the questions that you want, and grab his business cards for follow-up on those calls. Thank you so much.
Thank you, everybody.
Thank you so much. Our next presenter is Dr. Sam Oti, who is a NEAR member as well as a SIGA researcher. Sam we met also at Berkeley a long time ago, 5 years, 10 years. And he's now working at DRC. And he's also a friend, a mentor for many of us. Sam, the floor is yours.
Thank you, Janine, and good morning, everyone. My name is Sam. Can you hear me okay? Yes, and I'm the Secretary General for NIERA, and I'll be telling you a little bit more about NIERA in a little bit. As Janine said, I also work as a senior program specialist with Canada's International Development Research Center, and we are a funding agency. And so when Tony was talking very badly about funders yesterday, I marked his face. So wherever he is, no more funding for me. Obviously, I'm kidding. Tony is a very good friend. And I endorse what he said yesterday. Blank checks for everyone. Can I get an amen? Yes, and another fun fact about me is that I'm absolutely shameless. So I'm going to self-promote myself. I host and I'm the creator and host of a podcast on digital health and health technology innovations across Africa. And so, yes, so I talk about digital health. I interview innovators in the digital health and health technology space. So feel free to go to Spotify, Google Podcasts, and subscribe. I'm absolutely shameless, so I have no issues with self-promoting myself. Another fun fact, and you're going to hear quite a number of them, is that in 2013, that was when I completed my East Fellowship. And at the same time, in that same year, the government of Kenya introduced a program, or a new policy, and it's what they call at the time the laptop project. I think nowadays they call it the digital learning project. And look, I'm not Kenyan, but I've lived in Kenya for 14 years, and I don't want to get deported. So I'm not trying to say anything bad about this initiative. But at the time, the idea, I think it was very well intended. The idea was to distribute laptops to students in first year of primary school. And that was all about digitizing and transforming the educational system in Kenya. And that was back in 2013. Fast forward to 2022, and we're still not sure if that project worked and how it worked out. Again, lots of issues with procurement, corruption, et cetera, et cetera. And so on one hand, we have the government saying that the project was a great success, but you also have stakeholders like the Kenya National Union of Teachers saying that it was a scam. And like I said, I don't want to get deported, so I'm not here to pass judgment on that project. But as an impact evaluation scholar, I feel like it was a lost opportunity. I feel like this particular initiative was a missed opportunity for us, for the Kenyan government, and for researchers like myself to demonstrate the power of impact evaluation in informing policies and informing programs. And I'm sure this is not unique to Kenya. I'm sure in your individual countries, there's so many missed opportunities where policymakers have good intentions, but that intention is not often informed by rigorous evidence. And so this is where NIERA really comes in. And we did a needs assessment. And bear with me, I'm going to tell you a little bit more about NIERA shortly. And we did a needs assessment a few years ago, and where we found that indeed there is a strong demand among policymakers and decision makers for rigorous evidence, for impact evaluation. Of course, we found that there was some misunderstanding in terms of what the concept of impact evaluation was. People tended to think it was confuse it with monitoring and evaluation. But once they grasped the concept, they really liked it, and they really wanted more of it. And so that is where this concept of decision-focused evaluation comes in. And it's not a concept that is original to NIERA or original to me. In fact, there was a paper published by 3IE where this idea of decision-focused evaluations, I think I came across it for the first time. And the key differentiator about this kind of evaluations is the originator of the evaluation. And the key differentiator is that the originator of this evaluation is the user, the end user, right? So you can contrast that to knowledge-focused evaluations, where researchers like myself, we come up with an idea and we go to the government and we present, our findings, and hopefully, that could influence policy, right? Versus when, let's say, in the particular case of the laptops, the Ministry of Education says, you know what, the government has committed 5 billion shillings to this initiative, but why don't we commission an impact evaluation first, see how that goes, and then that can inform how we scale up this laptop project. So decision-focused evaluations is basically the hill that we as NIERA are willing to die on, because we believe that it is very important to have that demand, that demand comes and originates from the end users of impact evaluation. And as a funder, I can tell you for free, when people come to us, the typical practice is to bring a proposal and send in a letter of support. And we know these tricks. Anybody can get a letter of support. If you have a guy in the Ministry of Health, you can get a letter of support. It's not hard, but it doesn't really speak well about the ownership. It's not a good indicator of the ownership of that particular project or that particular initiative. But if you have a situation where the government says, you know what, we are setting aside this amount of money for this particular initiative, but we want it to be informed by evidence, that is a stronger sell to me as a funder. And so for us as NIERA, this is the hill that we are willing to die on. So a little bit about NIERA, another fun fact, and you'll get tired of those, is that in 2014, right here in this city, in Kigali, 3 East fellows at the time, we had completed our fellowships, myself, Tony Mveyange, who was on the panel yesterday, and Prof. Amos Juguna, we sat together and talked about this idea of bringing together a network of impact evaluation researchers across the continent, beginning with those of us who had graduated through the amazing program, East Fellowship Program at SIGA. And we kept talking about it, kept sharing our ideas with our contacts, and around 2017, 2018, we got funding from the Hewlett Foundation to launch this network. And maybe by show of hands, if you're a member of NIERA, please just raise your hand so we can see the strength and power of NIERA. Right, so I think we are 30 plus strong now and growing. East is still active, and so that continues to supply us with new members. The secretariat is based at the United States International University in Kenya. Prof. Amos Juguna is he is the chairperson. I am the Secretary General. Jennifer, are you here? She is the program manager over there. And we have Christina from Tanzania, who is our treasurer. Christina, are you here? And we have Anne Minor, who is our program assistant. Anne, are you here? Yes, so we have a very strong team, and we continue to grow as a network. And our mission is really about advancing the use of impact evaluation in informing development, in informing policy, in informing practice. And I know you probably can't see this, but bear with me. This is our theory of change. And at the core of our theory of change is that we want decision-focused evaluations to inform practice and to inform policy. And we have 3 pillars around that: capacity building, policy outreach, and evidence generation. And since we launched in 2018, we focused largely, tactically, on capacity building, right? Because we felt we needed to have that critical mass of people, not just practitioners like ourselves, but policymakers, media practitioners, other funders like myself, who really understand and appreciate this framing of decision-focused evaluation. As we've been doing policy outreach, we've developed curricula, we've developed training content. We even have a partnership with Utrecht University in the Netherlands, where we've developed curricula for several tertiary universities across Eastern Africa on decision-focused evaluations. And so we've been doing a lot of building that capacity and laying that groundwork for building this critical mass of people who understand and know how to do decision-focused evaluations. But one thing we've not done well quite yet, and again, it was just about us being strategic, is generating evidence. And this is where the initiative that I want to present to you comes in. It's called the Demand-Driven Research Initiative. And again, with generous support from the Hewlett Foundation, the goal, like I said, is all about stimulating that demand and generating research projects that respond to very clear demands in different domains. We are a multidisciplinary network. We have people in public health, gender, agriculture, education, et cetera, et cetera. And again, the objectives are pretty straightforward. We want to implement rigorous decision-focused evaluation projects. We want to create greater understanding and awareness. We want to communicate our results with policymakers and other stakeholders. And obviously, we want to advance our credentials as the partner of choice when it comes to decision-focused evaluation. And like Dean said a lot of times, this is also an invitation that we're looking for partners to work with us on advancing this field and this idea and framing of decision-focused evaluations across Africa. And the approach is pretty straightforward, right? The approach is oh, I see. Got it. So the idea is pretty straightforward, right? We initially we are launching a call for proposals for among our members to come up with ideas, DFE research ideas that respond to very clear demand opportunities. There's going to be peer-to-peer learning among the different cohorts of research projects that we support. There's going to be roundtable and policy conversations. And then, like I said, it's not just about the funding that we have from Hewlett. We are really keen on working with other partners to develop ideas on decision-focused evaluation projects. So where are we at? We launched a call for concept notes in early this year. There were 6 applications that were received, and they have been externally reviewed. And now we've invited 4 applicants to send 4 full proposals towards the end of August. And at the end of the day, we hope to fund 3 DFE projects. The country of focus will be Ethiopia, Tanzania, Uganda, Rwanda, and Kenya. And the themes will be on livelihoods, finance, public health, gender, and youth. Ideally, I would have liked to have a situation where the 3 projects that are awarded give lightning talks, just like the one my good friend Sam gave yesterday. But because we are still in the process of identifying these projects, I don't think I can give too much away. Otherwise, the person that doesn't get the grant might feel bad. And I'm a very kind person, as you can tell. Yeah, so essentially that's it, right? This is NIERA, and again, I want to emphasize, it's an invitation. We are looking for collaborators. We really want to move this field of decision-focused evaluations forward. So I am available, and members of the network are available for you to reach out and collaborate. So thank you very much.
Thank you, Dr. Sam. Thank you for the introduction of NIERA and the good work that we are doing. I was going to say you are doing. We allow to have 1 or 2 questions. If you have any question, please raise your hand. I'll pass on the mic. That means that we are all going to be part of NIERA if we don't have any question. All right. No more questions? So that was clear. Thank you so much, Dr. Sam, for NIERA. So now we are going to go for coffee break, 20-minute coffee break. And then after the 20 minutes, please be aware of the parallel sessions that Amy is going to introduce.
Thank you so much, Janine, and thank you, Dr. Sam. There will be 2 parallel sessions after the coffee break, or 1 parallel session with 2 rooms, rather. So one of them will be here, and that's on gender and development. Our MC will be the wonderful Jennifer Anira. And then we'll be downstairs where we had lunch, and there's a smaller room, and that will be MC'd by Constantine Manda, and that will be about political economy and labor. So please just take 20 minutes for coffee and then head out back. Thank you.
Just. Hello, everyone. I think we could start. Those who are outside, please, we'd like to start. My name is Jennifer Nyakinya. I manage the network of impact evaluation researchers in Africa that my colleagues have talked about since yesterday and today morning. So welcome back to this next session. I'd like to encourage people to occupy seats at the front, or if you have a bag, maybe probably put it somewhere down so that those coming in can get a space to sit. We'll be having 2 sessions, gender and development, and one on political economy and labor that will be moderated by Constantine. So that gender and development will be here. So those who are interested in that can remain in this space. And the other session will be on the first floor. Yes, Amy?
Yes,
downstairs.
Yes.
So I can give people time to decide where they want to go. You can go downstairs for the session on political economy and labor. And the gender, those interested in gender and development can stay here. Maybe in 2-3 minutes we can move. Political economy and labor, you get to hear from Dagim, an RCT in Ethiopia. You get to hear also from Good Work in Nigeria, Uganda, and Burundi. Or you might as well stay here. But I'd encourage those who want to listen to that, you can go, you can move now so that we can start. Okay. So I'm excited to lead this session. Each of our presenters will be given 15 minutes to present and then 5 minutes to engage them in question and answers. I would like to first introduce a very good friend of mine and NIARA member East Fellow, Muthoni Ng'ang'a. She's an assistant professor at Wilfrid Laurier University, and she's sharing her research on interventions to increase agricultural technology adoption by women in Kenya. Welcome.
Thank you, Jennifer. Thanks, everyone, for being here. I hope I'm loud enough. Great. Great. Thank you. Yep. So my name is Muthoni, and this is a pilot project, or some results from a pilot project that I've been doing with Ethan Ligon from UC Berkeley, and then Kali from IFPRI. And when you talk about the technology here, it's modern cassava technology, and I'm just mentioning this so that I can say that we are doing this with Focus on Cassava, who is our implementing partner in the country. And the lead, or the person who came up with this idea, Focus on Cassava, is Michael Murigi, who is also in the room, and he's also an economist. So I just want to recognize that he's here as well. Great. So just like in many developing countries, agriculture is a key sector in our economy, and that is Kenya. And despite the fact that we rely a lot on agriculture, we still observe slow growth in the sector, and part of the reason is because we have lower adoption of technology, and specifically we see many differences in terms of technology adoption levels between female farmers and male farmers, and female farmers tend to lag behind in terms of technology adoption. There are many reasons as to why we have low levels of technology adoption. This includes risk aversion, distance from markets, and so on. But we focus on 2 key barriers of technology adoption, and that is access to seeds, or lack of access to seeds, and lack of access to information about the existing technologies or the seeds. Now, just like I've said, there are differences in technology adoption rates between male and female farmers. But apart from this, we see that extension workers in our countries, they're never enough. So, like I think I had seen from the latest information that I'd read, we have a ratio of 1 to one extension worker to about 1,800, farmers. And then these extension workers, most of the times, they tend to be male and educated. And so mostly, if they go to communicate with farmers, they'll be communicating with male farmers who are also educated. Now, we see in a lot of literature that people tend to communicate or to speak to people who are like them. And for example, in education literature, we see that when female teachers teach girls, there's improved performance of girls without sometimes necessarily hurting the performance of boys, and also female patients wanting to communicate more with female doctors and so on. Well, obviously this is not universal in all the sectors, but this is where we are coming from, or just being part of our motivation, that what if we train lead farmers? And when you talk of lead farmers, we are saying, if we don't have enough extension workers, can we train a few farmers who we are calling lead farmers, and then we train these female farmers who will then reach to local farmers or to other farmers, and that means that more female farmers will be reached. Now, the research questions that we are looking at is, one, what is the impact of matching female lead farmers with female local farmers on technology adoption? And also looking at if we improve seed delivery, or we make seeds accessible to female farmers, will they adopt technologies more? Because we're hypothesizing that part of the reason could be that they do not access these seeds. Now, in terms of context, where we did this, and we did this in Kenya, like I've said earlier, and in a county called Murang'a County, and the eastern part of Murang'a, it tends to be semi-arid, and because of that, because they don't receive enough rainfall, then we realized that these modern variety cassava seeds could be a good alternative for farmers, or in fact for the community, because they're drought resistant, and they're also safer in terms of consumption as compared to the traditional cassava. And as compared to the traditional cassava, the modern variety cassava also takes a lower or a less, they have a lower maturity period. So 8 months as compared to 1 year. So this would be a good alternative to farmers. Now, what happens here in this county is that the county government here is collaborating with Focus on Cassava, who is our implementing partner, and with the Kenya Agricultural and Livestock Research Organization to propagate cassava, which then they want to ensure that, or at least they want to improve, the adoption, or to increase the adoption of cassava in this area. And like I've said, it provides a good alternative in terms of, what food can be produced in this area, because maize is not doing very well, because maize is not drought resistant. Now, the research strategy, like I had said earlier, I think I had mentioned that this is just a pilot, and maybe I should also have mentioned that it's funded by SIGA, and so we're just testing the viability of treatment interventions, or of our intervention or the experiment, so that we can see whether they're as effective as we'd want them to be in the context, and also to answer the research questions that we have. If we get funding for a scaled up project, then we'd know, okay, what worked and what did not work in the pilot project. So the treatments that we had here, we had local farmers electing or voting for, or choosing lead farmers who are female farmers, or at least, like I'm going to explain the design in the next slide, and then having these lead farmers deliver extension type services and specifically training to the local farmers, and then having the lead farmers also deliver the seeds to the farmers, either at their homes, or for some of the groups, or for some of the villages, then the farmers would, or had to pick the seeds from the lead farmers' houses. Now, we piloted in 6 villages, and we piloted the 3 things here that I had mentioned in the previous slide, and that is voting, training, and seed delivery. So in some of the villages, we had the lead farmers being voted for using secret ballot, and some of the villages they used acclamation. And then for the training, we instructed the lead farmers that once they received the training from Focus on Cassava, who is our implementing partner, then they would have to train the farmers either in their houses, that is a trainee's house, or in the lead farmer's house. And then again, for seed delivery, we instructed the lead farmers to either deliver the seeds in the trainee's house, that is the local farmer's house, or we told the lead farmer to instruct the farmer to get the seeds from their own houses. Oh yeah, sorry. And for training, they were to train the farmers either in the trainee's house or in any other place. So that is the NR. There was no restriction as to where they were supposed to give the training, either in their own houses or maybe just in a local area and so on. And the target here is female farmers. So even in the voting, when we had because for each of the village, we had a separate meeting. So when they were selecting the lead farmers, we told them that we are targeting female lead farmers, and each of the village was to select or to choose 2 lead farmers, and the instructions were at least one of the lead farmers should be a female lead farmer, and then the other one could be male, and there was, if they wanted to elect 2 female farmers, then that was fine. And we observed that in 3 of the villages, they chose 2 female farmers, and then in the other 3, they chose 1 male and 1 female lead farmer. Okay, so this is just very recent. So we were in the field in March and April of this year. So what we are just presenting are just the very initial results from what we have seen from the pilot results or from the pilot study. Okay. So what did we seek to learn from the pilot? One is whether the voting methods that we are suggesting are acceptable, because we could tell farmers maybe to elect them using secret ballot and probably they wouldn't, or either acclamation and probably they wouldn't, or they wouldn't maybe prefer either of the method. And then whether we also wanted to check, will the lead farmers actually provide the extension? Because this is a project where we are relying on lead farmers for the implementation. So we are not implementing the project fully, because we are training the lead farmers, or at least focus on cassava, train the lead farmers, and then we rely on the lead farmers to provide the extension to the other farmers. So the question we wanted to answer here is, will the lead farmers actually provide the extension once they're trained by Focus on Cassava? And then, like I said, it's just to check whether the experiment or the treatments that we are suggesting would be as effective as possible in a scaled up version of this project when we get funding for the same. And then also to check whether farmers are interested in planting or in growing this modern variety, cassava. So I'll give a highlight of the findings. So in the area, we have smallholder farmers. And that means, and even our data shows, that on average, each household holds about 1 acre of land, and most of the households have have 1 plot, and not just 10% of the households had 2 plots. And then in terms of technology adoption, all the farmers reported that they have used fertilizer on their plots. Well, of course, we didn't ask, or we don't know whether this fertilizer is enough, or maybe less, or maybe more than they should be using. In terms of use of hybrid seeds, again, we observe maybe like we had expected that, male farmers tend to, the technology adoption rate by male farmers is higher than that of female farmers. So 100% of all the plots controlled by male farmers, they had used hybrid seeds in the last, I think we asked 2 seasons, and then only 86, or at least lower, adoption by female farmers. Oops, sorry. In terms of voting, all the farmers reported that they were comfortable with our voting methods. And, oops, sorry about that. Oops, what am I doing? Sorry. Okay. All the farmers reported that they were comfortable with our voting methods. Like I had mentioned earlier, they were comfortable also voting for female farmers. And in terms of training, one of the key findings that we find is that male extension agents are less likely to speak to female farmers. So the instructions were, when you go to the households or when you call farmers for training, then because in each village we had about 20 households, we had suggested that if possible, between the 2 lead farmers, you can divide the households, and one will go to 10 and the other one will go to 10, but again, they had the freedom even to go together. So what we found is that in 54% of the cases, male lead farmers talked to female lead farmers. But the female farmers, or the female local farmers, reported that they spoke to a female lead farmer in 95% of the cases. So just to summarize that, we're seeing that male extension agents are less likely to train female farmers as compared to female extension agents. Okay. And then just to mention there, we found that in some of the cases, the farmers, the lead farmers, called the farmers for training in groups, so especially in cases where there was no restriction as to where they should train them. Then seed delivery, one of the key findings is that we've found that it's not possible or it's not feasible to separate locations for training and seed delivery, because we had piloted. What if we are telling a lead farmer, you can train at home, but you deliver, but then the local farmer can pick the seeds from another location. But in almost all the cases, we saw that the lead farmer, where they trained, is where they also asked the farmer to pick the seeds from. So in a scaled-up project, we'll probably not be separating the two. That is training and seed delivery in terms of location. Then the farmers also gave recommendations as to what they would expect to see in the training, and those are just some of the things that they want to know about cassava, how to grow cassava, the benefits, where they can market, and so on, and how safe it is to consume cassava. Because I think for the traditional cassava, if I'm not wrong, some of the farmers tend to say that traditional cassava may not be very safe in terms of consumption, but this is not the case for the modern varieties. So summarizing some very important issues or some things that we learn from the pilot study, male extension agents are less likely to train female local farmers. Voting, all the farmers thought that, or said that they were okay with our voting methods, although we had some farmers suggest that they prefer secret ballot as a way of voting for the lead farmers. And then, like I said earlier, that it's not feasible to separate the locations for training or for the extension and the location for seed delivery. And then we have an indication that we can actually increase information diffusion to local farmers, or to specifically female local farmers, by training female lead farmers. And then all the farmers said that they were eager to plant cassava, both for consumption and also for selling. Thank you very much.
Thank you. We'll take 3 questions. There are some questions here.
All right, so thank you so much for the presentation. I had a question on the theory of change for picking up the seeds. And I wouldn't have, like, if you don't have a very strong theory of change, picking up the seeds from a farmer's house vis-a-vis somewhere else in the community shouldn't make a difference. So that treatment arm was kind of too much when you are testing it. On the female, I think I missed the treatment, is exactly comparing it to the control. What is the control here? Is it a natural group that existed that had its own leaders? Or I think that bit wasn't so clear what the control was. Because then you are talking about male leaders or extension officers training more male extension officers. That story, I wasn't sure. Thanks.
We can take one more.
Thank you for the presentation. It was really very interesting. My question is around in training and distribution of labor when farming. So you say that there are female leaders who are now training female farmers, but then in a household setting, when there is a spouse, there's a spouse and a husband and a wife, who is doing what when it comes to cassava farming, and this training for the female farmers affect all aspects of farming when it comes to. That's, I think, in summary, my questions on distribution of labor.
Okay, you can respond to those, then we can take.
Okay, I'm not sure I got the very last question, but I will attempt to say something, but I'm not sure I got it. In terms of the theory of change, and I think the question there was, what's the whole idea about the separation in terms of picking of seeds and delivery or otherwise, and the whole idea here was to evaluate whether there could be a difference in terms of costs, because it's remember we're looking at just at 2 things, that is female lead farmer to female local farmers, And then the other thing is to reduce the difficulty when it comes to accessing the seeds. Because we're hypothesizing that part of the reason that female farmers do not adopt technology is because they can't access these seeds. So if we reduce the costs, and reducing the cost means that instead of the female farmer, instead of the farmer going to collect the seeds from somewhere, what if you deliver the seeds to them? Yeah. I hope. Oh, okay. So these seeds, what happens is that Focus on Cassava, our implementing partner, they grow them somewhere, and this place where if you need to go pick, it depends on where you're coming from as a farmer. So some farmers are near the farm where Focus on Cassava is growing the cassava, and some farmers could be far. So delivering the seeds to the farmers could be a way of reducing the, would you say, the access costs? But of course, I mean, I get your point. If the lead farmer is within your village, then whether I deliver to you or you pick from my house as a lead farmer, the cost may not be much. But I mean, I get the point. So we should probably be experimenting with picking from the main farm or delivering to the farmer. So I get that. I get that. Thanks a lot. Oh yeah, I think I had something about the control group. I mean, we don't have a control group because all we were doing is looking at whether our suggested experiment or treatments would be feasible in the context. So we are not really doing any impact evaluation at this point. Yeah.
Thank you. Can we have from this side? There's a question at the back.
Thank you very much. So, quick one. It's very well known that the smallholder farmers, this is pretty much work that I've also done, that the part of the farm is for income production, and then the smaller part, which is run by the women, is for home production. I didn't see that factored in sort of some of the perspectives, because if it's for production and for sale, they will naturally adopt technologies that are high yielding vis-a-vis the home production ones, which are, maybe you're looking at the cassava quality for the type of flour that is traditionally liked, and things like these. So I missed some of that, but really good work. Thank you very much.
Is there another one so that you can? Okay, don't think there is. Oh, there's the last one, please. Then you can respond to both.
I forgot my question, sorry.
Oh, okay. Oh, it's fine.
Thank you. So mine is, most of these modern technologies, they tend to, farmers tend to adopt at earlier stage, but in a long run, they drop out. So you might test some sort of positive acceptability in terms of access and what you are trying to find out, but for long run, you might find there is a drop. So in your attempt to scale up the pilot, I think you need to look at long run period than what you are suggesting.
Okay. Thanks a lot for the questions, and I apologize if I don't answer your questions, and especially the question that came from there because I didn't get it, but I'm okay to speak about it during lunch or during break, and any other question that I may not address fully. And I get a question on long run, and it's just a pity that it's not possible for probably Michael to speak now, but I mean, he's been working on the project for long in terms of, propagating cassava in the area, and, just getting, anecdotal evidence in terms of, the benefits that are coming from, growing this cassava in the area. But I agree with you, it's something that we probably want to look at. And again, if we have a long time to implement the project, would probably be measuring more outcomes that would then be informing the county government as well as our implementing partner and so on. And I think there was a question on production and consumption. And again, I may not answer this fully, but I'm okay to discuss it. And it's true, like the farmers say, that they're looking forward in terms of growing this cassava for both consumption and production. And maybe some of the information that we didn't have on the slides is how the implementing partner then helps the farmers in terms of once they have excess harvest, what they cannot consume, they take it up in terms of helping them to market and also to produce, I think, flour. I think you mentioned something like that. But again, if I'm not addressing fully what you mentioned there, I'm okay to discuss it. And thank you so much for your feedback and your questions, and also for listening.
Thank you so much, Muthoni. Can we clap for her, please? I'd like to invite Baba, a senior research fellow with the International Food Policy Research Institute. Today, she will discuss her work on gender norms and digital finance. Welcome.
Yeah, good morning, everyone, and thanks so much for the invitation to present here. I will be, once I have my slides up, there they are, I'll be talking about two strands of work. The first one was a formative evaluation that was funded by SIGA's Digital Credit Observatory, but that was work in India, and since this is the Africa Evidence Summit, I'll also be talking a little bit about work that we are currently doing around gender and digital insurance in Kenya. So the work that we are doing in both India and Kenya is really motivated by the theory that we can unlock investments in smallholder agriculture by removing credit constraints and reducing risk that smallholder farmers are facing because they are lacking access to formal credit and formal insurance. And one of the reasons for why access to credit and insurance is so low in smallholder settings is because transaction costs are high, and it's very difficult to screen and monitor smallholder farmers in the presence of asymmetric information. The innovation here that we're looking at and where digital technologies can really come in is that they improve the observability of smallholder farmers at lower cost. So you can imagine that with, for instance, satellite remote sensing or through smartphone images, digital technologies in that way are opening up new ways to observe smallholder farmer agriculture, to observe plots, to see whether farmers are using good practices, and to monitor them and see, okay, are these farmers able to repay their loans? In case that they submit insurance claims, are these insurance claims valid? Digital technologies just really reduce the cost of monitoring and observing the outcomes at the farm level. So that is really motivating broadly the work that we're doing in both India and Kenya, and also we're starting work around this in Ethiopia in the near future. But if we're thinking about the implications of these digital technologies for gender, we're not sure if this is going to be empowering for women and increasing their access to credit insurance, or if it might actually, because of existing digital divides, worsen the problem and worsen existing gender gaps in access to credit and insurance. So on the one hand, we're thinking it could be empowering because women particularly are subject to this, what we call a thin file, that there is very little data available. They might not be registered with the formal credit bureaus because they haven't had access to formal credit in the past. And so those data limitations might be particularly constraining for women farmers. At the same time, it could also be disempowering and reducing women's access to credit if things are moving more towards digital technologies, if they are not the ones who maybe are in the household owning a smartphone, or if technology concepts are less familiar to women as opposed to men. And so there might be sort of a a lower willingness to pay or a lower interest among women for these kind of tech-savvy types of products. And also, one thing to worry about is that prevailing gender norms might actually inhibit women's ability to access these types of products, regardless of whether they're digital or not, but that agriculture is often stereotypically seen as a male activity, and it's men who should be taking out loans and men who should be taking out insurance. So those were some of the considerations that have been going in and motivating our research in both India and Kenya. So let me first talk about the work that we're doing in India. This was a formative evaluation of digital credit and really particularly looking at those questions around gender and if we're digitizing these products, how is that influencing women's versus men's access and ability to take out these credit products if we're digitizing the screening and monitoring of loans for smallholder farmers. And we're looking at a state called Odisha in India. It's one of the poorest states in India where smartphone ownership is not very high. Technology penetration is not that high. And so this was really a novel thing to start digitizing these loans in an agricultural setting in Odisha. We're working with an organization that is using satellite imagery and smartphone pictures to then digitize the credit scoring and the monitoring of loans. So they're using satellite imagery, for instance, to look at how did a plot for which a farmer is requesting credit, what were the yields in the past, using satellite imagery to get proxies for that, also using smartphone images taken at the time of the season itself to monitor how a crop is growing and seeing, okay, you know, is this farmer able to repay loans? So really that monitoring was in place using digital technologies. And then in addition, when farmers were facing financial hardship, there was an insurance product combined with the loans so that if in the smartphone images it turned out that a farmer wasn't able to repay the loan, that insurance payouts could be triggered that would allow the farmer to repay the loan without having to dig deep into their pockets if they actually have just lost their harvest. So that was a little bit of the context of the evaluation. And then we asked two questions. First of all, through which channels could this type of digitization increase access to credit for men versus women smallholder farmers? And also, second of all, we were interested in can we increase demand for these credit products, knowing that there were probably going to be gender stereotypes and gender norms going to make it difficult for women taking out loans? Can we do gender sensitization using digital tools to increase women's demand for these digital credit products? And so a little bit more about the context. We did this in the context of a survey with 3,500-ish men and women from 58 villages in the state of Odisha. As I mentioned, this agriculture credit, or at least technology penetration is low. And we often see in Odisha that also formal agricultural credit is often inaccessible because the formal financial institutions require farmers to show up with their land documents. And a lot of farmers, and especially women in Odisha, they actually don't have land documents themselves. They're often sharecroppers. So it's very difficult for them to access formal agricultural loans. And the main form of financing for them of their agriculture is actually through microfinance. And so with that, we were working with a partner called Dvara e-Registry, which was able to overcome that challenge of having farmers requiring them to show land documents by using the technology, using satellite imagery and using smartphone images that were geo-referenced for plots where farmers said, okay, for this plot I would like to take out a loan. So that's a little bit of background on the study. Now, before introducing this loan product, we did that survey with 3,500 farmers, and I'll share some findings from that because that was part of the formative evaluation. So a first finding that we see in that survey was that on existing loans, and often these are microfinance loans, so not the loans that Dvara e-Registry is offering, we often saw that although women had loans in their names, and often loans being used for agriculture, they actually didn't have a final say in whether that loan was taken out. So on the left in this figure, you see that, the black bars is the proportion of men who had the final say in taking out a loan, and all the way on the left we see agriculture. The gray bars are the proportion of women who had a final say in taking out a loan, and we see that there's a really striking gender gap there, especially for agriculture all the way on the left. Now if we look at the 3 bars on the right, that is a variable that is measuring the proportion of respondents who have a loan in their name. And we actually see that there's actually more women than men having loans in their name, and especially for agriculture, where the least women had a say in taking out the loan, we actually see that that's an area for which most women have actually, agriculture is where they didn't have the final say in taking out the loan, but we see that for agriculture is actually the area where the gender gap is largest in terms of women being more likely to have a loan in their name than men. So whereas we see a gender gap, kind of women less likely to have a final say in agricultural loans, they are more likely to have agricultural loans in their name. And this is really kind of in a way coming from those microfinance loans that are requiring women to be part of microfinance groups. So it's women taking out loans. And it was just really striking to us that even though these loans are taken out for agriculture, women actually don't really have a final say on whether those loans are taken out. It's almost like, okay, you're the woman, so you sign up for the microfinance group and take out a loan. And so with that, we were wondering, do women actually want these loans? And oh, I got the 15-minute mark, but now it's all of a sudden 5 minutes. So women who did not borrow in the preceding season, the season preceding the survey, they often said that they didn't need that loan, whereas men attributed not borrowing for very different reasons. For instance, the terms of the loan, interest rates, things like that. And also when we look at interest in loans for the next season, we see that women were interested in significantly smaller loans than men, and this was a difference of 4,000 rupees, or about $50. Then we explained the product that the Dvara e-registry was going to be offering. And we actually see that the introduction of digital technologies for the screening and monitoring of loans was crowding in women's demand for these loans. So women stated that if digital technologies were being introduced, that they would be interested in significantly larger loans than what men were interested in. So we thought that was a really interesting finding, and alluding to that question on does digitization increase or constrain access to credit for women, we actually see that digitization could make these loans more interesting for women, maybe because they don't have to worry about access to those land documents anymore that were previously constraining their access to formal credit. So we also did an RCT in which we tested gender sensitization through digital videos that microfinance agents were showing at the time of group meetings. And there, these were aspirational videos that we were hoping would debunk existing gender norms and could increase demand for credit. Now we find very mixed effects, and overall, the gender sensitization didn't really have an impact. Since I went from 15 to 55 minutes, let me skip the rest of this slide. But so a recap is overall what we find improving access to digital credit doesn't seem sufficient, because in the Odisha context, a lot of women didn't actually seem interested in existing loans because they could borrow through the microfinance institution, and the problem was often they actually didn't have a final say in the decision to take out those loans. And it seems that more is needed, and maybe more gender transformative programming that really helps empower women to have a stronger say in how those loans are used, and that in turn could potentially increase demand for credit, but that is something that needs to be studied in the longer term. So now let me move to a little bit of our work in Kenya, and I'll be talking about kind of 3 areas of work in which we could think that digital finance, and in Kenya we're working on insurance specifically, so 3 channels through which that can impact women. A first pillar is, or a first area, is to make sure that programs are gender inclusive and that they reach women and men alike. Then we want to see if insurance programs are gender responsive in the sense that they have been designed such that they benefit women and men alike. And then finally, are they transformative in the sense that they actually change decision-making norms within the household and might actually empower women. So first talking about reach. What we're doing in work in Kenya, where we're actually, the digital insurance product uses smartphone pictures, just like in India, using smartphone pictures to settle claims. We call it picture-based insurance. Now, a big constraint here is that you need to have a smartphone in order to submit claims, because you need to take pictures. And so because of that, we're working with an organization called Acre Africa. They have instituted a network of champion farmers, local social influencers, who they actually work with to send in images on behalf of farmers. And they have they have a good balance of both male and female champion farmers. And what we actually found, and I think this is very complementary to the findings that were presented in a previous talk, is that the female champion farmers are much more likely to start working with other fellow female farmers. So this is a way, bringing in local female agents is a way to increase the reach, the gender inclusiveness of the program in terms of, reaching women. Because those are the types of farmers that other female champions will want to work with relative to male champions. In terms of benefits, we're looking at another barrier, payouts, insurance payouts. Actually, we encountered a challenge that a lot of farmers, and especially female farmers, in the Kenyan setting didn't have their own mobile money account. So when they were registering the number in which they would want to receive insurance payouts, many of them gave their husband's account, their husband's phone number, to be receiving their insurance payouts. So this is a challenge if we're thinking, is money paid into a husband's account, is that really benefiting women? And so we went ahead and elicited willingness to pay for insurance as a way of measuring the valuation of insurance products for women versus men in the black versus the blue bars. And we asked if this product pays into your own mobile money account, into your spouse's mobile money account, or as a solution for women who don't have their own mobile money account, maybe they prefer being paid into their ROSCA, their savings group. Now that was a really bad idea. We see that willingness to pay for insurance that pays into a savings group is very low for both women and men. But we also see a really strong penalty or disvaluation of insurance products that pay into your spouse's account. So then when we're thinking about gender responsive programming, we really need to make sure that these insurance products, in order to benefit women and men alike, they need to make sure that there's mechanisms in place to pay women directly so that they receive the income, the insurance payouts directly into their own accounts. With the 1 minute I have, that's really good. I want to talk a little bit about the last area through which you can make sure that insurance programs could be gender transformative. This is really exciting. We found as we were doing the Women's Empowerment in Agriculture Index, we found that attitudes towards domestic violence and finding domestic violence acceptable, that was really a disempowering factor for women in these communities. And so we went ahead and we screened a drama in which a husband and a wife have a conflict over the decision to take out agriculture insurance. And in there, the key message is that really joint decision making over these questions is going to benefit the household in the longer run, and that men should also that men and women should have this dialogue and talk together about these types of decisions and that can benefit the household in the end. And it's a really interesting drama. We've just screened it in 7 counties in Kenya. Everybody was on the front of their seat as the drama was evolving, and there were really interesting discussions after screening the drama about gender norms and who decides, and is violence, beating a wife, is that actually acceptable? Really interesting discussions, and people walking out sort of with this, with a changed attitude. And now we're in the field doing a survey to see if it actually also quantitatively changed attitudes, because we did this as an RCT, so we randomized at the village level whether this video was shown or just a general video about, a marketing video about agriculture insurance. So that's some work that's currently going on that's really exciting in the area of gender and digital insurance. So with that, I'll conclude, and here's some references for more reading. No worries, not at all. Thank you.
Thank you so much. We'll take 2. We'll allow 2 questions. 2 questions. There's a question here. Who else? Okay.
Thank you very much, Barbara, for the very interesting presentation. I found the results to be quite interesting. I was just wondering about women having the final say on the final say, and I was thinking maybe could it be that it's a man maybe bringing this information about this product, these loans, and maybe that's why they are not, the women are not having the final say? Like, do you have any information on that? It would be nice to hear about that, because an additional related thing is we also told that women didn't have or have less interest on the already existing loans. So maybe a new way of working, a new way of product like this digital product, it's new for everyone. So maybe that's why it's easier to break the gender also. Maybe if you can give us some information on that. Thank you very much.
One more question. There's a question here.
Thank you for the presentation. I would like to know whether the agriculture activities done by the household, means done by women and men, has an impact during the process of empowering women. Together with that, whether this activity has done in rural area, whether the microfinance institutions has also an impact as far as empowering women is concerned. Thank you so much.
Please take those.
All right. So on the first question, thank you so much for that question. Maybe I should clarify that in this setting, in the India setting, where we found that women rarely had the final say in taking out loans for agriculture, they were actually part of microfinance groups or self-help groups. This is kind of revolving. So they were actually aware of their opportunity to take out loans, and it was a bit striking to us that so many loans were actually used for agriculture without women having the final say in using them for agriculture, because they were part of the microfinance group and men are not part of the microfinance group. The loans were put in women's names. So I think that's very much related, I think, to gender norms and women when they come home with cash, that it's actually the husband, culturally, in this setting, deciding what to do with that cash. And then on the question if agriculture activities done by women and men have an impact on empowering women, whether microfinance institutions contribute to women's empowerment. I'm not sure if this is in India or the Kenya setting, but I think in either case we more are looking at the role of digitizing existing financial services. So I would need to start talking about kind of other people's research in order to really answer that question, because We didn't look into those research questions with our existing survey, since the focus was so much, how does digitizing finance, how does that change access for women versus men? So I think I'll not go into that question. We can talk more about that over lunch, just in the interest of time.
Thank you so much. Let's clap for her once more. If you have any other questions, you can reach out to her during the break, please. I'd like to now invite Dr. Aaron. He's an associate professor in the Department of Public Administration and Health Services Management at the University of Ghana. He will discuss his research entitled, "It Takes a Village, Encouraging Women to Use Maternal Care Through Community Involvement." Welcome.
Thank you very much. Good morning. I hope I don't have to apologize. Yesterday, after the panel discussion, during the questions and answer time, I wanted to make a contribution to emphasize the importance of interdisciplinary collaboration for impact evaluation. Because I've done a lot of extensive research on health policy and management, largely focusing on qualitative studies. And then I became very excited about impact evaluation when DEWA invited people who are interested to know more about impact evaluation, and then the training that we got and the various designs of impact evaluation was very exciting. And the collaboration that I have with my colleague, Alexandra Jabuski from the University of California in Berkeley, has been very exciting. She would have been happy to be here. She's not here. So I'm learning very much on impact evaluation, and I'm excited about it, but we are not going to throw away the qualitative aspect. And so that is what I'm coming to present today. Our qualitative findings and the way the design was done and the qualitative aspect. And so the title for our topic is "It Takes a Village, Encouraging Women to Use Maternal Care Through Community Involvement." In Ghana, women in the middle to upper class, getting access to antenatal care is a choice. It's not a big deal. But for those in the low income group, especially those that have low education and largely in the informal sector, who are in the majority, it is a big deal. Next slide. Okay. So our study started in July 2021 in the Upper East region of Ghana. Ghana has 16 regions. And our aim was to improve access to maternal health services and then strengthen support for pregnant women. And so you will see the Upper East region, the dark spot at the extreme side of Ghana, is one of the poorest regions of Ghana. Next slide. So the World Health Organization recommends a minimum of 8 antenatal contacts. We call it antenatal care contacts, or prenatal care. Okay? Antenatal care contacts, it doesn't necessarily mean to be visits. Previously, it used to be 4 visits, but they recommend 8 contacts. And that pregnancy visits, antenatal care, I'll be using ANC or antenatal care, should start in the first trimester, that is the first 3 months of pregnancy. And that all women should give birth under supervised delivery by qualified healthcare professionals in a health facility. Okay, next slide. Now, in the Upper East region of Ghana, at least we know that antenatal care is universal because women who have 4 visits and above range between 61 to 89%. And 64% start antenatal care in their first trimester from the literature, from the background. And then facility delivery ranges between 57 to 79%. Next slide. Now, in the literature also, we know that the barriers to antenatal care in low resource settings like Ghana, we know lack of money, transportation problems, lack of financial and moral support for pregnant women from their spouses. The decision to seek antenatal care is usually men who have to be involved because of the finances. They have to decide about the finances. And then we also have mothers-in-law who also have a say because of the cultural aspect, certain cultural beliefs as to whether the pregnant woman should attend antenatal clinic early enough or not. These are some of the issues. And some, because of ignorance, perception that obstetric care is not necessary because you know, some of the elderly women said we were not attending clinics and we didn't have any problems. And so because of all these traditional beliefs, there are delays in starting antenatal attendance within the first trimester or first 3 months. Next slide. So what were our interventions? We had 2 main interventions. One, we organized DEBES. Okay. So to educate the communities about antenatal attendance and to also encourage men to support women during pregnancy. And then the second intervention was to randomly assign women who attended antenatal clinic to treatment and control arms. And in the treatment arms, we will make calls to remind them about visits, regular visits, and then also follow up with at-home visits to educate them about the importance of coming to deliver in the facility and educate them about how they should prepare towards delivery, engage the husbands and the mother-in-laws to encourage them to give the necessary support, help them to make estimates about attending antenatal clinic, I mean, what it will take to go and deliver in the health facility and so on. So that is those were the 2 interventions. Next slide. So our enrollment period was 4 months, and we targeted those who were 18 years and above because of the legal age, and then those women who were within the first and second trimester were those that were recruited, and then all the new antenatal registrants at the study facilities, the 5 study facilities participated. Okay, we also obtained ethical approval for the study. Next slide. All right, so that is the way we did the randomization at both the community level and the village level. And at the community level, we randomly selected 50% of the communities to do education about the importance of attending antenatal and so on. And then the other 50%, we didn't do any education. We just left them like that. And then on the antenatal attendance, the women, we assigned 40%, where we will do the enhanced ANC attendance, education about the importance of making calls, visiting them at home, 40% of the sample. But then the 60% of the sample, we allowed the standard antenatal care that was already being provided by the health providers, so that at the end we will see whether the phone calls, the home visits, has had any impact on improving the frequency of antenatal attendance and delivery in the health facilities. Next slide. So we haven't finished the study, but we completed the DEBES, and that the findings I'm going to present today. And then we divided the study into round 1 and round 2. So we have also finished the round 1, and we include the demographics and other pregnancy history that we took, and other information about male partner involvement and the quality of care by midwife and so on. We finished that. The round 2 we are still ongoing, where we are continuing to interview women after delivery to see their experiences and about the care after our interventions, and then whether our interventions actually help and so on. We are doing that. So next slide. So the progress today, DBERS are finished. Recruitment is also finished. Round 1 is finished. Round 2 is still ongoing. And we are also going to do qualitative interviews of both health providers and then the mothers and their mothers-in-laws and so on about whether our intervention is sustainable and other factors that will emerge from our quantitative findings. Okay, so now let's go to the data, the findings, the DBERS findings. So these were the DBERS, and the DBERS, we usually educate them about the importance of early antenatal attendance, male partner involvement, birth planning, and so on. After we have found out, first of all, we start asking them, why are women not attending antenatal early? And they will give you a lot of reasons. And then the midwife will then now educate them about these things. Next slide. Okay, so these were the findings. Lack of male support, poverty, poor quality of care by midwives or the health providers, lack of knowledge, stigma, traditional beliefs. Okay, let's go to the next slide. I'm there with 5 minutes. So I want to just give an example of lack of male support. It was a very heated debate between the men on one side and the women on the other side. The men said that they supported the women throughout the pregnancy. The women denied vehemently, describing the support as insignificant. What were the types of support? The men said they supported women financially and by arranging transportation to the health facility, especially when they are in labor. And what did the women say? The women said the support was not enough to pay for the numerous tests and other expenses in the health facilities. The men don't trust us. When we tell them about the various expenses in the health facility, they think we want to use the pregnancy as an opportunity to collect money from them for other purposes. Okay? Next slide. Right, so another reason, lack of male involvement was another problem. And what were the reasons? You just let all the slides come, the page come. Yes. So you have cultural beliefs and farm work, right? So one of the cultural beliefs is it is not part of our culture. Your fellow men will be laughing at you. They will ask you whether you are an Ashanti man always moving with your wife. So you see, that is the sociological dimension to it. In the northern sector, there are variations in cultural beliefs from the southern sector. That is where the Ashanti is made reference of. To them, accompanying your wife to the health facility during pregnancy is not a big deal, but in the northern sector, they will laugh at you, according to them. And farm work is another problem. You cannot stop your farm work to be following women always to the health facility. So that is it. Another one is polygamy. So they think that to avoid any conflict in the family, you should avoid being too much involved in the care of any of your wives, because the other one is watching to see whether when it is her turn, you are also going to give the same attention. So to avoid trouble, you need to be very careful not to be too much involved in the accompanying your wife, following your wife always to health facility and so on. Next slide. Okay, so poverty is also one. where to get money for tests and transportation. It's an old problem. Next slide. Poor quality of care. It's already one. Next slide. Lack of knowledge is particularly an issue. Women do not understand why tests were done. They did not want to start taking routine drugs. Sometimes they will collect it and keep it aside, you know. And then men believed women did not need support during pregnancy because pregnancy is not an illness. It's not any illness. And it's only when it's labor and they are heavily pregnant. That's the time that they think they need to support the women. But the women said otherwise. They said it is rather during the early stage of pregnancy when there is nausea, vomiting, and loss of appetite that we need support from our men most, and so on, right? Now let's go on. Let's quickly look at some statistics of the round two, briefly. Traditional beliefs is another problem. Go on. Now, yeah, no, this is an important area. There was an evidence of male involvement, and it was good because some men indicated that they have been accompanying their spouses to ANC, and their spouses are always happy, and the midwives also give them special attention. They encourage other men to emulate their example. I have been sending my wife to the health facility for ANC. She's here. She's always happy. And the midwife here has ever attended to us during our visit. And in fact, what they usually do is that when you accompany your wife to the antenatal clinic, they give you preference. You will jump the queue, so that it will serve as an encouragement for other women to impress upon their spouses to also accompany them. Okay, now let's go to the next slide. I have 1 minute more. So, yeah, let's go on. Yeah. Now you will see from these descriptive statistics, the cumulative frequency shows that, men 1 to 3, that's the first trimester, over 52%, do not belong to, that is age of pregnancy. What am I saying? Okay. Yeah, that's the month. The month at which they start antenatal attendance. You see that over 52% do not attend. I mean, they attend antenatal. Just a little above 50% attend antenatal during the first trimester. That's the explanation. Okay, that's during the first trimester. So you see that even this is less than the 64% that the literature was saying. All right. Next. Okay. Now you will see that school attendance is a problem. Even though, say, about 61% says yes, they attend school. Let's look at the level of education. Next. So you see that in Ghana, we call this the red zone. 66% fall below, the low basic level of education. That is from primary to junior high school. We call that basic education, 66%. So that tells you that there's a lot of illiteracy, and it's accompanied with low incomes, erratic income levels, and so on. And that explains why it is a big deal to have money and other things to be able to attend antenatal. Next. Okay, so the age of the respondents is there. Next. The marital status, polygamy was a factor, but about 81% are monogamous. Okay. Then, of course, here again, occupation. You will see that almost 50% are either housewives or farmers, and these are the low-income groups. Okay, next. Okay, now go on. Now, this is an important area, access to mobile phones. About 92% said they had their own mobile phones. That suggests that if we have to use mobile phone to reach out to them, it can work well, because many of them have access to mobile phone. Next. Okay, so this is just policy implication for our studies. The Director General of the Ghana Health Service is aware of this study. It was just a small pilot study. We didn't do it large enough. They are interested in the study, and we hope to scale up and then see how the findings will be like. Next slide. Okay, so we are now going to do the next steps, pre-analysis. We are going to do the qualitative aspect and so on that I already spoke earlier. Next. All right, thank you so much for your attention.
Thank you, thank you. Thank you so much. Can we have 2 questions? One there and then there. Those 2, please.
Thank you for bringing in some qualitative methods. I found it very interesting. I noticed that you had some interesting quotes that seemed to be the women reacting to what the men had said. I'm curious if you got those through some sort of group interviewing or focus group technique, whether you also did individual interviews, and in general, how you chose the qualitative methods, and if you can share any findings on how to get rich qualitative data from couples on subjects that they seem to disagree about. Thank you.
Take that then. There at the corner, that one.
Thank you for your engaging presentation. You made I think I should stand because you might not see me. You made an interesting comment about how older women, like the mother-in-laws or the grandmothers, would say, oh, we turned out fine and we didn't use the clinics. This might not necessarily be the case because there might be just a local woman out there who comes to the house to help them with their maternity issues. So did you engage with the local practices before, should I say, westernized medicine came into being, and a way of bridging the gap between the local midwifery services and formal clinics and hospitals for these kinds of issues? Yeah, thank you.
Your point again, briefly.
Yeah, the interaction between the local maternity practices that do not involve formal clinics or hospitals.
Yes.
That's the kind of services that the mother-in-law or the grandmother used in her own time, compared to the modern medicine and modern practices.
Thank you.
Yeah,
Please take
traditional birth attendants.
That's right.
Yeah.
Yeah.
Thank you. You can take those.
I should.
Yes, yes,
okay,
please.
So concerning the qualitative approach, it was a very small study. So the idea was more about the randomization, but then because we randomized at the community level, we wanted to just use the DEBA period to do the education. So it was not a rigorous qualitative approach using either focus group or in-depth interviews per se. So we just gleaned from our DEBA education, and then we were trying to see that when we now collect the data, we did the baseline and want to, at the end, see whether the DEBA education, where we emphasize the importance of attending antenatal clinic early, has helped the communities that we did the education or not. But then we are following up with a qualitative study, based on the preliminary findings, and at the end of our interventions, the phone calls, the home visits, and so on, whatever the findings will be, will inform the qualitative study that we are going to also do. I hope your question is answered. Thank you. And then concerning the TBA, in Ghana, they banned the traditional birth attendant, and they said every birth attendant should now be supervised by qualified health professionals, midwives, and doctors. So usually we have community health officers who try to educate them, and midwives also try to educate them to come and deliver in the health facility. And in fact, the traditional aspect was, we found that it was very minimal. I mean, the belief system where mother-in-laws will try to prevent them, that is more in the literature. We didn't find that as a big barrier. They said that, well, times have changed, and they now know that we are in the modern times, and their time was not like this. And so if there are other reasons, it could be poverty, lack of male involvement, support, and so on, more than the traditional beliefs.
Thank you so much. Let's give him a round of applause. It seems to have been a very engaging discussion, so please pick up further during the break. Thank you so much. I'd like to call our final discussant, East Fellow and NERA member, Solomon, who is the Director of Research at the International Center for Evaluation and Development. Solomon will share his research on increasing women's participation in community-driven development projects, evidence from Kenya. Welcome.
Okay, thank you so much for coming, and thank you in advance for listening. Yeah, I will talk about a research I'm working with Elise and Ganesh from the World Bank. It's about information, the effect of information on women participation. It's an experimental evidence from Kenya. It's an experimental evidence from Kenya. So Amy just told me that I have 15 minutes. So I will just start with a story so that I can save some time. So let me take you back in 2020. I had a chance to join the World Bank as a young fellow in forced displacement just after I was done with my East Fellowship. Then the third meeting with the bigger team, it was not really pleasant. And the meeting was about evaluating the one project in Ethiopia. And that project is the Ethiopian Development Response Displacement Impacts Project. And the project makes this community-driven development project investments. And they expected, they invested a lot of money. That's what I realized later. I will come back to that later. But they expected that women would participate in the activities and in the activities of the community-driven development projects. So everyone was furious, but I was confused. And finally, you know, the World Bank meetings, most of the time, they are very short, even shorter than the time allocated for my presentation today. Then the meeting ended. After that, I was confused, as I told you. I called the YPP in the team because I want to clear that confusion as soon as I could. Then she said that, you know, Solomon, the confusion comes. They invested $200 million on that project, and they anticipated women would significantly participate in those projects, but that didn't happen. So that's, I think, the gist of, that's, I think, how this paper is incepted. Then after, and even worse, after a couple of months, a less rigorous impact evaluation of the project came. And they find out that the project didn't have so much or significant effect on the economic, social, and other aspects of, you know, the local community. So we said, okay, let's try what we can do to improve the participation of women in the other project, a sister project in Kenya, that is the Kenyan Development Response Displacement Impacts Project. So we started exploring, we started,
The center's over here.
oh, it's going there, okay. So yeah. Yeah, so we started exploring the literature. What we find is that the most cited barriers for poor women participation is that one is cultural, as it has been mentioned in the previous presenters, and the other one is the poor information access. So we find out that, okay, having an information experiment or information intervention is the cheapest option. So let's try that, we said, and that's what we did here. It's study the impact of information provision on women's participation in community-driven projects. Yeah, so there were, when we do the literature search, there were two strands of literature. One is the impact of CDDs on various socioeconomic outcomes, and there were also information experiment research on various, aspects of participation. We didn't find any research by that time that explores how information affects women participation in CDD programs. So we need evidence on the effect of information on women participation. Yeah, so why do we care about women participation? The first thing is that, as I told you, most of CDDs, they were not effective. But most of the literature shows that when there is a significant amount of women participation, there is a huge gain in social, economic, and political outcomes. You can see some of the papers over there. It could lower, the incidence of corruption and bravery, and it could also improve, access to social services, for instance, in Norway, in relation to healthcare. So we also anticipate that women participation could bring positive energy in CCDs that could improve the social and economic impacts of the CCDs. Yeah, so the research question is, does providing information increase women's participation in community-driven projects? And it's the case taken from, the Kenyan Development Response to Displacement Impacts project. Yeah, so what's KDR-DIP? The KDR-DIP is, it provides funds for refuge host communities in Kenya, and it also provides, it has a sister project in Ethiopia as well. And it encourages, particularly encourages the participation of disadvantaged peoples and communities, particularly women, in the activities of the projects and investments. So far, the project has invested 470 investments, or formed about 470 investments, and formed some groups as well. So the expectation is that the women would significantly participate in the activities, in the activities of the project, and they participate also in the groups. But that didn't happen in the Ethiopian project. So that's what we are trying in the Kenyan Development Response Impacts project. So what we did is that we prepare the treatment, and the placebo scripts, and both has 6 components. So the control group or the placebo group, they get only the first part. We just give them general information about the project, but all the 6 components, including the later 5 points, they were presented to the treatment group. So the difference between the treatment and the control group is that we provide more detailed information on the benefits of women's participation in community-driven projects. We provide also the phone number of the community facilitator. If the women would like to participate in the community activities, we give them also further information that KDR-DIP would encourage the participation of women than men. So that's the treatment and the placebo script we provided to our treatment and control group. Yeah, so this is for the treatment group, and for the control group or for the placebo group, we just provided the first part. Yeah, so we had 2 treatment variables we generated based on our script, the control and treatment script. We created, or we generated 2 types of treatment variables. The first one is the information treatment variable, and the other we call it, I think, the information treatment take-up. Not so many people, even the co-authors, agree with this. So if we have an alternative name, we would be happy, to take it from you. So yeah, we had the sample women. We take a sample of men. Then we assigned them to the control and treatment script. That's the placebo and the treatment script. So this is our information treatment assignment variable. So women that are allocated to treatment, they will be, the treatment group, and they will be coded as 0. Otherwise, they will be coded as 1. Otherwise, 0. But our information treatment take-up variable is because we give an information treatment. So we give to the information treatment to the women. Not all of the women will understand the information treatment. So what we did is that we had a follow-up question to check if the women understand what was presented in the information treatment script and identify two groups of women. That's one who understand the script in the treatment, in the information treatment, and those who didn't understand the script presented in the information treatment. So we generated another control group. So this control group is the original control group plus the treatment women who didn't understand the script presented in the information treatment. So this is our another treatment variable called information treatment take-up. We have different versions of, the variations of, the definition, or we formed the information treatment take-up in many different ways, but we find similar results, which is no effect. But we will come back to that later. So what we did is that we had two kinds of, presentations. We presented in different ways for the treatment and the control group of the placebo group. So for the treatment group, first we had a formal, a normal survey questions. Then what we did is that we mentioned what KDR-DIP is, and then elicit prior likelihood of participation. We didn't measure actual participation. That's what we are going to do with the midline and the inline survey, but we just measured their likelihood of participation. So we mentioned what KDR-DIP is, and we asked their likelihood of participating in KDR-DIP activities. And we did that with stones. We give them 10 stones, and we tell them that, okay, give me your likelihood in terms of the number of stones, because there is a cognitive burden to ask likelihood for those women in terms of probability. Then after that, what we did is that we presented the treatment script for the treatment group. Then we had an obfuscation statement. I wouldn't like to go there. We did that just to reduce the risk of experimenters' demand bias. Then after that, we elicit posterior likelihood of participation. Then we ask for the treatment group their level of understanding of the information presented in the treatment script. Then we add a follow-up question on the perceptions and also prior knowledge of participation. It's the same. The treatment, the way we presented for the control group is the same as the treatment group. So the only difference is that instead of presenting, the treatment script for the placebo group, we presented the placebo script. The other is, instead of asking, the level of understanding of the treatment script, we didn't ask anything for the placebo group or for the control group. So this is how we presented the experiment to the treatment and the control group. Yeah, the sampling and data, I think I can skip this part. So we ran a basic model, just regressing the treatment variable, the treatment assignment with the posterior likelihood of participation. That's our basic model. Then we extend this basic model with controlling for prior likelihood of participation. We also control for other covariates, household covariates, and also their prior knowledge of KDR-DIP and all these things. Then we run also another version of the model, that's the IV estimation, using information treatment take-up that I explained earlier as a treatment variable, but instrument it with our original treatment assignment. So this is the basic model and the extensions we run. We run also a number of robustness checks and all these things, but I am not going into that. Yeah, so the first result we find is when we use the information treatment assignment as a treatment variable, what we found is it's a null effect for the eight specifications we run. But what interesting here is we find a significant effect of the prior likelihood of participation. But our treatment assignment, it didn't have any effect. So we thought that, okay, this could be because the women didn't understand our script. So what we did is that, as I explained to you, we use the information treatment take-up. That means we excluded the women who didn't understand the information script. We put them in the control group. We did another version also removing them, but the result was similar. So this is presented in the next slide. So we find a non-robust effect here. When we have the basic model, it had a significant effect, but when we included the control variables, the effect disappears. This is the OLS estimation. But the prior likelihood of participation has still a significant effect on the posterior likelihood of participation. So when we run an IV estimation with using our treatment assignment as an instrument, the non-robust effect even disappeared. We didn't find any effect of information treatment take-up on the posterior likelihood of participation. Interestingly, the prior likelihood of participation has still a significant and robust effect on the posterior likelihood of participation. We ran a number of robustness checks and also different definitions of information treatment take-up. The results looks similar. So yeah, to conclude, so what we find is that information treatment or assignment to the information script or the information script, it didn't increase women participation. So providing information doesn't increase women's participation in CCDs, even if it is cheap. So we need to try maybe a more costly approaches, to increase women's participation because the information, even if it is cheap, it's not increasing. So if the project objective, like our project, if it is aiming to increase women participation, so we need to take more proactive actions and be ready to pay a little bit more and increase women participation. Even the information treatment take-up, it had some effect, but that was not robust. So this confirms our conclusion that, or it strengthens our conclusion that even if the women understand this or not, information treatment doesn't affect women's prior likelihood of posterior likelihood of participation. But here we are talking about the prior likelihood of participation, not actual participation. 2 minutes, yeah, I'm wrapping up. Thanks. So, but the prior likelihood of participation was a strong predictor of posterior likelihood of participation. As you see it, the prior likelihood of participation had a robust effect on the posterior likelihood of participation. So when we ran further analysis, for instance, what we did is that our theory of change was that, okay, when we present information to the woman, it changes the woman's perception of participation, the benefits of participation. We thought that women doesn't have an information on the benefits of participating from the CDD project. So our theory of change is that, okay, the information will change that perception. And then if the information changes her perception, it changes or it affects the posterior likelihood of participation. That was our theory of change. We checked for that. The perception that the woman has, it significantly affects, I haven't presented here, it significantly affects the posterior likelihood of participation. Then we did another regression checking that how does our information treatment and our information treatment take-up affect the perception. It didn't affect the perception. So the problem is the information treatment take-up or the information treatment assignment or the information treatment script we presented, it was not strong enough to influence or to change the prior likelihood of participation through her perception to have a significant effect on the posterior likelihood of participation. So that's the thing. So the information treatment take-up, as well as the information treatment assignment, it didn't affect the perception. Then that's why it has a null effect. That's why it has a null effect on the posterior likelihood of participation. So why we need to get, I think I already explained this, the first point. The second point is, it could be because of also cultural barriers, because we are doing this experiment in semi-pastoral and pastoral religions where, women are not allowed to go even alone, not alone, to participate in community-driven projects. So that could be one of the reasons why we find also the null effects. So the next step is many people has been questioning our results that, hey, okay, this is just a likelihood response. It's a perception-based response. So what we are going to do is that we are going a midline survey sometime in July, or maybe sometime at the beginning of August, or maybe by the end of August, if the election in Kenya goes really well. So we will have a follow-up survey. That's a midline survey on actual participation of women. So we can measure the actual participation by women, not only in KDR DIP activities, also in some other activities as well. Then we will have also the chance, we are concerned about there could be spillovers to female and male household members. As they said, sometimes, the women get the information as like the credit, but the man might benefit, from that information. He goes and participates there. So we check also the spillover effects to the other family members. It can be to the women or to the men. We will also check the spillover effects to other households in the community as well. And in order to do that, we use some network questions. We will include network questions in our survey based on recent study by Michael Carter, 2021, and also Conley and Udry back in 2010. They used network questions to measure the magnitude of spillover effects in information treatment experiments. So, okay, if treatment does not affect actual participation, then we will have an inline survey in December or at the beginning of next year. So we will explore that maybe with experiments, with some experiments. We have no idea, we haven't thought about that yet, but if anyone has done that kind of research exploring why women participation is low, I would be really, really excited to learn about that from you. Thank you so much. I think I kept the 15 minutes limit.
Thank you. Let's clap for him. Please, only 2 questions. Because of time, you can continue the discussions later. I will take him, and I've seen a gentleman. Sorry, I know I didn't pick you the last time. Let me take you, and then that guy later.
Okay, thank you, Jennifer. Thank you, Solomon, for the interesting presentation. A very, very important, interesting paper, I think. I have one question for you. In terms of this theory of change itself, so why women participate then? If they participate, they have to get some kind of benefit, yeah? So whether they have information or not, they need to have they need to understand that they benefit from their participation. So if that benefit is not clear for them, whether they participate or not, it doesn't have anything. So the theory of change itself, by itself, is somewhat questionable for that. So I think, I don't know, because of time, maybe you may not be presented that on, but women, in your case, information is a central point. But access to information doesn't necessarily mean that women, whether they participate or not, doesn't participate, but they have to get some kind of benefit for their participation. So in that case, the theory of change maybe, I think, need to be very clarified for them to participate or not to participate. So information may not be the only factor. So because it's a big project, the fact that the information, access to our information doesn't have any effect on women participation misleads such kind of big project to benefit for women. So I think you can comment on that. Thank you.
Kim? And then one more.
Thank you very much, Salman. My name is Christian. I work for the FAR Foundation. I actually wanted to ask you, so you are interested in women's participation because they don't participate, and if they don't participate, that affects the completion of the project or the effectiveness of the project. If that is yes, is there a dollar amount that we can assign to every woman who participates in a project? If you could say, for every project you implement, if women participate, every woman who participates, maybe we gain 10% in lost value, right? So that is the money we could lose because this woman didn't participate. So if it's 10%, following up on the comment he made, we can say, okay, so we give you 2% of that share, creating an incentive for you to participate, right? But if we don't have a number, then it's very even difficult to even say, why do we think this is a problem? It could be that, well, if they participate or not, it's still the same result in terms of project completion.
Please take those.
Okay. Yeah, thank you, Al-Level and Christian. So I think that's also the practical question that came into my mind when we conceived this paper project. So the Kenyan Development Response Impacts project was approved by that time, and we didn't have a budget for that to allocate benefits in terms of 2% or 10% or to pay salaries for women participating in the activities of the project. So what we said is that, okay, what is the cheapest option to try? We have the money, we have the research funding, but we don't have to make some costly interventions. Okay, let's try an information. We went to the literature and we find that information could be one reason because they don't have the information. So I think we are a bit tied at that time because we didn't have a budget. We talked to the TTL who is leading this project. He said no, because yeah, inflation was there and all these things. They have a lot of reasons to say that. So we couldn't go to much more costlier approaches, as we said, but that could be the next step in Ethiopia. The team has won another chunk of money now, so I could bring this to the team now. I think we have a say now than previously because we put some money also for the research, those kinds of interventions. For instance, what we are thinking is that village level interventions and giving 10% as I said or 20% more to villages that has more women participants or something like that. So I think that could go along that line, but I agree with you that information, that's also what we find, right? Information is not useful in this context. It might work in another context, but it doesn't work. And I agree with you that there should be some kind of incentives. It could be monetary incentives and all these things. But as it stands now, I have never been in the field, to be honest. But they told me that they give them a small amount of money when they come and participate, and that couldn't even buy an exercise book for their kid. So I agree with you that information doesn't work, and a small amount of small amount of incentives might not take out the women from home and participate in those activities. That's what we might need to explore maybe in the Ethiopian project. Thank you so much for the comments that are really relevant for our work.
Thank you. We need to have a hard stop. So again, you can always engage him later. Let's give a round of applause. So we're going to break for lunch. We'll take about an hour for that. You can take your voucher on your way out. But let's us thank once more Muthoni, Baba, Aaron, and Solomon for their presentations. Thank you.
Kondo's inaugural class of the SIGA East Fellows in 2012. I'm currently co-founder and director of the Impact Evaluation Lab of a small NGO in Tanzania called the Economic and Social Research Foundation. It's an esteemed pleasure and privilege to welcome back everyone to the plenary. We're going to dive right into our next session, which will feature research related to impacts of digital credit. Each of our presenters will have about 10 to 15 minutes to present, followed by 5 to 7 minutes of questions of each of their presentations. So without further ado, I'd like to introduce our first presenter, David Sung-Ho Park, who is an assistant professor of development economics at the KDI School of Public Policy and Management in South Korea. Today, he's going to discuss his research on the impact of digital credit in developing economies, a review of recent evidence. Welcome.
Thank you. Hi, my name is David Park. I'm assistant professor of economics at KDI School of Public Policy. Actually, it's my first time introducing myself, not as a student, so because I just started. So just like right before I get into talk, KDI School over there, we also have like many programs that we host, like African scholars, practitioners, and policymakers. So if you're any way interested in that, I believe that we also have many fellowship programs and mandated programs that we could suit you if you want. So please come talk to me if you're interested. Okay, so the talk that I'm going to do today, this is first of all, this is a joint work with Jonathan Robinson at UC Santa Cruz, who was my advisor, and also Joshua Blumenstock at UC Berkeley. So this was an effort. Okay, I'll try to speak up. Okay. So this was an effort to try to synthesize some of the this small but emerging evidence space in digital credit. So yeah, just for the motivation. But in recent years, there has been this like massive like transformation in this consumer lending space by this like massive introduction of like digital credit products. So these digital credit products are often characterized as being instant, automated, and remote. And by having such characteristics, these also like they minimize the transaction cost massively, and also by using non-conventional data for credit scoring, all these factors massively increase access to credit in many low and middle income countries. So while such loans have already reached like millions of borrowers in low and middle income countries, almost like surprisingly, there has been like really limited evidence of how, whether what kind of welfare impacts there are on borrowers' welfare of such loans. So yeah, so what is digital credit? I'll just spend like a minute on this. Like simply put, digital credit is any loan made on a digital platform. By being digital, it could be characterized by being instant. So instead of taking multiple days, it could be done like right on your phone or on your like smartphone, etc. It's also automated in the sense that the loan decisions are not made by human loan officers, but often by some kind of algorithm. And it also it's remote in the sense that it does not require any like in-person interaction. So there are like many forms of like this digital credit products, and these are maybe one of 4 of the more prominent ones. The first one, which is a little bit more prominent in this African continent, is the partnership between the commercial banks and telco companies. So in this one, in these type of models, typically they make use of the already this like well-developed mobile money platform, and the loans are backed by the loans are backed by commercial banks, and like consumers could potentially get loans over the phone using their mobile money platform, which does not require a smartphone, of course. And the second is there's also this model is also prominent in many like African countries, like in Kenya and Tanzania. This is a partnership with fintech companies, usually based in like outside of Africa, like in Silicon Valley. And they that's the third model. The second model, maybe not a little bit less relevant for this review, but this model is a little bit more prevalent in like Asia or Latin America, where like tech giants like Alibaba or Tencent, like they try to partner with local commercial banks, and then they give out loans. So these are like slightly different in terms of like many characteristics. But maybe the third one, which I was just talking about a minute ago, these are if you heard like Branch or Tala, these are the typical examples in this type, where there's like Silicon Valley based tech giant, like tech startups, like they use the money from their investors and just make these like small loans based on their smartphone apps in developing countries. And the fourth one probably predates many of these products, which is about airtime loans. So where the borrowers could just borrow credit on like based on their feature phone, and then they could use those credit to just use like those like traditional mobile services, like making a call and sending a text message. So just like digging a little bit, just like if you think about this a little bit more prominent models, prominent products based on that first model that I show you, which is the bank and the telco partnerships. So again, these are like more prevalent in African countries because almost by definition of this model, they utilize this mobile money platform. So naturally, the more prominent models, the products in this space is M-Shwari in Kenya using M-Pesa's mobile money network, and also Mpawa in Tanzania. And again, like the credit scoring for these, the determination of the credit eligibility of these loans are like determined by using the mobile money transaction data. So that's also like one advantage or something by nature, like how these loans work. And these products, like they feature these like small amount and short term. So they're about like maybe tens of US dollars amount, depending on your credit score and your previous mobile money transaction history. And these loans are typically are supposed to be paid back up to like a month. So these are very short term and small amount loans. They're also, it's a really like high fee loan. Like these are not conventional loans, so they don't call it interest anywhere, but they call it like facilitation fees. And these fees, they add up. I mean, they are like subject to compound. So especially when you don't pay in time, like, and when you annualize these rates could materialize, amount up to like well above 100% a year. So these are really high interest loans. And yeah, these, as I briefly mentioned, like Branch and Tala are like two really like prominent examples. There's going to be like one talk out right after my talk about like evaluating one of these products in Nigeria. These are like smartphone lending apps where you could just download from your app store. And again, these are the funds usually come from outside of this continent, and more or so those like private public investors on these Silicon Valley-based firms. So these are, in a way, maybe from the consumer side, kind of similar to the telco products in a way that they're also quite small loans. They're also short-term period, and their interest, or actually the fees in this case too, they're quite high when you like annualize them and think of them in the context of those conventional loans. And again, like this model is a little bit like less relevant because there was like no study in our review that followed into this category, but it's a pretty like more prominent model. So I just want to spend like maybe a few seconds on this. So like here, like WeBank, like Kakao Bank in South Korea, like these are like one of the models where they like already existing tech giants. They partner with the existing commercial banks. These are a little bit more, they're closer to the conventional loans in the sense that it's more large amounts, like tens of thousands of US dollars. And also interest rates like a little bit more closer to the market rates. Okay, so with all these different products, like maybe one thing that did not like focus that much is like all these like fourth columns that are in this table that I put here, which just basically kind of documents like how many existing like users like in the most previously in their like most like recent reports or so. So all these zones, like, it's already been so popular and it has reached like so many people in these like low and middle income countries in many different places. However, it's not like really like well said whether these loans are like helpful or harmful to the borrowers. So on the help side, yeah, all these the factors being instant, remote, like automated, that means a huge reduction in transaction costs. So that should be something good. There's like new scoring models or just like scoring models on like existing new data. All these factors kind of point towards expanding access, so that should also be a good thing in general. So and just with the sheer volume of like these loans and just like the popularity that we see that we observe, that highly suggests that there's unmet demand in such markets. So again, like that, it's indicative of that this is a good thing. The harm side is that again, these are typically very like small loans in a short term, and with very high interest rates, which are kind of the characteristics of some kind of predatory lending or so. And there's also like quite some like media news outlets that talk about the negative like potential or negative effects of these digital credit loans. And there's also like in one of the papers or two of the papers that's reviewed in this review, it's also documented that borrowers are often poorly informed of the loan terms. So it's like they don't know the interest rate, the fee structure, they don't know what the late fee is, they don't know what's like the consequences of paying late or defaulting it. So consequently, there's also many observations that many borrowers that end up paying late, and that also ends up like these like piling up fees that they need to pay. The late fees in addition to the facilitation fees, which is kind of de facto interest rates. And the default rates are also high, and which means, of course, like losing access like for like to future loans from the same lender. And in some instances, that could also mean like losing access to other lenders, especially if you report to the credit bureau. Okay, so what do we do in this review is review this like small but like really highly emerging evidence on digital credit. We in the paper like on which I'm presenting today, we include 8 completed studies. 7 of them were funded by the Digital Credit Observatory at SIGA. So these 8 studies, they span across like 6 countries, the first 4 in Africa and the last 2 in Latin America. We split these different product types into three groups, the MNO bank partnerships and MNO airtime and the non-bank lenders. And these products are mostly, again, like short-term loans, except one study where they actually target these farmers just by the nature of the product. Like they have like a longer repayment period, but other than that, they're mostly like short-term loans, like up to 1 month or so. And the customer base, like naturally, you can think of these are pretty like new products in a new stage. So these are just by as lender, like they target more of these like more affluent people and more younger people, like more educated. So this is not really like one of their like they target this in, but it's more like these factors are highly correlated with the other like predictors that the lenders would use for predicting their credit score. Okay, so just to just kind of skim through the borrower characteristics. As I said, they are relatively young, 30 or 40 on average, and they're also more educated and higher. They report higher income or expenditure. So all the numbers that I report here, or kind of summarize here in the last two rows, these numbers are well above national averages. And many of these studies, they stratified on gender because many of the studies did want to look into the gender differentiated effects. So you can see the gender ratio, female male ratio are kind of balanced in many of the studies. And the urban-rural ratio also, it kind of varies because yeah, you might have thought that this type of product is also more focused and kind of only on the urban goods, but that's not really the case, at least in these 7 studies that we cover here. Okay, and take-up. This is one of the crucial, one of the first crucial findings that we have by synthesizing across these papers, is that we do find a high take-up, especially in the telco model, where the take-up rate is about 34 to 35%, and the airtime loans too, they're much higher, and the non-bank ones, which are in columns 6 through 8, they're also much higher. But however, one caveat here on these numbers is that. And just happens to be those 3 studies over there. It was a much more selected sample. For example, they did a study only on those people who are potentially interested in loans. So their take-up rates are kind of in a way systematically larger there. And again, these loans that these 8 studies study they're relatively small in size, and some borrow repeatedly. So that's why in the second column and third column, average loan size means that the average loan size per time, and the total value of loans is that this is, so for example, if you look at the first column, 2.8, that's the average value of loans that people take at one time. And over, I believe that for that study in Kenya, it was over 18 months or so. And over 18 months, the total amount that the study sample borrow was about $25. So there's this behavior of repeatedly borrowing, which I'll get into later maybe. And the default rates here, maybe the more relevant is column 1, 2, and 6. So that's the 7 to 15%. Other ones are maybe column 3, for example. Those are for mobile money agents. So it's kind of different in terms of the nature of the product. So 7 to 15 and 2 to 3 for airtime. Again, airtime loans, typically you automatically you paid when you recharge. So that's also one systematic structural factor why the default rate is lower in airtime loans. But anyway, 7 to 15% if we kind of stick on that number you can think of this as a high, but this is also kind of a limited time. So this yeah, I mean. It could be high or low, but yeah, that's the number we find. Okay, so and also in terms of looking into what kind of welfare impacts that they had, we actually include only 3 studies in this part because many of the studies many of the 8 studies that we included, they have faced some kind of logistical or implementation challenges with their partners, and which is kind of not uncommon in this space. Because this digital credit products, just by the nature of being new and innovative, typically these lenders, they change their products or even cancel the product, and that happened to many of the studies too. So maybe these 3 studies were fortunate enough to have their studies completed. And so the first one was studying M-Shwari, arguably one of the most well-developed or the well-known like digital credit product, which is have like many users, like millions of users in Kenya. So they have like many like interesting findings, but I'll just like focus on this like one core finding, which is relevant to our review, is that they find there's like positive effects on risk coping. What they mean by that is that they first document that like a lot of people, about like 90% of the people, they face some kind of income or health shocks, and in response to those, they reduce some like their expenses, like either like food expenditure or health expenditure. And in terms of this, it's like this exogenous variation they have. In terms of this loan, what they find is that these digital loans, M-Shwari, they help people in their study sample to like less likely to forego an expenditure when you face some kind of income or health shock. And they also go through the other, like, you know, the other outcomes, and they find no like significant effects, either negative or positive. And the second study here is they study this product called Kuchova, offered by Airtel Malawi, like obviously in Malawi. So again, there's still like just one of the core findings related to this is that they also find some kind of small but positive effects on like self-reported financial security. And they also, but unlike the Kenya study, they don't find anything on risk coping. And also the second study and third study also talk about that too, but they also go through this like pre-registered list of outcomes that they think could have been like effective either positively or negatively, but they find no significant effects on those outcomes. And the third one, which is actually going to be like much more extensively like discussed in the next presentation, they evaluated this like smartphone lending app in Nigeria, and again like they have many interesting outcomes too. But one of the core findings is that they do find this increase in subjective well-being, mostly from a reduced depression. And they also go through their like pre-registered like list of outcomes on like other welfare outcomes, but they don't find like any like significant effects on any of them. Okay, so like another really like important topic in this field is about this consumer like protection and like this customer knowledge. Like while like the previous like slide was kind of telling you that, I mean, one like kind of summary of this is that yeah, there's some modest evidence for these like positive effects of digital credit, and so far like we don't like studies have not found any like negative effects of these loans on borrower welfare, but still like there remain some of these concerns when it comes to these like whether people are knowledgeable enough. So like one study that's there's two studies relevant to that. One, the Malawi study, they also had a second component where it was kind of more focused on this consumer knowledge on these digital credit products. And one really interestingly, or maybe shockingly, they find only like 1/3 of their study sample, which were kind of like people who are potentially eligible for this loan. They were aware of the interest rate, due date, or even the existence of late fees. And they also had this RCT intervention where they had this IVR, like interactive voice response basically like it's like a way to provide information. And they did this by like providing information on like the loan terms, like what this product's are, what will the consequences, like what's going to be your late fees, etc. And they surprisingly find increased demand of the effect of this. And another like finding here is that they do find like a reduced default rate of this intervention. So yeah, this kind of like suggests like information disclosure, which naturally you would think that something that the lenders would not want to do, that could actually be profitable, and this is maybe some like suggestive evidence that it could be profitable and it should be advised. And the second one, this is also an interesting study. This was also a study in Mexico, and what they did is their intervention was basically just like just introduce this kind of fictitious waiting time. So after the loan decision was made, they just made this a delay, and the effect of that delay was that actually people were like just higher repaying. They were more likely to repay the loan. So this kind of suggests that digital credit, when it comes to digital, all this are remote, like all those like nice things about digital credit. One part of it, like being like instant, maybe it's too instant and too fast. So this also suggests that maybe just having like this break and just some kind of mandatory waiting period could actually help the borrowers. Okay, so maybe I went through all of these. This is just like a summary. So we do find like robust demand. So it's not a surprise. Second, maybe it could be surprising. We do find, I mean, we as in sense as this academic community, we do find there's the welfare effects in these few studies. Again, this could be a little bit like surprising to some, especially for those who thought and argued that a digital credit might be like too harmful. But again, this doesn't mean that digital credit is all good. These are only like a handful of studies. These should be like keep on be stunning. And even among these ones, there are still reasons for concern, like consumer knowledge is low, and etc. Okay, so maybe, yeah, these are some open questions. I think I'm already out of time. Like the first one that we talked about a little bit, those are really important and just kind of keep worthy of future research. There are really interesting parts about product innovation, different ones. I may not get into it. I can spend like more than like 5 or 10 minutes on each bullet. And the third one too, like it's really abstract, but it's like that's pretty indicative of like, how this could be expanded. So, for example, like many of the studies, they try to do some kind of gender differentiated effects of digital credit. However, because of their like a sample size, they were not able to do that. But this also could be something that could be expanded. So, okay, thank you.
All right, thank you, David. I think we have time for about 2 questions or comments. Yep.
Yeah, that's quite interesting. And coming from Kenya, the one thing I also noticed that has not been studied, we have this issue of predatory apps, which you mentioned, and they actually spam your entire contact list if you don't pay up. So there's this public shaming issue that's going on, and the whole fintech field is not well regulated. So I guess those are maybe further avenues of research, but I've also not seen such research myself. And what you've done is quite interesting. Thank you.
Anybody else with a question or comment? Okay, great. Do you want to say some last kind of, no?
Yeah, I could kind of respond to that comment too. So yeah, so I mean, it's really like a nice comment in the sense that like most of these like products that were studied, like or even like not only in this studies but also like in, like by academia, are not really those like predatory lenders, or they're more, these are more prominent ones that are like more likely to be like a good partner for research, etc. So yes, I think maybe that's like that's really kind of in a way a dilemma. So like, I mean, maybe those type of lenders are, they should be studied. They're like more need to be studied, but it's also really more difficult to like partner with them and study. But yeah, but I take the point totally.
Thank you so much, David. Okay. Before I introduce the second presenter, please, I just want to reiterate, we need to wear our masks when we're indoor, please. I see many, many faces without masks. I urge you to please wear masks, please. Okay, our next presenter is Suraj Nair, who is a third-year PhD student at UC Berkeley School of Information. Before coming to UC Berkeley, he was a research manager at IFMR LEAD in India, where he collaborated with academic researchers and government agencies across India to study the impacts of large-scale development programs. He's going to share his work today titled Welfare Impacts of Digital Credit, Results from a Randomized Evaluation in Nigeria.
Hello, yeah. Thank you. That's the longest introduction I've had in a while. So, good afternoon, everyone. It's a pleasure to be here. Thank you so much for having me. Today, I'll be talking about ongoing work which is joined with Dan Bjorkegren, Josh Blumenstock, Wunmi Folajimi Senjobi, and Jackie Moro. We've been looking at, we've been working on a study that looks at the welfare impacts of digital credit in Nigeria. So I think David did most of the hard work in setting up some of the motivation for this kind of, for this project, so I won't spend too much time here. I think, like David said, there's enormous demand for these short-term, high-interest digital loan products. Nigeria is home to one of the fastest growing fintech ecosystems in sub-Saharan Africa and in the world. The last time we'd counted, there were over 50 providers offering these products. Sorry, I just got distracted. Yeah, there were over 50 providers offering these products, and there was a massive demand for them. As we've been discussing through the day, there are several advantages to these products, which is why they're so popular. But at the same time, there's massive concerns about the potential for harm. We just heard a comment about predatory lending in Kenya. The same concern has been brought up repeatedly in Nigeria over the last 2 years. We've been following this trend for the last 6 months as well, where there's been a lot of public shaming and spamming as a result of predatory lending practices. So our study tries to directly address this question of whether these products are actually helping or harming people. In order to do so, we conducted an experiment in Nigeria where we worked with a lender. Thank you. Yeah. So the experiment we conducted in Nigeria, we worked with a lender that is a smartphone-based loan provider. And what we were able to do is induce random variation in access to credit. So we focused on a sample of 1,600 customers. And what we did is roughly 3 months after their first loan application, we went and surveyed them. This was a phone survey. We collected data on a large set of welfare outcomes, ranging from financial health to women's economic empowerment, income, expenditure, resilience, and other things like that. We followed a very rigorous pre-analysis plan that we'd put up on the AEA registry before we began the analysis. So everything I'm going to show you today follows this pre-analysis plan. Before I get into the details of the research, I'll quickly preview the main findings. So we find that increasing access to digital credit in this context leads to some crowding out of informal borrowing. We also see some positive effects on measures of subjective well-being. And we find, as David was briefly mentioning previously, no evidence of positive or negative effects on a whole range of other outcomes, ranging from women's economic empowerment to income and expenditure. So that's the preview of the study. I'll briefly explain the research design, and then we'll jump straight into the results section. So as I mentioned, we worked with this lender. The lender provides loans through a smartphone platform. What we were able to do is focus on a set of first-time customers interacting with this lender. So this is essentially people who are trying to borrow from this lender for the first time. We focused on a set of roughly 45,000 customers who were trying to borrow from this lender between August 2019 and February 2020. And the design is as follows. Roughly half these customers were assigned to a treatment group that we refer to as the auto approval group. Essentially what this means is that we relax the credit score requirements in these groups. So if any individual in this group applied for a loan, they would get it, irrespective of what their credit score was. And the remainder of these customers went into the control group. This is the standard approval group, which is following the business as usual practices. So individuals in this group could apply for a loan, and they would get the loan only if they met the minimum credit score requirements. In addition to this, we also had a second set of treatments where we randomized the value of the initial loan offer. The value of the loan offer ranged from about 1,000 naira, which is about $3, to 13,000 naira, which is roughly $35. For the purpose of this presentation, in the interest of time, I won't spend too much time talking about this second set of treatments. I'll mostly just focus on this first treatment where we were able to expand access to credit for a set of borrowers. It's also worth mentioning that, and David touched upon this point a few minutes ago, it's worth mentioning that because this is a smartphone-based lending app, our sample is drawn from the population of smartphone owners in Nigeria. And this population is very, very different from the Nigerian population on average. So you can see straight away from the table on the right that our sample is mostly male. 3/4 of our sample is male. Over a third of our sample has a university education, which is, I think, twice what it is on average otherwise. And we also see that a third of our sample is concentrated in Lagos. So this is very, very different from what statistics would look like for the Nigerian population on average. It's worth keeping that in mind as we go through the result. The other thing worth mentioning is that take-up is very, very high in our sample. 85% of our sample takes out at least one loan during the study period. The figure on the left is intended to give a sense of what the loan ladder looks like. So the first bar is the average value of the first loan. The second bar is the average value of the second loan, and so on and so forth. The figure on the right is simply tabulating what people are using these loans for. The most common purpose of these loans is to meet everyday needs. And interestingly, there's a large number of people who are using these loans to simply try and move up the loan ladder quickly to access larger loans. And there's a set of people who are simply interested in testing out new loan products. And after that, we see people relying on these loans for business needs and medical expenses and things like that. So hopefully this gives you a sense of the sample we have and how these loans are being used. Yeah, so I won't spend a lot of time talking about estimation. I'll move straight to the results we find in terms of treatment effects. As expected, we find that our experiment increases access to formal credit. This is hardly surprising because essentially we're relaxing the credit score requirement for a set of borrowers, and therefore we should be seeing an increase in formal borrowing. I realize the figure is not exactly clear, so I'll quickly explain what's on the screen. So in this figure, everything on the left is an outcome variable of interest. Anything that's in bold is a main outcome variable that we pre-specified in our analysis plan as something of interest. Anything that's indented is what goes into what is used to construct these main outcome variables. The things to focus on are these coefficient plots in the middle. The red diamond is the point estimate of the treatment effect, and the black and gray whiskers are the 90 and 95% confidence intervals respectively. So if you look at rows 2 and 3 here, you'll see that there is an increase in terms of borrowing from formal sources in terms of both amount and number. But interestingly, if you look at rows 5 and 6, there's a corresponding reduction in informal borrowing, both in terms of loan amount and the number of loans as well. We also see in this figure that there's no impact on savings as such. Even though the coefficient is negative, it's not statistically significant. Digging deeper into what's happening with the informal borrowing, we can see that the first row simply shows that the increase in formal borrowing is driven by respondents borrowing from the lender we're working with. But if you look at the red box in the third row from the bottom, you'll actually see that there's a small reduction in borrowing from friends and family. And there's also a small reduction, even though it's not statistically significant after we adjust for multiple hypothesis testing, from money lender sources as well. So that's the first main result we have. There's an increase in formal borrowing as expected, accompanied by a small reduction in informal borrowing, driven by a decrease in borrowing from friends and family. The second main result I wanted to talk about today focuses on the effects on subjective well-being outcomes. So in our survey, we ask a number of questions that try to understand how these loans are impacting individual subjective well-being. One outcome we focus on is essentially a measure of life satisfaction. That's the second row here, and we see that there's no effect. The other outcome we focus on is essentially a measure of depression. It's a standardized questionnaire called the PHQ-9 questionnaire, and that allows us to get a sense of whether respondents are depressed or not. And as you can see, for all of the 9 questions that are a part of this instrument, there are negative treatment effects, which means that respondents who have been accessing these digital loans report being less depressed. All of this translates, when we aggregate up into a main outcome of interest, into a large improvement in subjective well-being. The really striking thing about this result is that this increase is very, very large in standard deviation terms relative to other anti-poverty programs or cash transfer programs that we see. So the striking thing here is that over a 3-month period, on average, people borrow about $90 PPP total, but we see this large effect of 0.28 standard deviations, which is substantially larger than what we've seen in the literature with cash transfer programs and anti-poverty programs in general. And so this is really interesting. We spent some time in our paper speculating about why we might be seeing these kinds of results. Some of the descriptive data we have simply suggests that a lot of individuals are relying on these loans to meet urgent short-run needs. More broadly, I think the point that all of this is leading to is this idea that despite the fact that these loans might have the potential to cause a lot of harm, they might be serving one very important crucial function. They might be allowing people, especially low-income individuals, to access critical resources exactly when they need them because of the really quick dispersal times. And we know that when people are unable to access really critical resources when they need them, that has potential adverse consequences for their mental health. That's well documented in the literature. So this is the second main result we wanted to highlight from our analysis. In our survey, as I mentioned, we capture data from several other outcome variables. We find no effect on financial health, income expenditure, or women's economic empowerment. We also capture a whole set, we have a whole section on resilience, which captures basically information very similar to the Tavneet Suri study. We have a very high rate of shocks in our sample. So in the Mshwari study from Kenya, 90% of that sample experienced a shock. In our sample, about 82% experienced a shock. But despite that, we find that increasing access to these loans has no effect on improving resilience or risk coping, which is something to think about. One thing to highlight here, obviously, is that our data covers only a 3-month period. The study in Kenya covers an 18-month period. So there is this substantial difference in the time period that's being covered in our analysis. Yeah, so to broadly summarize the main results that I just mentioned, we conducted this experiment which increases access to digital credit. We find that there's a modest reduction in informal borrowing. There is an increase in subjective well-being, which we think is simply caused by this fact that people are able to access these critical resources as and when they need them. We find no impact on a whole set of other outcomes. We do spend some time looking at heterogeneous treatment effects, but as David pointed out, our sample is not really well set up to do this, at least in terms of gender. We do have some suggestive evidence that there is heterogeneity in treatment effects by other dimensions, like occupation. We find potentially larger effects for people who are unemployed, for instance, and that's something we're working on figuring out right now. There are, as I mentioned, there are a number of important limitations of our analysis. These effects are really short-run effects. They cover only a time period of 3 months, so we have no way of telling anything about longer-term potential detrimental outcomes. It's entirely possible that, for example, the negative saving coefficient we saw could translate into a larger problem in the long run. That being said, the nice thing about our results, the results that we do have, is that they're very consistent with the more subjective data we've collected from our respondents. Most of our respondents seem to think that the loan terms are fair. Most of our respondents agree that they do not regret taking out this loan at all and they would do it again. So this somewhat provides some confidence that these products are not exactly harming the sample we've studied, at least in the short term. And as I mentioned, the lack of negative effects is particularly encouraging right now, and it's generally consistent with some of the other studies that are out there. But that being said, we should be really, really cautious while interpreting anything I've discussed today. Just the fact that we're covering only a 3-month time period is enough cause for concern, because we are unable to say anything about longer time periods. Some of the other studies looking at similar products highlight other important issues that we don't cover at all. We know, for instance, for example, that customers are often not really fully informed about the...
Let's take about 3 to 4 minutes for questions. Yes, please. So we have one, and there was one right behind. And one at the front here.
Yes, thank you very much. I think we should move beyond trying to draw conclusions, especially in the context of impact evaluation, where we only rely on some p-value. It's not. We don't really know what.
Maybe it's this one.
But I personally believe that in the context of impact evaluation, we should move beyond the realm of just drawing conclusion based on p-value. Sure. And it should be based on whether it's relevant based on the context. For instance, we implement an intervention, and this intervention is averting 1% death among pregnant women. It may not be statistically significant, is that not it? But if you look at it in the context of clinical significance, the intervention could be worth running. So in the context of impact evaluation, you should be thinking beyond that single p-value stuff.
Okay. Thank you very much for sharing your research. I think there was something you actually shared that was interesting, especially when you mentioned that most of the people that you surveyed are educated, like they have formal education. Okay, can you hear me now? Okay. Yeah. They have formal education, and at this initial stage, you are not sure if borrowing caused them any harm, but based on some of the other, maybe I'll call it research, or because I know a little bit about this context of the research you've done, it has been obvious that there's a huge harm that this particular digital borrowing has done, specifically in Nigeria, and this research is out there. Now, does it worry you, or was it a concern to you that most of these guys, though they are educated, probably did not even look into the context of what contract are they signing, to actually get these loans, and then comparing that to somebody that is probably not educated and would not even look at any kind of contract, right? That's the first point. The second point is, I don't know if you were also trying to look out for, the policies and some of the regulations that is actually existing that is making many of these loan companies and institutions who exist. Some of them are actually not regulated, so you can also check this out. And so there's a whole lot of things happening within the context of the country at the moment where people set up things and eventually even scam people, actually, doing all of these things, and then it results into the shaming and things like that. That's another point. The last point is something you mentioned about resilience. So you mentioned that you're not sure in this short term to be sure if it's causing them harm at the moment. But we know that shaming and all of these other things brings huge harm beyond what is happening right now. And because there has been no specific or very strong repercussions by borrowing and not paying back, so at the moment they can easily say, yes, I can borrow again, because the worst thing they are going to do is just to shame. And I will go to another hub and borrow again. The worst thing they're going to do again is to shame. And I'll continue to do that until a point that it becomes very grievous, right? And then it spoils their career, spoils their name, and a whole lot of other things. So that point of resilience, is it resilience based on the fact that there is no particular regulation or something very strong that people could look at and say, this leads to, a big bad effect on my life? It's just resilience based on the fact that I can continue to do this and there is nothing that's going to happen to it. Thanks.
Thank you.
Hello, can you hear me? Okay.
Yes.
Thank you so much, very interesting presentation. I was wondering, since your population, the target population is the marginal borrower that is not currently targeted by the app, how much do you think your results would differ for people that are currently eligible for the loans, so that have the credit score? And do you interpret your results as suggesting that the credit score should, requirement should be expanded, or as a sign of cautiousness that there should be other things that should enter the consideration when expanding the population of potential borrowers? Thank you.
Yeah.
Thank you. Yeah, go ahead.
Yeah, so I'll just quickly start with that and then work backwards. So on the point about expanding the credit score, can you hear me now? Okay. So on the point about expanding the credit score, we don't find, at least in our setting, that our treatment caused default rates to go up in any way that it seemed concerning. The 7% default rate is the sample average. It's not differential by treatment groups, right? So that's one point. So are we advocating that we should just expand credit scores in that way always? No. I think that was something we did for the purpose of the experiment. You're right that we were targeting marginal borrowers in this experiment, absolutely. Definitely the results are likely to probably differ if it's a population of people who've been repeatedly exposed to digital credit. I think that's a valid thing to say. Unfortunately, we don't have a lot of data to provide more light on that fact, but that's probably true. The nice thing about, at least in the Nigerian setting, is that there's so much competition and so many options available for people to borrow from that we think people get familiarized with these products very quickly. Like, once they're in the ecosystem, they're able to access a number of different products very rapidly. So we do think that people will be able to learn and figure out very quickly how to use these products. Does that answer most of? Yeah, sure. Going back to your concerns about the resilience thing, so we define resilience as a way in which households can cope with negative shocks. You're absolutely right in the sense that constant public shaming and things like that can have adverse impacts on any individual, but that's not something our study was set up to capture in any way. That being said, the way the lender we're working with is set up, people can't repeatedly keep borrowing unless they repay the loans. So the cycle you described where somebody borrows and doesn't repay and then borrows again and doesn't repay, that can't happen, at least with the lender or the set of lenders we were talking about. If they don't repay the first loan, they are not allowed to borrow again. So, you know, the chance of that happening, at least in our sample, is very unlikely. But the larger point that type of shaming could have adverse effects is absolutely valid. I agree with that 100%. There was one other point I wanted to respond to, but there were three things you said. I can't remember the second one. Sorry, could you repeat your second point?
So maybe you can just
yeah, sure.
Connect after the talk, please. Thank you.
Yeah.
All right.
I think that was it, right?
Yeah. Yeah. Thank you so much, Suraj. Thank you. All right, so next three talks will be a bit faster. They'll be lightning talks. We have the 2021 non-resident fellow, Dr. Esther Agasha, who recently completed her PhD in microfinance at Mbarara University of Science and Technology in Uganda and is lecturer at Makerere University Business School. She will be presenting on her work titled Financial Literacy and Women's Financial Empowerment, Evidence from Uganda. So you have no more than 10 minutes. Welcome.
Good afternoon, everyone. Unfortunately, mine is more further than digital credit. So I am in this session. I'm hoping I'll do the best with this session. It's still at a proposal stage. Later I'll show you that we've started pilot. So yeah, my study is on the impact of financial literacy on women's financial well-being, and I intend to do a gamification experiment in central Uganda. So going to the motivation of this study, majority of women have not and this is not just for Uganda, but I think globally, have not benefited from the different financial initiatives and are still financially illiterate, but even more worrisome, they are still financially insecure. And as we will see, the ladder to full financial well-being is still far from expected. So why Uganda? And why women in Uganda? The case for women is that we me inclusive, we make the majority of the total adult population, and yet we have limited financial well-being in terms of financial security and financial independence. And this is supported by different studies. And to just show you the results from one of the financial inclusion studies, the FinScope study 2018, as we can see, regarding future financial security strategies, women still largely depend on children to take care of them as they grow or in their old age, compared to men. They do not have a stronger financial strategy going forward and have limited savings. And even when it comes to owning property and owning businesses, they do not compare favorably compared to their male counterparts. So what has been done? The government of Uganda has put, of course, in place a lot of strategies to kind of combat this. And some of these strategies have been through the financial literacy programs. The one that is most known now, and the countrywide strategy, is the National Strategy for Financial Literacy, SFLIU, which is now in its second phase, effective 2019. However, on different inquiries, informal inquiries, I found that this strategy, with others that are listed, does not have, first of all, they do not have the data set of the women that have been trained, but most worrisome, they do not teach financial literacy in a more active way. There is a more passive way of teaching financial literacy, which means that they train what they call trainers, and they hold events, 2-3 hour events in such a room, and invite people, and they talk and go away. So I became curious, then I asked myself, so if we're talking about knowledge, if we're talking about competence, if we're talking about skills, how are these going to be learned in such a setting and in one session? And I found literature that supports this, which shows that passive financial literacy strategies have actually not had a big impact in as far as financial well-being and economic empowerment is concerned. And I also found literature that supports active financial literacy strategies. Unfortunately, most of this literature, the one that supports active financial literacy, does not, is limited in as far as looking at the impacts of financial well-being and women empowerment in particular. So I then set out to look at the impact of gamified financial experiment or gamification experiment on women's financial behavior as well as financial well-being. And the contribution of my study will be that we will be able to test the delivery of financial literacy in an interactive and engaging way, and hopefully be able to inform policy and inform strategies like the National Strategy for Financial Literacy. So for the research strategy, the study will employ a randomized control experiment, and this will be restricted to the central region, the Greater Kampala region, which is Kampala and its surrounding 5 surrounding districts. And the reason for this is because this is the region that hosts majority of the government projects, which means many projects here have been piloted, and women around these areas, though we are targeting semi-urban areas, have a higher level of business activity, and that's exactly who we are targeting. We shall randomly select 3 divisions from each of the 6 selected districts, and from each division we shall also randomly select 3 parishes. And from each parish we will work with the local councils to select and access women groups and the list of women groups, and from these we will randomly select 3 women groups to act as clusters, giving us 162 clusters. And we are also, in these we are targeting a sample of about 4,000 individuals, given that each saving group has between 25 and 40 women. The experiment will have, we had previously looked at excuse me. Oops. I'm trying. Not working. Oh, thank you. Yeah, so for the experiment, we are looking at, we had previously looked at only having 2 treatment groups, but we have added a 3rd treatment group and 1 control group. So in the control group, we will have passive learning, and in the 3 treatment groups, we will have active learning, with 1 treatment group looking at only women, the second one looking at only men, and the 2 looking at the combined participation of men and women. Reason being, we wanted to measure the household dynamics and how these household dynamics do impact financial literacy and financial well-being. So for the game, we are looking at a board game experiment, which is a physical game. In this, we will have 2 sittings for the instructions of the game. We'll have 2 sittings per month. The game will be 2 sessions per sitting. We will have fake money as startup capital of 3 million Uganda shillings, which is within an acceptable range. Of course, after looking at, after doing some research, we had this money a bit higher than this, and we had to reduce it to kind of fit the kind of characteristics, sample characteristics we are looking at. And we will have assets. Okay, and in each asset, we will have a card that represents the asset, and we will have participants play 5 periods, and each period will represent 1 year. And they will play for a maximum of 2 hours. And for each session, we'll have 2 sub-sessions. The first 1 hour will be the time to play the game, and in the second one, we will have more of a discussion, because we want to, one, do observations, but secondly, we also want to have a discussion from what these women have learned. So fast forward, this is how the games are. For on the one hand, we have the asset card, and this could be one of the assets, maybe the stall, which is an asset, and we have instructions. And on the other hand, we have the demand shocks. And in the demand shocks, we just wanted to mimic this to kind of show what happens in the real world. So, for example, for an asset which is the market stall, we show how demand shocks in such kind of an investment, or investing in an investment like that, would probably affect the returns on this asset. Here are my expected outcomes. Yes, I know I have 1 minute. Looking at basically primary outcomes as a financial literacy index, the financial behavior index, financial well-being index, and a bit of heterogeneity characteristics, which include age, income, etc. I don't know why it's not showing down here. And going forward, we have, like I said, we've started on a pilot. And this pilot, we've partnered with one of the financial institutions called Abitrust. We are targeting between 400 and 500 of their clients. And the pilot actually started this week. And we will have a baseline in December 2022 with 2 endline, maybe we could call them midline and endline studies. Thank you very much.
All right, so let's have one question, please, and if you can be brief. Thank you.
Thank you, really interesting experiment. I see that you're going to kind of incentivize efforts in the sessions through competition. You should look at the experimental literature on women shying away from competition when they're competing against men. I'm worried that in your women plus men treatment, that could confound like the effects that you're interested in at the household dynamics level. And that you may want to think about keeping it constant across treatments against whom women are competing, and that you have maybe like women-only competitions and men-only competitions, even in the mixed treatment.
Thank you so much. That doesn't sound like a question. I'll come to you for further discussion on that. Thank you.
Anybody has a burning question or comment I can keep under 1 minute? Okay, thank you so much. Okay, our next presenter is Dr. Merceline Kamande, who is a senior lecturer of economics and the principal of open, distance, and electronic learning at Mount Kenya University. She will be discussing her research entitled Exploring the Use of Mobile Money Services Among Tea SACCOs in Rwanda. Welcome.
Thank you so much, and good afternoon to all. Yeah, the research that I want to present is a research that we did between 2019 and 2020 here in Rwanda. The research team was comprised of researchers from Mount Kenya University and University of California in Nice. If you can go to the next slide, thank you. Yeah, the structure of the presentation, I will first give an introduction, and then I'll give the details of exactly what we used to do as presented in that structure. As a way of introduction, this research was built along something that had been done by an institution. This is a finance institution which is called African AFR here in Rwanda. And what they had done is that they had instituted a project that was meant to automate some SACCOs in the two rural districts in Rwanda. And the automation focused on those two. The first one is in a place called Mulindi, and then the other one is in a place called Rusizi, and it serves two districts. And what the institution had done is that they had automated the banking operations of these two SACCOs, and the intention of this study was to assess what this had done to the members of the SACCO, and in terms of what benefits did they get, and of course we also looked at what spillover effects they had on the cooperatives. I need to explain here that the the T-Circle in Luanda is built allowed cooperative. So each of these circles was serving a certain group of, or rather distinct group of cooperative members. So both the membership of the circle and the cooperative were related, although they were two different cooperatives, which maybe I don't want to go into the details of. And what were we looking at in terms of the research questions? We wanted to look at how the demographics and the socioeconomic factors that affect the uptake of the mobile services in Rwanda. And then we were also concerned with how the cost and benefit, or rather what are the costs and benefits to the farmers who are using these services. Then we were also interested to know the factors that limit the access and usage of mobile money services. Then we also looked at the value propositions from different stakeholders in terms of like what can we do to be able to improve the usage of the mobile money services. And we also looked at how we can be able to increase value for the users. And then we also looked at the regulatory framework. And each of these questions targeted different respondents. So we were able to talk to the farmers, we were able to talk to the banks that are doing the mobile money, we were able to talk to the regulators, we were able to talk to quite a number of institutions. And now one thing that was unique about this project is that we started off in December 2019, and within 3 months there was a COVID interruption. So we factored in a set of questions that were able to capture that kind of an interruption. So the methodology that we used was mainly qualitative in nature, and the major methodology was actually diary studies, where we were able to follow these farmers for 6 months. We used to do a dialysis for every 3 weeks in 3 cycles. And then in addition to that, we were able to do surveys with different members of this group. And then we were able to have interviews with the different stakeholders that I've already mentioned. And in terms of the daily studies, we were able to reach 101 respondents. Of course, the focus groups and the dailies, there was a bit of overlap, if I can put it that way, in the sense that they were members of the cooperatives that we were dealing with. And the main data that we collected was qualitative, with some small portions of quantitative data to take care of the demographics. And then we also used a lot of observation and documentary review. Again, as I talked about interruption, data was collected. The first 2 rounds was collected face-to-face. Then the last cycle was done on through telephone interviews, because we could not be able to travel to the respondents. We looked at, or rather our data was presented in 6 themes, and presenting the findings in terms of themes, in terms of demographics, we found that age and whatever we call the Ubudehe categories. Ubudehe is a demographic classification in Rwanda, which ranks people into different groups depending on their socioeconomic status. And we found that age and Ubudehe categories were main significant factors in influencing this. And key among them is that we realized that older research participants were less trusting. There were a lot of trust issues with the older respondents. And this group, because of this trusting, the ones, the younger, the younger participants were able to trust the services more. Then the other thing is that there were a lot of security concerns. This was across all the groups. And some of the things that came up with the security concerns is that some other people were sort of forced to share their PIN numbers in order for them to withdraw this money. And maybe to clarify here, it's like what they used to receive through the mobile money was their salaries, or rather their wages, or the wages for the pickers, and also being able to draw money from the banks to their mobile money. So whenever they need to withdraw that money, then if I am not able to access that service, then I'll be forced to give out my PIN number, and the agent will do for me, and that caused a bit of security concerns. The level of literacy was also quite an issue, because the other folks who were by and large of a lower digital literacy then were the ones who used to share that. And then the other finding was that men had access to more mobile, or rather they had access to phones more than the women, and therefore they were able to access the service more. The cost and the cost and benefits. The key thing I want to highlight here is that the members really appreciated the fact that when they get the money, whatever money they were being paid, they was able, or rather they were able to see it in their phone, and that was a benefit to them, because again, they didn't have to walk to the banks to get this money from their accounts. They were able to receive it in their accounts. Then for the SACCOs, they were able to reduce the cost of payments, because before what they used to do is they used to go to the farmers, but when this was automated, then they were able to actually send this money from their offices, and that was a benefit to them. Then, especially during the COVID time, they were able to actually take advantage of being able to pay services through the mobile money, and that again was good for them. Number 3, in terms of the limiting factors, I think I've already mentioned some of them. Poor network was key. Digital illiteracy was another one, and unreliable availability of money from the agents. And then the issue of trust issues was also a major issue. And then the agents also reported that they were running out of money quite frequently. So that was also a limiting factor to the use. In terms of the various prepositions, the main thing was here the issue of the network infrastructure. And I think this was something that we recommended, that the mobile money providers need to work on that. And then the issues of how the agents again interface with the mobile money operators and the banks because of that. And there's something that the BNL was coming up with the issue of non-exclusivity of the agents, which again, there were mixed feelings over how that benefited some of those agents. Moving on to how to increase the value, I think that's more of what I have already talked about. If the providers are able to actually tackle the issues that were found as limiting factors, then that would make the service more usable and more beneficial. I think, again, that also touches on the regulators, how they can be able to improve on the services that they are giving to the mobile money users, and that is mainly by making the service more acceptable, more secure, and more available to the members. So finally, we want to just conclude to say that there's need to reduce the inconsistencies in network availability. There's need to increase the security, and also to have more mobile money agents. Thank you.
Thank you so much. Do we have a question or a comment? Okay, thank you so much. Oh, there was. Sorry, there's one more question maybe. Let's just get it. Please be brief.
Thank you very much for your good presentation. For me, my question is about sample and the sample size and sampling procedures. You mentioned Simple-random and the non-simple-random, but we couldn't hear how simple-random could fit in that context. And maybe for non-simple-random for qualitative studies, which one did you use and why? Thank you. Yep, go, please.
Okay, now the simple random was mainly done for the diary study respondents, whereby we got the list. This was actually a systematic random sampling, whereby we got the list for the members of the circle, and then we were able to pick our diary respondents from there. So, but all the others were for the, that's for the diary studies, but for the focus groups, for all the other methods, then we use the non-random.
Okay, our last presenter is Oscar Barija Cabanillas, a consultant at the World Bank, working on the poverty unit of West Africa, and he will present on his research titled Impacts of Airtime Loans on Network Usage and Communication Expenditures in Haiti. Welcome.
Well, thank you everybody for staying until the end of the session. Better now? Okay, thank you everybody for staying until the end of the session. This is a paper that studies the impacts on expenditure of airtime loans in the context of Haiti. Okay, so I'm not going to repeat what has already been said. Pretty much, there are very few formal credit lines that are able to finance consumption, and digital credit offers innovations that allow people to access these small consumption loans that otherwise would be too expensive for a regular bank to provide. I'm going to focus on airtime loans, and as David mentioned at the beginning, this is a very simple form of digital credit, and it's aimed at prepaid subscribers. So how does it work? You have a prepaid account, you can borrow money that you cannot convert into cash, but you can use it to finance your cell phone expenditure. These are very small loans, less than 50 cents, and maybe it's important to highlight that they are very popular with prepaid subscribers for two main reasons. First, they provide airtime if a customer has no cash, and second, they are convenient because even if you have the cash, you don't have the need to go and find an agent to recharge your cell phone account. You can just add credit directly from your phone. And maybe something that I would add is that they are very popular with cell phone companies. Pretty much any cell phone company that has a prepaid plan is offering an airtime loan package. And the last thing that I would add to the information that has already been said about airtime loans is for many people, they constitute their first formal financial transaction where they receive a loan from a formal lender. They're not considered lender, but they receive a loan, they see the fee, and they can pay later on. So the two questions that we want to answer today are the following. The first one is, what is the impact of having access to digital credit on cell phone expenditure? And the second is, if we see heterogeneous impacts depending on the subscriber's financial constraints. Some key features that we need to understand about airtime loans that are going to be key to understand how we implement the study. The first one is you have access to the airtime loan, in the case of Haiti at least, in the 5th week after you activate your number. You receive a single loan offer that it has a fixed fee that is around 11%. You have 30 days to pay this loan. However, we see that most loans are paid in less than 5 days. And they don't have a collateral in the conventional sense, in a way that if you do not pay your loan after 30 days, the only cost is that you lose access to your number. Of course, you can go and find another SIM card, but the number that you had, you lose access to that number. Okay, so to implement the study, we use detailed cell phone records where we can see every cell phone transaction, and both when people recharge their accounts and when people request a loan. And we implement an event study design where we use the loan eligibility rule of the 5th week after line is activated. This means that we only see a change in the eligibility status of new subscribers. So what we do is we have data covering most of 2019, and we see new line activation between March and July, and we follow these new lines for 16 weeks, and we measure the change in their expenditure and network patterns after the 5th week when they are eligible for the loan. Additionally, we have a set of what we call well-established lines. These are lines that have been active in the network for more than a year, and we use them to try to control for different usage levels due to seasonal changes or due to different events that happen in the country that change how people are, or how much people are using their cell phone accounts. Okay, in terms of results, on average, what we see is that having access to airtime loans increases expenditure by 16%. And this is on top of the fee that people are paying. So having access to this warranty form of digital credit actually crowds in additional resources. The second result is that, of course, people are spending more, and this is related, and you can see that now they not only, now they contact more people, but they also have more frequent contacts with people. And we see this as evidence that they were passing on calls before they had access to the loans. And something that has been a common concern with digital credit products is that this easy access to credit can drive, can increase expenditure in certain goods such as gambling. And in Haiti, you can spend money, you can gambling using your phone. We do not see that having access to airtime loans affects at all how much people are gambling in their phones. And believe me, people gamble a lot using cell phones in Haiti. Okay, so now we try to understand the mechanisms behind these results. And we think three mechanisms might be at play. The first one is that airtime loans relax liquidity constraints. Think about it this way. You do not have money in your pocket, so you request a loan, so you're able to make a phone call. Even if you do have cash in your pocket, since you are not sure how much money you're going to have at the end of the day, you'd rather keep the cash in your pocket instead of making a phone call. Airtime loans relaxes that. The second mechanism is that airtime loans lower transaction costs in the sense that you need to go and find, in the absence of airtime loans, even if you have the cash, you need to go and find an agent to recharge, and that's a transaction cost. And the final one is that airtime loans reduce the salience of the cost of calls. That is, in the absence of airtime loans, you have to go and pay with cash before you make an additional call, and that makes salient how much that cost is going to call to you. We have no reason to believe that a single mechanism drives the full effect, and with our data, we're able to explore mechanism 1 and 2. With respect to airtime loans relaxing liquidity constraints, we lack a direct measure of financial conditions or income status. However, we see that the expenditure in the network is related with socioeconomic status. So what we do is, under the premise that expenditure levels before airtime loan access is, before a phone number is eligible for airtime loans, under that premise, we create terciles of initial expenditure that we assume they reflect economic capabilities. So people that before the airtime loans are in the first tercile of expenditure, we consider them low income, and people that are in the third tercile, we consider them higher income individuals. And then we test for differential impacts on credit access. Something to mention first is that we do not, to understand the result that I'm going to show you, we need to take into consideration that we do not see that between low and higher income individuals, the borrowing rates differ, and we do not see that loans finance a different share of the total expenditures. However, when we go and explore the impact on total expenditure, you can see in this figure that for low-income subscribers, access to the airtime loans doubles their expenditure, and again, this is on top of any fee they might be paying for the loan. So for them, this form of warranty credit actually crowds in and is a catalyzer for additional expenditure. Of course, with additional expenditure, they talk more, interact more in the network, and again, we don't see any effect on gambling. And in the case of high-income subscribers, we do not see that airtime loans affect how much they're spending in the network. The second mechanism that we explore is convenience, and we divide convenience into two different type of convenience. The first one is that you're gonna request an airtime loan if it's very difficult to find a person in the street to recharge, and there are in every single corner in Haiti. What we see, how we try to test for this is to see at what time airtime loans are requested, and what we see is that 95% of the loans take place between 6 a.m. and actually 7 p.m. That is the time where it is the easiest to recharge in the street. You just have to open the door, go to the street, and you can find someone to recharge. That's not difficult. So we believe that this type of convenience is not the main driver of loan demand. So the second element that we explore in terms of convenience is that maybe having access to airtime loans allow people to strategically adjust their recharge patterns. So they have money, however, still it's inconvenient to go and find someone to recharge, even if it's easy. So since I can take an airtime loan, I just simply, I can more freely choose when I'm going to recharge. To try to see how airtime loans affect recharge patterns, we leverage the recharge data, and we try to see how recharge patterns change after airtime loan eligibility. And what we see here is something that is the following. For poor subscribers, we see that access to airtime loans actually, they recharge, when they have access to airtime loans, they recharge more times a week, but also their recharges tend to concentrate towards the end of the working day. And we argue this is showcasing a cash management strategy that is at the end of the working day when you have the uncertainty of how much money you're going to need or you're going to have in your pocket resolved, so you can go and just recharge at the end of the day. In the case of non-poor subscribers, we see the opposite. They recharge less often, and we see that the recharges toward the end, that actually what they do is they reduce their recharges, especially at the end of the day. And we argue in the paper that this shows different cash management strategies where poor subscribers try to keep their cash until the end of the day when they know that the uncertainty about if they're going to need to use it in other things is resolved, while non-poor subscribers use it as a way to simply more freely choose when they're going to recharge. So some final thoughts. The first one is that low-income subscribers find smoothing cell phone expenditure challenging, even if it's a small percentage of their total budget. And we argue that this is related to short-term income cycles that create cash management challenges for them. And when you provide a guarantee form of credit, actually this allows them to manage their cash in a different manner. And one argument that we do is, or that something that we need to explore more, is to which extent this applies to other forms of consumption. Of course, if you have out of your total budget a particular product that you have a guarantee form of credit, it's gonna affect the behavior in that particular product that is cell phone expenditure. But we need to explore how this happens, how this takes place when these warranties form of credit expand to other types of consumption. Another point is airtime loans is a first step for financial inclusion. This comment is a bit dated because now you can see the big explosion of digital services around Africa. However, in Latin America, and particularly in Haiti, there's no digital product such as the ones you see in Africa. So when we started this project, airtime loans was a first step toward building this form of financial inclusion. And another point that we would like to discuss is we see that even if cash management is a reason for loan demand, we see that convenience also drives a large part of the demand. So that's something that we need to explore in terms of product design. For example, we saw a paper when just delaying how much time it takes for you to receive a loan affects if you're going to accept it or not. Well, thank you.
Thank you so much, Victor. Okay, so one question or comment, please. Yes, Bunmi.
Thank you very much, and thank you for the wonderful presentation. Actually, it's amazing to see that some of these things we overlook on our phones and just do on a daily basis have been contextualized here. I just want to find out, there's this, I don't know how it works in Haiti, but in Nigeria, a lot of us actually, when you run out of credit, there's this 606 that will call you. If you want to borrow credit, you borrow credit, and then you repay later in your next recharge. But somehow they charge us. If, for instance, I borrow 1,000 naira, and when I'm recharging next or something, I pay the payment to they'll give me 950. Yes, they'll give me 950. So when next time I recharge, I'll recharge 1,000 naira to pay off. So I don't know how you account for that. That's different, the interest on the airtime loans.
No,
specifically. Thank you.
Thank you for your question. The process is very similar. Actually, you have digital credit providers actually have two ways of charging you like the fee. The first one is you borrow 1,000 and they give you 900 and the fee is already included on that. Or they, in the case of Haiti, if they're going to give you 1,000, they actually make that the next time you recharge you have to pay 1,100. So that's the way it works in Haiti. Again, this is the conditions of the airtime loans in the country. I'm not arguing this is the conditions that airtime loans have in every other setting, but in particular case of Haiti, the loan has a fee of 11%. You can pay it out up to 30 days after you request the loan, but we see that people pay the loans pretty quickly in less than 5 days.
Thank you so much, Victor. Okay, so we are going to go for coffee break. I've been asked to remind those who are presenting their posters to still do so. And for anyone who would like to learn about the fellowships that SIGA runs, Maya will also be by the posters if you want to take questions. And of course, the rest of us who've also experienced the fellowships would be happy to answer your questions. And then we'll come back at latest, please, 3:25 in the main room for the parallel session on data privacy and digital financial services towards responsible, and Dan is going to be the one emceeing that. And then the small room downstairs will have the session on agriculture and environment, and I'll be emceeing that. So we can go do a coffee break and poster sessions. Thank you.
We're looking for the panel on agriculture. That will be taking place downstairs. Just want to make sure everyone's in the right spot before we get started. All right, thank you, everybody. Has everyone had a chance to get some coffee? I know it's been a long 2 days. Thank you for bearing with us. We're getting to the close here, and I hope everyone's got some energy left in them to stay engaged, to ask some good questions. Be prepared. I'm excited to introduce this panel on data privacy and towards responsible innovation. My name is Dan Casera. I work at SIGA. I help run our financial inclusion programs. And in particular, that includes a new focus on data privacy. We just closed our first request for proposals and will be starting to fund research on the topic later this summer. So I'm very, very excited to have this discussion. For SIGA, what we're interested in, this is about evidence to policy. We're very interested in, one, understanding how people conceive privacy. What are the technical solutions to privacy-related problems? And then how can we use that to influence policy and to drive innovation, things that we can't do today? I'm going to introduce our moderator, Sekou, and then he will introduce the rest of the panel and we'll get started. First and foremost, I'm excited to be able to start calling Sekou a friend of the program and a friend of SIGA. One, because of his background. He holds degrees from the Georgia Institute of Technology and from Morehouse College. He is a research scientist and technical lead at IBM Research Africa. He's written a paper on data privacy that was very influential for SIGA's own conception of how to start thinking about privacy, particularly in the nature of understanding what does privacy mean. And also, in the short time I've known him, just a very quality human being, the type of person who comes in the morning and check-in's a mess, and some of the name tags have gotten messed up, and as soon as he grabs his, he's trying to rearrange and make sure that everyone else is in good shape. So I'm really excited to turn this over to him and his expertise and the esteemed panel. Unfortunately, the Honorable Minister Irir could not join us this morning for health and personal reasons, or this afternoon, excuse me. But really excited to get started, and I'll turn this over to Sekou and the rest of the panel. Thanks, everybody. Can you give him a round of applause?
All right, thank you for that very gracious introduction. Good afternoon to you all. Welcome to the most important panel on security, privacy, data, all these other things that you could be at right now in this room. Okay, that was a joke. But it really is important. There's an esteemed panel here sitting up on the dais. However, each of you has an opinion and has a role in this privacy question that should never be discounted. So, towards that end, and also to help us wake up a little after having some time out, I wanted to actually pose a question to you, and I'll get some assistance from those with the microphones. So, it's not a very scary question, but I do want you to reflect on it for a little. When the microphone comes your way, don't shy away. I want you to answer this question. Can you give an example of data that you think is private? Right? Can you give an example of data that you think is private? So there are a few microphones in the room. Okay, I see we have one volunteer. I like this energy.
Of course, my PIN number for my bank account.
I think emails.
Well, I actually think that there is no private data because whatever you have, I think somebody else has it, whether a computer or a person. My PIN number, for example, I think the bank has it. They can't use it for bad reasons, but they have it, so it's not private.
I think health records are private.
Okay, where are we? Oh, we have another here. We have one here.
Excuse me? Bank details.
Okay, I like it.
I think private data depends on who owns the data, because even the email, the passwords that we put in our phones, someone has the clue about it. For example, if you forget it, someone knows how to recover it. So there's no private data. Thank you.
That's a good one. Who do we have? Yes.
My phone number.
I like it. There are some who are now thinking about this. Wait, how is my phone number private? We have another.
Data of the patients.
Patient records?
Yeah.
Okay.
I think data is private. Each.
All of it. All data.
All of it.
There are people in this room that are wondering. I am happy that there's been so much engagement. We can spend hours on this question, but I want to give us time to actually cycle as a panel. And I hope that this stimulates the questions that you have for us. So let me briefly introduce the esteemed panel with the apology that we are all male here at present. So as Dan indicated, our most senior ranking member isn't present. However, my hope is that the next time such a panel is convened, we're not just talking about parity, we're talking about complete representation. In this message, in this moment. But if you forgive us for today, we can proceed? Yes? Okay, thank you. So first we have Dr. Said Ngoga, currently the Technical Innovation Division Manager at Rwanda Information Society. Thank you. Next we have soon to be doctor. Let me speak that into existence. Mutembesa Daniel, a research scientist at the Artificial Intelligence Research Lab, Air Lab, at Makerere University. Next to him, we have Fred Otieno, a research engineer at IBM Research Africa. And next to him is Martin Gordon Mubangizi, a data science officer at the UN Global Pulse Lab in Kampala. And just as we have this discussion, note that many of us are coming from strongly technical backgrounds. So if at any time we forget and we do not say something that actually is in English, or understandable, I should say, pause us and say, what is that acronym that you just used? AI? Is that artificial intelligence, or is that something else? Pause us, it is okay. We want to have a dialogue. We want to make sure that we are all together. All right? So, I will first jump in with a question for Dr. Said. As the Rwanda Information Security Authority works to support the digital transformation that is happening here, what types of privacy harms do you consider? And we have just had a small sampling of the things that some of this audience have suggested are private. Can you mention how some of those may be related?
Thank you. So I think some of the participants here have already touched on different, how they perceive the personal data or the private data. So on the government perspective, so coming from the agency that is in charge of digitization, or at least anything related to the implementation of IT project. These are government IT projects. So there are people who just mentioned like your data is almost everywhere. So for us is, as much as we are trying to make sure that I'm just talking mostly from the government side, as much as we want to provide or we want to give the citizen this, at least a safe, or making sure that they can access the services, just government as a service provider, making sure that we put our services to the citizen and making sure that we can provide this one government experience where you just see like government as one unity, and the services, you can receive almost everything you need from birth certificate, marriage, or any type of document that you may require from the government. So you see that there's a lot of information. As much as we are trying to combine or integrate or put all these information in one place, in itself is already a threat in some way, because there's a lot of sharing of information from one institution to another institution. So that is one way of I could put it. The second is, this is on the side of access and the sharing. The other is just even at the service, when we're providing this, when we are receiving these services, yes, your concern is to make sure that the system or the data is already in a is secured, but also to make sure that the platform or the website you are accessing, it has also the capability to protect the information you're being provided. So these are some of the examples. I could just put it in a two category. Every time you're accessing a system, you are providing information, but the system should be able to guarantee the safety of the data, but also should have the capacity to also protect your privacy, your right to the privacy as well. All those two categories I want to put out. Thank you.
All right, thank you very much. So it is not by accident that this panel is focused on data privacy in the lens of and digital financial services. Why is that? When we look at motivations for anything to happen, there has to be a driving factor, right? Financial services is one of the strongest, most pressing, call it levers, that is increasing the need or the desire to process data. Yes, there's the Evidence Summit side, and we are all here from an Evidence Summit perspective. But beyond seeking evidence to justify or to verify that something is working or not, there are also needs around understanding what might be the pulls, what might cause things to be used. In financial services, in many countries, artificial intelligence is already being there. It's under the services, under the covers, in the background. Because data is very linked to AI, we have to understand how privacy factors there. In that regard, I am going to then reach to my brother, Mutambeza. So, in your past work, really cool work that has been started in Uganda, there's an element of applying both quantitative and qualitative perspective to tap into what communities are saying using AI tools. What is AI? Artificial intelligence. Basically saying, can we write programs that have the ability to tap into data, whether it's social media in the way that we think of Facebook, Twitter, whatever, or social media in the analog world? What is that, you ask? Radio. So, can you speak about some of your work in that regard?
Hello. Hi, guys. Yeah, we want everybody's attention on this. So let me get a sense of how many people understand what artificial intelligence is, have heard of it, machine learning, data science, anything. Please, just raise your hand. Okay, so we have a fair bit, and thank you for just giving me a perspective. I'm going to answer that question or tackle it backwards. So I'm based at the Makerere University Artificial Intelligence and Data Science Lab. Also, some of our work has been AI or artificial intelligence in agriculture, where we're doing automated crop disease diagnosis, where you have to actually go out to the farmers, collect vast amounts of data, have them in a response system, and those images, then you do some machine learning on them. Then we've also done, crop disease monitoring. We've done things around, you want to listen to a community. There are 100 radio stations, 200 radio stations, different languages, discussing about their problems. How do you tap into that? with a machine learning natural language processing model that can listen and ear peek specific topics of interest per community in context. Several other things in livestock where we are developing low-cost tools for pen-side or disease identification. But really, one of the things that I have found, and I am very honored to have come here, is impact evaluation or impact evaluators, which you are, is far, far removed from the developing field, the fast-paced innovation developing field of AI, machine learning, data science. There is a stark rift. There is a stark rift. So I am going to poke the impact evaluators here that you really reach out to these, because these innovations are affecting communities at scale, unprecedented before. And so it's one of the things that I hope will be a resolution from here. And the way to look at that through one of my research projects has been look at the entire scale of fairness, accountability, transparency, and ethics, so FATE, where data privacy is one aspect of many other things, okay? It doesn't profit, it doesn't matter whether the data is private, as long as if it's unfair or there are unbiased outcomes, okay? You still get, that disparity in where you want. So, yeah, so some of the things that I really noticed, just appreciating some of the presentations that were done by, say, Dean Carlin, and he was saying structured ethics, like the IRBs that you do, far, far behind and far removed. If you're deploying AI, if you're deploying AI models or data science models at scale, by the time you get through an IRB, which is a couple of months, the damage is already done. So I wanted to know, and this is me asking because we're from a technical perspective, we want to listen to also what evaluators, impact evaluators have to say. I wanted to know, are there fast, throughput, M&E, impact evaluation, toolkits that, that do this on the go rather than, are at the end of a service? And so that's one of the things that I hope that you can look into. The other piece of work that has been central and is currently ongoing is, are there alternative ways of using data, say for social credit scoring? And we really need impact evaluators to be able to guide prior to, to the deployment of things like these, where so we are using social credit scoring, social knowledge to do credit scoring and sort of extend that. So we need you. I think one of the things that is an outcome for me is we need you even before the process, in the design of the algorithms. An algorithm is just, a procedure that you put into, basically a step to do something that you put in a computing segment. But we really, really need you. And this is prior and in the process of modeling and development as impact evaluators. Yeah. To wrap this up, my perspective is, data privacy as one of the ways, as one of the ways to capture it has been to closely work. If you're innovating, you have to be able to closely work with two parties. One is the local beneficiaries, and two is some sort of oversight, okay? And one way that this, SIGA, the Evidence Summit, and all partners can start looking into is actively looking at developing frameworks that facilitate that conversation between, hardcore technologists to the policymakers, to the beneficiaries. There is definitely a gap here. Yeah, so that's a hard line, which is a hard problem and challenge, but I think this is one of the directions that such community should focus. So thank you. I yield my time.
All right, thank you, Mutambisa. So one of the things I'd like us to also reflect on, we're in an age now, just as was mentioned earlier today, where cell phone penetration, whether it's the feature phone or the smartphone, is significant. Accordingly, it's very easy for information to be shared. Now, just because it's easy does not mean that it should be done. And in many cases, whether we're talking about it from where do you get the data to base your recommendations from an evidence perspective, or where do you get the data to understand what is actually happening? There are things that we have to think about now just because of the rate at which information can be collected and shared. All right? So with that, I will turn to Martin. So beyond the fact that you are at Pulse Lab, and beyond the fact that it has conducted data and privacy projects, you are also intimately aware of the process of informing how policy is drafted, presented. You have worked with the government of Uganda to create policies. Can you speak a little bit about that? And any ideas that you have about even the process of adoption, increasing adoption in this space?
Thank you, moderator. Yeah, so I work with Pulse Lab Kampala, which is part of a network of labs with other labs in New York, Jakarta, and Finland. And we have, since 2015 when I joined the lab, we have been working on trying to identify data sources that can inform the achievement of the SDGs, basically non-conventional data. And so our major focus was artificial intelligence and big data. And we know that a lot of data is being collected and is in the hands of the private sector, which could be very useful in measuring the progress of the SDGs, but also other development frameworks. So what we did earlier on was to try to engage the regulators of the telecoms, to engage the telecoms themselves, and the Ministry of ICT and National Guidance to try to understand the kind of conditions that needs to be met and what kind of incentives the telecoms would need to basically share data for social good. But of course, one of the issues was privacy. But at the time, one of the other issues was about whether it was legal for them to share the data. So we then worked with, but even in those conditions, we were able to access data from telecoms to demonstrate how this kind of data could be useful for social good. And the data we accessed was aggregated. So there was no personal identifying information. Then also the government at that time was trying to come up with a data privacy and data protection law. And so there was a bill in Parliament, so we supported the ICT Committee of Parliament by bringing down experts to tell them about the best practices that they should include in the law. We took them for a benchmarking visit to Mauritius, because Mauritius, has, I think now they have their second version of the law. And so then we also provided some comments to the request for public views on the bill. And so we are happy that in 2019 the law was enacted, and then in 2021 the Personal Data Protection Office, or the regulator, was actually put in place. And the regulator, the office, has actually done a lot until to date, but there is an issue of awareness and literacy, So one of the ways we are trying to support government in this is by using a use case, a data sharing use case, And using this data sharing use case, it would help us to engage with the data producers and but also engage the data users, because we want to build a data exchange platform which will try to match the data producers and the data consumers. And we hope this is going to enable data sharing between, within government, but also business to government, government to business, and business to business. Because the engagement we have had already, it shows that there is a lot of interest, you know, on all the sides. And we know that also the private sector has needs data that is in the hands of the government. So that is what we're trying to do, and we think this is going to help us discuss these privacy issues and how privacy can be handled such that data is available in the data exchange platform. Thank you.
Thank you. So it's interesting to me, and I hope that you all feel this. As we talk about this concept of data, we are implicitly having a conversation about privacy. One of the elements of this is also an unspoken element of trust. All of the institutions that have been mentioned so far have to rely on some part on trust. And in this data space, if you are not able to protect your partners or your clients' privacy, that's gone. It is very hard to stop that cart once it has stopped rolling down the hill. Once you have lost trust, it is very difficult to rebuild it. And since we're talking about trust associated with data, in most cases, once the data is gone, it is gone. Meaning, it can be on the other side of the world before you even know that it is missing from your database. All right? So with that said, it's probably the case that we need to think about systems that can help. There are two elements of this, and first I'll ask Fred to speak about some of his work in this concept of having workflows that share data through multiple stakeholders, multiple users, multiple timelines, maybe even for multiple purposes, because that's an important part of this whole process. Fred.
Yeah, so really when you think about trust, I'm just going to take us back to some of the comments from the previous session. So there was a question about the predatory credit lending, digital credit lending applications. And there are cases in Kenya where you'd find if you have defaulted on your loan, the app would actually send messages to all your contacts. And that's just public shaming, and it's terrible. And when now you think about what is privacy, because actually we were asked that question, and from the audience itself, we found different answers to this. There are those who are okay with sharing all the information. There are those who are not okay with sharing all the information. So there now comes the question of, is my data safe? If I've given you my data, what are you going to do with it? And then finally, have you consented, or rather, has the user consented to having their data processed and collected? So this question is kind of a conundrum, because actually you have to bring in the regulators who will oversee that the people who are building these applications or who are building these technologies actually follow a specific framework that does not exploit the end user. Because you can think about Mutungi Olo somewhere in Nairobi. It's in these times when the prices of food is increasing every day, someone would be pressed. I need to get that extra 10,000 shillings so that I can maybe buy something for my family. And they'll just go into the app. Maybe they won't just, since they're pressed for the need, they'll just do yes, yes, yes. And he has the money, he can buy the food or whatever need it is. But are there any guardrails which these app developers, or rather that ecosystem from the developer to the user, which actually protects the user's data? So there are some few changes which happened. Like in Kenya, the central bank recently passed a digital credit providers regulation, which ensures that all digital credit providers actually adhere to specific rules and regulations. But now, beyond even the regulators, we have to bring it even closer to the people who are building the apps, or these people who are providing the assistance to alleviate poverty, to assist the society generally. So I'll just take it back to now some of my experience as a developer and talk about some of the things which, as a developer, you can put in place which can help provide the trust that the users can actually see that their data is properly used, accessed, or viewed by different parties. So there are several elements. There's an aspect of confidentiality, integrity, and then access control. So in terms of access control, are you providing a means of authentication or authorization for someone to access this data? And then who is given the access based on their role? Because you may have those who are higher up and those who are lower in terms of hierarchy. If you're to, let's say, for instance, take an aspect of, you're looking at a regional administration, you have the provinces and the districts. So the users at the province level probably have the oversight to see what's happening in each of the other districts. But now the users at the district level should not be able to access all the information from the other districts. Basically, they just access information from their own districts. So there are mechanisms of authentication which can do this. So I'm sure everyone here accessing their email, you have to put in a username and a password. And then even for those authentication methods, there's even a level deeper which you can go in, which is providing password patterns which are approved. And then also you can have mechanisms of, let's say, renewing the password every 3 months or so, such that you are able to secure these systems to the best of their ability. But even beyond that, there are new technologies. I think some of us may be using the Face ID, or if it's the biometrics, there's even passwordless authentication, which involves like having a separate app on your phone, which you can use to enter a specific system. So these are some of the measures which you can put in to actually show the user that, yes, I've collected your data, I am protecting it. So even in that protection, when the data is at rest, there are cryptography or encryption mechanisms, which is basically you're hiding that data such that if someone else looks at it, they may not understand the meaning of it. So like, I think someone said my password, but the app user, or rather the app developer may be looking at my password, or the bank knows my password. But in proper development practice, those passwords should be hashed and encrypted such that even the app developer doesn't know your password. But now, this now goes into the training of the developers to actually make them aware, or have them use frameworks which enable them to establish these practices. So those are the three things: authentication, access control, and then ensuring the integrity of the data. Another thing also which is crucial here is data minimization. So you'll find that some of these credit lending apps, they would ask for you, like, I want to access your contact list, I want to access your photos, I want to access your... But if you think about it, does a credit lending app need your photos? Or does it need all your contacts list? So as a measure, you minimize, you just pick the data which is necessary for you at that moment in time. But now, some of these applications may be dubious, and people have other interests. So that's basically, just in a brief, some of the things which when building systems you can consider to ensure the trust of even the users and the community which is using your application. Yeah.
All right, thank you, Fred. So one of the things I'd like to, again, level setting. There are people in this room from many different backgrounds. So I hope in this conversation there are elements that is now piquing your curiosity for follow-up questions. Even those who are studying economic shocks have to be concerned with some of the things that Fred is talking about. If, for example, you're developing an app that is giving people money, real money, using M-Pesa, for example. Right? These are things to think about. The other element for us to actually think about is we're talking about data here, and there's an element related to data sharing, data moving very quickly, and the policy or the legislation may not be able to keep up. We understand that reality. However, there are, and there must continue to be, efforts towards this notion of some attempt to bridge the gap. So, as an example, here in Rwanda, there was a data privacy law that came into effect recently. And I say recently, and we say some few months back. Everything in the COVID time was recently, we know. But I'd like to actually understand, so Dr. Said, what can you say about what has happened since that law has come to bear in Rwanda?
Thank you. So yes, we just recently, this is last year, published our first data privacy law. And I could say that we still need to have a lot to do on my colleague here, Martin, mentioned about the digital literacy or the awareness, and also making sure that at least the public are aware of certain rights that they have already in the digital, at least in the digital world. So one of the main, there has been a lot of campaigns, and this is really, there's still a lot of effort and area of improvement, making sure that the public are aware of the right that they have in vis-a-vis the services or the digital platforms. So, and the law has a certain number of rights. There are about 9 rights, like the right, for example, of being represented. So these are like children, school, at the hospitals. Like the right of not being subject to any decision-making processes or profiling that may be running in the background. Even the right of, so there are at least a number of rights that are there, but also the mechanisms. There are also some certain principles that are already in place to at least ensure that there is a legal or a lawful practice and handling of the public data, as well as the personal, but also I could also add at least several principles regarding the processors, the controllers, all those people who are at least who handles the private personal data. So another thing that the law has put out is also a certain timeline, because we have to agree that this is really a shift of paradigm in one sense, since most of our systems, registries, all these systems that I could say the mainstream system or digital infrastructure were not designed with the privacy aspect into their conceptions. So there is a certain timeline that has put, at least for them to comply, but also for new, we have now like the authority that is in charge of at least putting in place or making sure that this practice is at least as safe and ethical as possible. So mostly I could say that a lot that has happened are on the awareness side and making sure that we have this instrument in place to make sure that at least the new systems that are being designed or deployed at least have this in their original design. Thank you.
Okay, thank you very much. We know that many countries are trying to figure out what works, what is effective, and trust, I hope everybody in this room understands, no one has figured this completely out. So you might hear about GDPR or HIPAA or all of these things in the global north. They're still trying to understand the implications or the ramifications of these things and how to protect their citizens. But let me combine two questions here. Mutembesa, you are one who is exploring this notion of privacy-enhancing technologies. Are there any that you think might be of interest in this room? And at the same point in time, are there research things that you would be excited to see this room champion?
Oh, thank you very much, Sekou, and thanks, guys, for holding, the attention. I realize, panel sessions, very one direction, but please, let's bear through this. So, privacy-preserving technologies. One of the things that we've seen is many of the innovations are moving the processing and the compute to the edge. In other words, as close to the customer as possible, okay? And so this is one of the things that I'm excited to see impact evaluators come and, sort of look into. One of the things has been, if you don't want the data to be over a network, so there's a project that we've been doing called privacy-preserving traffic monitoring at the edge. If you don't want the data to be streamed all the way through a network, which can be hacked and all these things, what you do is that then you do the computing all the way at the camera, okay? And so you just send the metrics that are important without sending, say, the images and the like. So it would be really interesting to see, and of course this is for traffic monitoring infrastructure, but we've seen the same in environmental sensing, okay? Air quality sensing, which we partly do, and all these other things. So we would like to see some of the impact evaluation on the shift from centralized processing to edge processing, okay? So that's one of the things that I'm excited about. I don't know if I covered anything, but I'll be looking forward to hearing questions. Thank you.
Okay, thank you. So again, you heard it here. Evidence Summit, we're asking you all to become experts in edge computing. Do we agree? Okay, let me actually switch then. Last, we are at the end of our formal parts of questions. We're leaving time for you to ask us questions as a panel. But I still wanted to make sure. Now going to Martin. With the right technologies and regulation, for you, what do you think you would like to see? Most excited to see coming out?
So I think for me it's around data sharing. Like I've said, in Uganda we're trying to look at a data exchange for a tourism statistics use case. And in Ghana, we are still in discussion with the ministry there, but also with the private sector and UN agencies there, and we're trying to look at whether we can have a data exchange for agricultural data. So you find that there is a cost of not using data for decision making. You might make a wrong decision that may end up failing your business. But there might be a different party elsewhere that has this data. And the nature of data is that you can reuse it a number of times, It's not like oil where it will get depleted. So for me, what I'm excited about is this data sharing, it's good that the government of Ghana is, the Ministry of Agriculture in Ghana is, Food and Agriculture in Ghana is very excited about it. And we want to see how we take it forward. Equally in Uganda, the idea of sharing data for tourism is also something that has caught the attention of the Ministry of ICT and National Guidance, UNDP, but has also the Ministry of Tourism, Wildlife and Antiquities. So, because for example in Ghana, you will find that there are very many private sector companies, but also different initiatives by the government of Ghana, where there is a lot of data being collected, but there is no sharing of data. So you find someone offering insurance, another person is giving loans, others are distributing farm inputs, others are training people to do bookkeeping, but everyone is doing his work. So what in the end, for a new investor coming into the market, he has to spend a lot of money. Maybe he's working with the same, he's also going to collect data, while data is available somewhere that he could actually use, because for him, his business, his line of business is different. So basically, those are that's something that I'm very excited about, and in doing so, issues around privacy, issues around data governance, issues around incentives will be discussed, and I think that will go a long way to actually support data sharing within the government, because even within government, you'll find that sometimes it's like departments and ministries own data, and they don't want to share with others, while it would actually be good for the country. But also private sector has a lot of data. Like during the time of COVID, telecoms data was very useful in understanding mobility of people. And you could actually know whether the population out there is, conforming to the non-pharmaceutical measures that the governments were putting in place. So this sharing would help us to, do very many things. Even we are thinking of a data strategy for the government. As we are doing this use case, we are also learning and also documenting, and in the end, we have a data strategy for the government that would enable the government benefit from a lot of data that is collected within the country.
All right, thank you. So, in preparation, if you have questions, please raise your hand so that those with the microphones can come to you. But as that is happening, Fred, you and I happen to work at IBM Research Africa. It has been in both Kenya and now South Africa, approaching 10 years. So just as the summit is almost 10 years old, we are there. What things can you say, because you are in this squarely, what things can you say as an engineer? There are some students in the room. You have been a student in this Kigali that you have learned, that you wished you knew in the process of developing software, developing these technologies that people will use related to privacy.
Yeah, that's an interesting question, Sekou. So, I actually just, I was reflecting on what Daniel talked about, Mtembezi, about the edge computing. So there's the challenge that you have organizations, and in certain situations they want to interact, but now people are siloed, like they want to keep the data to themselves. So, and in the age of artificial intelligence and data science, one thing which is coming out which can help in terms of performing the artificial intelligence at the edge and then sort of aggregating the results which you're getting from that, which can be meaningful for both partner organizations. So that's an aspect of federated learning which I think is going to change the data landscape as people look into it. Another thing which is also currently hot is in terms of there's cloud computing, which is basically you have servers which can be accessed from anywhere in the world, and there's now an aspect of how can we deploy applications which can basically run across these multi-region compute services and basically power the aspect of data sharing, because with the various data laws you find that some of them are edged on having the data for their citizens within the region. So that's also an aspect which can unlock the potential of utilizing the various data for applications which can be beneficial for society and the world as a whole. Yeah.
Okay, thank you. I think there's a person here with a question. If you have the microphone, proceed.
Yeah, thank you very much. I want to congratulate the panelists for the interventions. Mine is not purely a question, but I want just to briefly describe what I understand with this digital financial inclusion and data privacy. For instance, in Rwanda, over a couple of years, we have a huge transformation into digitalizing a lot of activities. So if you look at the government services, they are like 100% given on digital services. We have a system called the Ilembo. From the village to the ministries, everything is done through that system. So which means everything is known by the top, from the RISA to the consumers. We have also electricity consumption. Before COVID, people online payment could be 60%, but 10 months ago, now it's 94.5% using mobile phone to buy electricity, and 1% to buy electricity with mobile phone, 94%, and 2% with bank. So which means 4% can use traditional means, meaning that almost everything is digitalized. It's on phone, etc. My question is just to ask the panelists, maybe Saidi will tell me, how do you think that all those digital transactions are first secured? And somewhere you talk about hackers. I don't know what is the magnitude of hackers, and is it that assurance can be like over, because we know that there is a lot of benefit of that. So government get all revenues because the taxi vendors have significantly reduced. We get everything on time because of those digital services. But what do you think that there is potential threat that we have to be mindful when it comes to all digitalizing? Thank you.
Thank you. So I would say that as I can just direct it in this direction. So because already the security of the systems has been really part of one of the requirements, because of everyone is aware about the security threats of the data. So there's a lot of effort. Technologically, there are so many solutions, there are so many ways that can be done, at least the safety of the data. I don't think there's really much, even technically and even on regulations, there's a lot that has been happened. And even most of these systems have already that in their design. Maybe the question could be on as even the topic and all the colleagues here, is more or less on the side of ensuring that these the people can still exercise all their human rights online. So that is really where we are facing a lot of challenges, because our system, when developed decades ago, or all this architecture that we have today, they didn't have that in their conceptions. We really didn't anticipate most of the things we are talking right now when designing, and that's even what my colleague was mentioning, that really no one has yet figured it out, how really we ensure the protection of privacy, the protection, at least ensure the safety of at least these basic human rights being played or provided digitally. So I will just put in that direction, but on the side of security and safety, so today we have really a lot of technologies and solutions on at least that we can assure, or making at least sure that the citizen can trust the system when transacting online. Thank you.
So this conversation could have taken 2 days. We could have spent just on this one topic. Just letting you know it's okay to come and ask us questions afterwards. I think that there may be one question, but where's the mic? Okay, if you can. Yeah.
Thank you, moderator. I just wanted to pick the panel's mind on some issues for us economists. We don't know them about. I hear something called dark web. Dark web, and also I know IT guys, I know of stories where they write algorithms which scrap data from the internet, and then they will customize it according to what you usually shop, what you like, in that when they're advertising online, they send you specifically adverts according to your social life. And some of IT guys, I understand they sell such information to big tech companies. So I just wanted to pick their mind on that. Thank you.
Very spicy question. We'll handle it to the...
Yeah, so in terms of the dark web, basically that's yeah, maybe we can we talk more about it, but it's basically a web interface where people do illegal activities mostly.
Yeah,
or rather,
if I can jump in there.
Yeah.
So in essence, just as we can use the internet for communication, nobody's saying whether that's good or bad, it's neutral. There are, quote, dark places, dark corners of the internet where people go specifically for conversations on things that should not be shared or should not be transferred, etc. Yes, this is there, it exists. There's regulation around it. Also, there are limits to what you can do. It's a longer story. The other point that you're making in terms of, yes, there are actors, and some of those are even in Africa, who are grabbing information that may not be properly protected. So for example, at the Kenya Medical Research Institute, there was an entity that copied data from their record of medications and generated a book, an app, that they were charging people for, while people at KEMRI intended this information to be freely available. And people were downloading this app and paying money. So again, these things are there. However, active regulation and active monitoring and processes are needed to ensure that these things don't slip. But you have to understand, meaning that you have to have the capacity in your organizations. Even though you may be an economist, I urge you to make sure, whether it's a course or two in these technologies, so that we are not caught by surprise. So each of us as I mentioned at the beginning, we have a responsibility in terms of our own data, and we are also in roles where we influence the consumption of data for other reasons. So we have to make ourselves as aware as possible as we can. So whether it's through organizations like SIGA helping to facilitate that kind of knowledge transfer, those things can happen. Reach out. This is important. All right, and I'll pause on that one. Oh, we can take one more question. I love this. The young lady.
Thank you. So my question's not directly related to government services, but to kind of to get at that broader social cohesion and governance. So since a lot of social media apps are kind of directly designed to elevate divisive or outrageous or dramatic content, since that leads to more clicks and views and thus ad revenues, can you reflect on the role of potential regulation or other government policy to potentially shift the business case for some of those social media apps, and if you think there's scope for that? I've heard some interest in a subscription model, for example. Thank you.
Yeah, thanks. So that question is at the center of the tensions that, business cases that are profitable usually are, sort of exploitative. They try to maximize or optimize things, say, around behavior. Once we understand the behavior of a person, we codify that. You can put that in an algorithm. The algorithm can, then, optimize for that particular thing that they want you to see. And the business cases, there's a lot of tension, and there's an entire community known as HCI, that are really, really interested in this particular question. Very hard question. Why we are, succinctly really, why we're here as a panel from the technology side is actually some sort of appeal, okay? Because when we speak to policymakers, they do not understand how we speak. One of the things that I have seen is that impact evaluators are able to communicate things in a way that technologists are not. And so this is a central role that I envision that impact evaluators can play. Yeah, because many of these things are developed in a sandbox, in a black box, implemented in a black box, very far, and when they are, it's very hard, even for other people to really interpret, basically the technology, but also the outcomes. So really, this is why we're here, some sort of appeal that as you move forward, it would be really interesting to see how to connect to technologists so that you're communicating to the policymakers. One last comment, even before I jump out of that. The transition, I was seeing some of the longitudinal studies that you were doing, say, on mobile money, okay? The services that pop up on a mobile money service, MTN, Safaricom, within 18 months of a longitudinal study, have a very, very big, in my perspective, from what I see, have a big effect on, say, some of the evaluations that you're making. 18 months, probably they have produced, some 2-3 new services which are affecting at scale. And when you have a study group that you sort of designed on a specific premise, it's already revolving, and, some of those things are out of scope. So to keep up with the veracity or the velocity of fast-paced, I think you should be having those conversations with technologists at the start. Thank you very much.
Okay, again, I know there's much that we could talk about, but we pause for this moment. We have the opportunity to engage. All of us will be here for the remainder of the day, so please reach out if there are any questions at any point in time. But we thank you for your attention and your participation.
Thank you to Sekou, and thank you to all of our panelists. We're going to take about like a 2-minute break to give the folks downstairs a chance. Don't leave the room. Yes, don't leave the room. We're at about 2 minutes. I'm going to ask the panelists for our next and final session to start making their way up to the front so that we're able to get going and bring us home strong.
All right, welcome back, everyone, or if you were here. Actually, those who've been sitting in this room for a little while, why don't we all stand up for a moment and do a quick stretch. I'm very impressed with all of us for making it to the final session of the conference. So give a good stretch. Sorry. Yeah, we're so close. All right, great. So I thank you. And I know we have a few people still trickling in, but I think we'll get started with this panel because these guys have a lot to say, I hope, and I'm sure, on digital credit, and I really want to hear it. So I've also promised to try and end right at 5:30. So I know we're going a little bit past the agenda, but I think it's worth it, and I feel that there's still energy and interest in the room. This has been an amazing 2 days. Thank you to everybody who's presented, all the organizers. Wow, this has been great. So I'm Carson Cristiano, by the way. I'm the executive director of SIGA. You saw me yesterday morning. Very happy to be moderating this panel, although I'm sad that Suleiman Osman from Innovations for Poverty Action sadly could not be here, so you're stuck with me. But I'm delighted to, yeah? Oh, I thought you said something. So I think we heard a lot of really interesting presentations earlier on the impacts of digital credit. And then we just had a really fascinating panel for those who are in this room on data privacy, which is just such an important topic. This is an area that's very interesting to SIGA. Dan mentioned earlier that SIGA is home to the Digital Credit Observatory. I just remembered that I could take off my mask briefly, which is funded by the Gates Foundation, and our new iteration of the DCO is going to be very focused on privacy. And so for those who are interested in this topic and digital credit in general, please follow along, subscribe to our newsletter. Hopefully there'll be a lot of interesting evidence coming out on this topic in the next few years. So I'm going to introduce our panel, and I'm glad that we're doing this because in addition to the research presentations you heard earlier, I think this is meant to generate some interesting discussion about, okay, what do we make of what we're learning about digital credit? There's been a lot of evidence, new evidence coming out recently. The DCO alone, I think, has funded about 20 evaluations over the last couple of years, but it's a little bewildering. I mean, as someone mentioned earlier, I forget, on one of the last panels, I think it was Suraj actually in his presentation, that it's really encouraging that we haven't seen a lot of negative impacts of credit, but we haven't seen a lot of real positive ones either coming through, and so it's a little bit of a mystery. You know, what the field is evolving so rapidly, the industry is evolving so rapidly, but we still don't really know what's going on. And I appreciated that Sekou, who moderated the last panel, emphasized that understanding the mechanisms, you know, why are things, not just does it have an impact or not, but why are we seeing certain outcomes, why are we not seeing others, is so important. And so I'm hoping that our panelists can help us think about those things a little bit, and also help the researchers in the room think about what should we be prioritizing in terms of studying digital credit. Okay, so now I'm sure you want to know who's sitting up here. So we have Patrick Hiteyezu, who is the Director of Research at the National Bank of Rwanda. We're very excited to have him here. He coordinates macroeconomic modeling and forecasting activities, manages a large portfolio of economic research projects. Before he joined NBR, Patrick worked as a researcher and a lecturer in various research and academic organizations in Rwanda as well as South Africa. He served on the board of directors of the Rwanda Development Board and on the advisory board of Chance in Rwanda. So thanks for coming, Patrick. James Ogada is an engagement director at the Busara Center for Behavioral Economics. He spent the last 7 years doing research on inclusive finance. He's devoted to working with partners to make finance work better for low-income people. He often works with the private sector as well as philanthropy and government agencies to help create responsible value-adding products and to shape the development of strategies, programs, and consumer protection policy. Denise Ferris has been working as a research fellow at BRAC, Uganda's Independent Evaluation and Research Cell, IERC. She manages impact evaluations related to women's social and economic empowerment using an epidemiological lens. One of Denise's studies looks at digital solutions for repayment of microfinance loans and its effects on intra-household bargaining, financial and domestic violence, and general empowerment of women living in poverty. And those of you who are here this morning met Dean Carlin, who presented on a few different studies, including the Ghana panel. He's a professor of economics and finance at Northwestern University, co-director of the Global Poverty Research Lab, a fellow and on the board of JPAL, the Poverty Action Lab, and founder of, president and founder of IPA. So we're glad to have Dean on the panel. He's going to be filling in for Osman. Okay, with that, I'd like to start by just asking each of our panelists a question. And thanks to Dan and I think Osman too for organizing this and made my job very easy as a moderator. I want to start with Patrick. So, you know, coming from your background at the National Bank of Rwanda, can you tell us about your perspectives on the role of digital credit and digital financial services?
Thank you so much, and thanks everyone for inviting us today here. As it was said, my name is Patrick Itaezu, and I'm a researcher at the National Bank of Rwanda. Obviously, when talking about credit and digital credit, it's a good measurement of financial inclusion, and it has an impact on economic development. And if you look at the case of Rwanda, where where we have around 25% of the share of GDP or credit to private sector as a share of GDP, and only 36% or so of the population being financially included via banks, that alone creates, would raise the eyebrows of any economist working at any central bank. When you hear that only 8% of Rwandans today, they have had some histories with some loan products from the banking sector before, then you would wonder how does the central bank achieve its core mandates of price stability and financial stability. Financial stability assumes, among other things, that financial institutions' loan books are broad-based. They cut across different sectors so that there's no systemic risk somewhere. Monetary policy transmission requires that a wide range of households and firms, they utilize credit. They have access to credit and they use credit so that different various monetary policy tools can work. Now, the data currently show that around 47% of the people, they have access to the formal financial sector using other channels. And most of the 47% are have been brought in on board by digital means or digital financial services like e-monies and things like that. So as a result, the central bank, to achieve its core mandates of price stability and financial sector stability, has ventured into other mandates, other non-traditional mandates, some among them being financial sector development and inclusion, and some others like payment systems development. So I work on the research wing of the central bank, where we support those non-traditional functions as well to work. Our research is more is very close to the policy making of the central bank. We have currently different research streams that are related to financial inclusion and payment systems development. Currently, we are talking about some studies on the impact of payment infrastructures, for instance, on access to credit. We have on the supply side still, we are now currently pursuing some studies that aim to understand the pricing models of most providers of digital credit. Now, on the demand side, we also have some studies that are aiming at sort of increasing the demand for credit. Some of them being like the digitization of informal rotating credit and saving schemes, as an example. So we want that to help us not only to monitor developments in that informal sector, but also to sort of create awareness of the market to the banking sector that there is actually an evolving market. And then we are also digitizing them. We are mapping them and digitizing them.
The choice of loan products isn't always a rational one that consumers make. And I think people often assume that if you lower the cost of interest rates, then people would automatically switch to cheaper providers. But I think what we're learning is, again, some of these choices don't always tend to be rational, and we have to factor in other things like brand loyalty and trust of like certain brands. And it's not only just about the interest rate, as much as we likely in all of this room agree that people need to be picking cheaper options. But when you look at markets that are a bit more developed and there's a lot more variety, you find people tend to be very loyal to like more expensive brands and not look at alternatives and switch to cheaper alternatives that offer the same generic consumer loan products. Second is, I think there's some hype around the innovation that fintech players are producing in the market, especially when it comes to credit scoring. I am one of those, I don't really believe that hype, because I think what we're seeing in the market is a lot of the players say that they practice risk-based pricing. So the higher the risk, the higher the cost of these loans. And yet they claim to have these proprietary data science tools that help them understand customers. And we are clearly seeing that's not the case, because if that was the case, then they'll be able to figure out to distinguish borrowers who are creditworthy and those who are not, and those who would need other products. But we're clearly seeing that that innovation is not happening at the rate that which they claim, or at the or learning, or these algorithms are learning at the rate that we would expect them to. Something else we're observing is MFIs are starting to fold a little bit to the pressure of the growth of the digital credit industry. So what this means is MFIs would bundle loan products with other aspects such as savings and extension services, but the growth of digital credit, even in rural settings, means that people are increasing the demand for digital generic consumer loans, and the MFIs are starting to offer these same loans in response to market demand, because they also need to survive. And that, I think, is problematic when you consider the kinds of products that MFIs tend to offer and what digital credit doesn't as far as bundling and complementary services. I think what you're already observing that's very prominent is also the diversity of players operating in the digital credit space, and they have different implications for impact downstream. So we look at fintechs, they have maybe shorter term priorities, often because of the nature of investments that come in. You can compare that to banks, who I think have longer term perspectives, have higher risk appetites, and maybe have a deep understanding of borrowing behavior in domestic markets. So the nature of participants and how they extend these loans and their commercial priorities tend to have an impact downstream on customers that we're seeing more and more. In terms of where we're going, one thing that's a big problem is the gender gap in digital credit and digital finance in general. I think there was an assumption that digital platforms would close the gap in the gender gap in financial services, but actually what we're seeing is the gap is growing for reasons that I'm sure we'll discuss here in a bit. So these are usually supply and demand factors that are expanding this gap. So when it comes to supply, there's aspects like an algorithmic bias in the distribution of these loans, where moderate women who have moderate risk for loans tend to be excluded, and high-risk men tend to be included. And this is one among many supply-side factors that are emerging in the market. There's also demand-side factors as well. There's some women who tend to opt out of digital credit platforms. Maybe it's because they prefer other forms of engaging with finance and borrowing that are not related to digital credit. There's also aspects of like they don't own handsets, which obviously excludes them. and several demand-side factors that we've observed as well. One thing that was, another thing aspect that we've observed is the growth of what I like to call wage garnishment. So there's very high growth of digital platforms. So if you think about a digital platform, it's something like Uber or like Trigger Foods in Africa, where you have people who have reliable digital records of how much money is going in, how much money is going out, and there's some momentum to maybe carry out automatic deductions for loans, and this has, obviously, it has benefits as far as having reliable credit histories, but there's also some concerns around agency and when to repay and how to repay that are emerging as well. And I think one thing that we're also seeing, and I hope that continues, is the recognition of the need for a greater diversity of digital credit products. And there's people like the Gates Foundation and the FSD Network in Africa who we work with recognize this need and are starting to figure out what different products are needed for different segments. So women who have different kinds of occupations, for example, and there's a lot of momentum around figuring out what digital credit solutions look like for micro and small enterprises in Africa that tend to employ a lot of people and have real implications on livelihoods. So in a nutshell, that's where I'd say the industry is and what we've been observing going forward. Thank you.
Thanks a lot, James. Denise, can you speak to what you've seen at BRAC as the key factor for take-up and use of digital financial services, as well as any particular design features that you think can help users reap benefits from going digital?
Great, thanks for the question. I think, from BRAC's perspective, because they are a large microfinance organization, it started in Bangladesh, it's now operating in 6 different countries across sub-Saharan Africa. The main thing is that they're trying to pivot, the microfinance model to adapt to this digital service. And what they're doing is they're testing different theories in different countries. So in Bangladesh, you've kind of got bKash, where they kind of had to create a system similar to mobile money, and through social uptake and community, because there's a large trust, not only of the institution, but of people using the services, it was able to be kind of like a higher uptake. So awareness, I would say, is a big issue. Not only awareness of the product, but how do you transition your current clients to something new and novel, or how do you pivot as a financial organization to address this gap in the market that we feel is going to address, the forgotten in terms of financial inclusion. The other big thing that we've kind of seen in Uganda and Tanzania and Rwanda is literacy, digital literacy. If we're trying to reach the ultra poor, or the poor, which is BRAC's model, are they really going to have the skills in being adept at using these technological devices? Even something as simple as dialing a hashtag and a number to access your mobile money account, are they aware of how this process works? There needs to be a lot of training. In one of the studies I'm running with Isabella Cohen in Uganda is we did some experimental games of can they even send a basic SMS message? Can they read the account numbers and the mobile money messages that they're even being receiving or sent? The other thing that we've kind of seen on BRAC's side is trust. And trust keeps coming up throughout this whole entire conference whenever we start speaking about digital stuff. Trust in the data, trust we're going to use the data and protect it, trust that we as institutions are going to allow the clients, their trust. Do they trust us? A lot of the times when you're asking a microfinance or a woman or a disabled person to look at financial services, they need to have a lot of trust. And we've seen in East Africa that sometimes, as soon as an organization, a financial nonprofit, does something where women don't get their money or it goes missing, even with the mobile telecoms, people lose trust, and they lose trust fast, and then the rumor mill starts to spread around, and people then try not to use that services. The other thing that we need to factor in is sometimes the legal regulations, like in Uganda, they created a mobile money tax that is added on top that is taxing people when they withdraw the money. So a lot of the times people don't want to use that service. So how are organizations going to kind of look at this trust issue? And then lastly, I would say that probably the most important thing is human-centered design. How are we taking these things and leveraging it to actually adapt and respond to the context and the local needs of the populations that we are trying to serve? What works in Bangladesh of the bKash is not something that can be easily replicated in the East African market, largely because the telecommunication companies, MTN, Safaricom, Airtel, have already kind of filled that niche. So BRAC's model that has to adapt to now working and networking and integrating with these big corporate companies rather than creating an in-house solution. So that brings in a whole other set of issues and things that we need to address.
That was a great summary. Thanks, Denise. So Dean, I'll ask you a general question because you didn't get a pre-prepared one. So given all of your experience, you studied a lot of different aspects of digital credit and digital finance. So what are you most excited and or skeptical about?
Am I on? Oh, I guess I'm on. Well, you must have read the top thing that I wrote down I was going to say. So I think of digital credit as an economist's dream, right? When we think really basic, like principles of economics, we think about market failures, and we think about transaction costs, we think about information asymmetries, but let's just talk transaction costs. And digital credit is dropping the transaction costs for getting credit. 5 clicks on a phone, you can get a loan. That's great. But also digital credit is a total nightmare to a behavioral economist. Because 5 clicks on a phone and you take out a loan. What are the terms? How do you repay? What's the interest rate? Do you really understand what you're getting into? So now there's a solution to this, don't get me wrong. I'm not, I come down personally, like from my reading literature, somewhere in the middle that we need smart regulation, smart consumer protection. But you want to let markets work, you want to embrace this. It's going to happen anyhow, so we might as well figure out how to do it well in a way that is conducive to making sure that consumers understand what they're getting into. And then it can be great. We can have it, we can have the first best, maybe, or maybe second best. So that's my, big picture take, and that's, obviously a very hand-waving statement I just made about, smart regulation, what does that mean? And that's where, hopefully, research can help guide those kinds of decisions by doing collaborations with regulators, with banks or financial institutions to try to figure out what type of disclosure actually works. A lot of disclosure policy is really bad. It's the equivalent of telling people their weight in stones. Who here can tell their weight in stones? I don't even, I forget what the conversion is, but it's something, right? APR is not so different. You tell most consumers what the APR, usually somewhat useless information. Say that that's true in America as well as in Africa or Europe, that an annualized interest rate is often not the relevant number that people need to know to understand what the true cost of a loan is to them. And yet that's, in America, that's the regulation that we have, is you have to report APR. And in a lot of cases, that's really the wrong information. So this is, the problem I'm describing is not, I don't think we have a guiding light from some country that has figured this out perfectly. So that's my overall big picture reaction. The one other thing I would say is, I personally got my start in microcredit. That's how I got into doing development. I worked for a microcredit organization when I was 22 years old. And the thing that I was most struck by is they didn't know what their impact was, and they weren't using evidence to guide them. And I got into, that's how I ended up deciding to do a PhD and ended up in this path. And when we saw the impact of microcredit start coming out, and we saw a lot of mixed results that were kind of not too many negatives, very few negatives, only a few positives, and mostly a lot of mush is one way to describe it. I think there were a couple issues, and I think it's relevant to think about those issues when thinking about digital credit, and as we try to understand what is the impact of this from a societal perspective. One of the biggest issues with the studies of microcredit is that they all waited too long before they did any measurement. So we never had any really good information about how people were actually spending the money. This is true actually of a lot of programs. Cash transfer programs have the same problem, that everybody always wants long run, long run, long run. And I love long run, don't get me wrong. But if you wait a year after issuing credit to say how's life in a year, and then you get a mediocre result, we don't know whether that's because they used the money for some short-run things that made them better off, and then in the long run we're back where, you know, the money was gone, and they were still better off, or, you know, did they use it to invest and the investment didn't turn out well and they're back, or did they just spend it on things that you're not measuring? There's just so much unknown about that, so you don't know, and we don't actually have very good information about how people spend the money. And that's true of microcredit, and you know, I'm hoping that won't be true of digital credit if we you know, can act quickly to try to understand that better. But one of the other reasons why I think we see a lot of mediocre results from microcredit, we're probably going to see the same in digital credit, which is at the end of the day, money gets used for lots of things. And so it makes it so that if you want to measure the impact of something that for its very purpose can be used in 10 different ways. Think about a very simple situation. You know, we talked a lot about sample sizes and power calculations and things like that. You know, and a lot of these issues have come up. You know, if you have a study with 1,000 people, right, and you think about, okay, what do I need to measure the impact of this? And you say, oh, well, you know, I think it's going to increase, you know, investment and income, and so 1,000 is enough to study this. But now imagine that there's 10 different ways that people are going to spend that money, and it's 10% of the population is doing each of those 10 things. Right? And when you then measure the impact on any one of those things, you don't know who's doing which, and the point is you get 10 null results on your 10 outcomes. Even though it's working for everybody, it's just working in 10 different ways, and you don't know up front who's going to use it which way. Right? And it's not a very deep point, but it is a recognition that a lot of times when we see null results, it's not necessarily that it didn't work. It's just that it's not any one path, it's not any one chain theory of change that just has very clear steps where the first thing is A and then A causes B and B causes C. Whereas there are other interventions in the world where there's a very clear chain of events. You do business training, you expect business to change, and then from there you expect something else to change. You do an education intervention, you expect kids to learn more on tests, and then from that other things happen, right? So there's a clear chain. With money, from the very beginning, it can go a million directions, right? And so just be realistic is the point. And so then that does segue to the last point I would make, which is one of the things that I think is exciting about digital credit is the linkages. The linkages to other things that do have a social cause to try to promote, to try to help facilitate, where the digital credit, because it can control some of the flows of the money, you can do, you know, loans for solar-powered things. You know, loans that automatically get paid out to a school to pay for education expenses. And that does a couple things. It might make it so that the financial inclusion is actually helping to solve another market failure in a different sphere. It also does actually help focus the measurement. If it's a digital loan for school, well, the first thing you want to look at is school, and then you know. Like, did it move the needle on school fees? Now, if it doesn't move the needle on school expenditures, that doesn't mean it failed. It just means that it didn't, that linkage wasn't actually, it didn't actually further that linkage, but it still means that people got access to credit and they may have done good things with it, and now you got to look at the other 9 things, right? But if you do find a result on schools, it tells you that that linkage is working, and that there was a market failure in access to credit for the purpose of paying for school fees, or solar power, or whatever the case may be, and that linkage can work. And so that part I think is kind of exciting about digital credit, is being able to find those linkages where we are able to satisfy some other social issue that we're trying to address at the same time.
That's great. Yeah, thanks for reminding us that credit is a means to an end. It's not an end, and we really need to think about what kind of outcomes are we trying to influence. And also, we need to look at how different people use credit differently. And that's one reason that the DCO is now really focused on funding research that, you know, looks at different types of borrowers and how credit may affect them differently, including men and women. So I'm going to try to do the impossible, which is ask you guys 3 of my favorite questions in the next 20 minutes, and still allow room for or time for 1 or 2 questions from the audience. So let's try to make the responses quick so that we can get through these. So the first thing is pretty straightforward. What's one thing you'd like to see lenders or providers adopt or test to address consumer protection? Who wants to answer that? Or to improve outcomes from digital credit? what's something you want to see tested by the providers? I'm going to ask you about regulators as well.
Yeah, I can take that. So I think for one, when you think about especially novice borrowers who are interacting with digital credit for the first time, is there needs to be more lenience to these borrowers. So a lot of people are just trying digital platforms without necessarily knowing the consequences of being late on these loans or ultimately defaulting on these loans. And these have real and very damaging implications on welfare, because these people, as soon as they're included in formal finance, get excluded because they take out these loans to see how it works. They heard from a friend or family, and not knowing the consequences of not repaying those loans in time, what that means for their access to digital credit and other forms of formal finance in the future. Something else that I'm really that I think the market should push for is more effective disclosures, and I think this is something that you began to address as well. People don't really understand the terms and conditions. There's no cool down period from the time when our loan is available and making the decision to take that out and really figuring out what amount do I actually need, what can I actually repay. So figuring out how the timing of these information disclosures and the contents and making it simple yet comprehensive enough for people to adequately really understand the implications of their decisions. Yeah, maybe I'll leave it for that for now and see.
I think to kind of add on to James's point is that we kind of need to think about it from the eyes of the people who we're serving. You know, what is the outcomes we want to see with them? And we want them to develop better digital literacy, better digital literacy understanding of how these loans work, because it's so easy for them to kind of maybe get an ad to click, to go through the 5 little check boxes, but do they actually understand what they're signing up for? You know, if they've got a debt collector who's now phoning them or coming to their little house and taking away their only goat, what impact is that going to have on the household? And if they're not aware of what they're signing up for, then we're going to open up a can of worms in the sector that we are probably then going to create a lack of trust. We're going to create an unstable market where then people aren't going to trust these services. And what's going to happen is that ultimately people are going to become fearful and not utilize them. And then the gap that we see that is increasing is still going to increase, and it's not going to close.
So I don't know if this is what I'm about to say is right or not, because I want to see evidence. But there's a different way of looking at the same problem and a counterpoint. And I want to be really clear. I'm not disagreeing with you with evidence. I'm disagreeing with you about, I'm saying there's a different theory which says, you know, getting someone to be actually literate and financially savvy is actually a pretty tough thing to do. How about we just set up the choice structure so that it kind of lends them to the more to the better decision. I'll give you one example of a study from what I mean by this, and then an idea that I want to see happen, and we're working on in one place. In a study in Uganda, we did financial education, group-based financial education, and we also, that was one treatment arm. A separate treatment arm gave people access to a group-based savings account that was with a financial institution. A third arm did both together, and then a fourth arm was a control. We followed people up for 1 year, and then 5 years later. We were actually very surprised. The financial education alone did actually move the needle on income and savings and knowledge at 1 year. At 5 years, knowledge went away. No longer found a treatment effect on knowledge, but the behaviors continued. So it really made us wonder, was knowledge actually necessary? Or is it just the behavior that needs to be learned, and the behavior's learned, but you don't have to actually be able to answer questions about interest rates and things like this, that as long as you have the habit, that's all that really matters. So here's the idea that follows from that. And again, and this is something that, you know, it's easy to shout out ideas, right? And the point is, I might be wrong. I want to see evidence to see, like, what is the value of teaching versus setting up decision structures, and is there a way of doing that? In Mexico, we're working with the bank regulator to set up a tool online, the website, where you can go and you put in your information, and then you get bids from banks for starting with credit cards, and that would be, you know, basically digital more or less. But and the point is, you put in your information, and then you get prices and all sorts of other information about the options, and you know, you don't actually have to understand too much to work this, right? You do have to understand there's a column that has price, and if you want to sort by that, then you sort by that. So people could make the wrong decision, but it's actually really helping guide them kind of in a very easy way to the cheapest access to credit, given their profile. And this is set up by the regulator, not the banks. So they set it up, and we'll see what happens. We're just starting this project. So that is my answer to your question too. Is that's what if I were to talk with the regulator, I do think that understanding disclosures and things of this nature, like James mentioning, I'm a big fan of that kind of work. IPA actually does have a grant that has a competitive fund on consumer protection for financial inclusion. So do please check it out if you're interested in that work. We're actively trying to work with regulators and institutions to learn more about how to do that proper consumer protection. The thing I'd love to see a financial institution do is figure out how to treat the client's portfolio as a whole as the service they're providing, whether it's credit or savings. I think way too often we see some financial institutions which actually, whether explicitly or not, encourage people to do both at the same time. And trust me, they're not paying high interest rates on the saving than they charge on the loan. It's the other way around, right? So they're getting very little or next to nothing on savings, and then paying high interest rates on debt. And a savvy financier would never do that. The first thing they would do with savings is pay off their expensive debt. But the other thing that happens is once someone does pay off debt, they often don't continue to make payments, and so they don't accumulate savings. So is there a way of offering a product which actually looks at the portfolio and helps someone segue, if they are in debt, help them pay it off, and then continue making deposits so that they then accumulate their own savings? A lot of times there's this kind of cliff that happens from a behavioral perspective. You get, you're excited, you pay off your loan, and ooh la la, and then you just start spending more, rather than continuing to put money aside. And so I think that would be an exciting thing to see a financial institution take on, and I think the digital aspect actually makes that very amenable, because you can do various ways of describing the portfolio to clients in ways that are potentially more successful.
Patrick, do you want to add to that, or we can throw the regulator question on the table as well? What is the role of regulators? You can speak to either of those.
Thank you so much. So we are in a market economy, and you know that too much regulation is not good for the market as well. Now, where are we starting from in the first place? We're starting from an imperfect market structure in which we operate. The supply side is highly concentrated in the hands of a few, and what happens as a result, you have not only high prices, but also some scopes of unfair pricing as well. So the regulator then, what you or me as a regulator should be doing in this case. So one of the things that we do is, first of all, to advocate, or where possible, put up infrastructure that will reduce that inefficiency that pertains to the market structure in which the supply of digital credit operates. So currently the central bank has, let me say probably a couple of months ago, that was in April this year, we rolled out our regulatory sandbox for fintechs. So we are now allowing new adventurers in the fintech market to come and experiment their ideas, using real data and things like that. So with that, we hope to sort of deconcentrate the market, but we do not stop there. We go a little bit further to ask the providers, can you disclose your risk pricing model? Because they keep saying, okay, it's a risk-based pricing. Okay, but can you tell us how do you price the risk? That is the point at which we are today. We are not doing this only for banks. We are also doing it even for e-money providers. If you remember very well, one of the things that shows that cost is a very, very important driver of the uptake of digital financial services what did you observe a couple of years ago when we scrapped all these push and pull costs. Between June 2020 and June 2021, the number of merchant payments using e-services increased by 280%, just in a period of 1 year. So that shows that cost remains a major deterrent to the development of financial services in Rwanda. So what we want, first of all, is the disclosure of that pricing. Now, the second thing is to have, as a country, and other countries have already done so, to have some principles, some guiding principles for pricing by financial institutions. Let me give you an example of Kenya. So Kenya recently, when they moved from the interest capping to the market pricing, they came up with something called the Banking Sector Charter. So that charter aims to ensure that banks, when they are pricing their products, they observe certain principles, okay? It's not like you are dictating or regulating prices. You are simply telling the banks, look, there are certain things that you have to take into account. Maybe before I even get there. So in the past in Rwanda, or even in the present, the prices of loans were at a high level due to the information asymmetry, you know, and all those kind of things. But we've put up infrastructure to make sure that there is a proper credit reporting system. Now, what do banks do? That credit reporting system is going to be only used when they want to say yes or no to your credit application. But it won't be used when they are going actually to price your loan. So as a result, that initiative, that infrastructure that we put in place of credit reporting wasn't very much successful. So as a result, in Kenya, what they did is they came up with some principles of pricing loans. One which is customer centricity. So all the banks have to show that in their pricing, the customer comes at the center. And secondly, risk-based pricing. So not looking at overall risk in the economy, but looking at the risk pertaining to an individual customer. So after I've built my credit history, I should get a better credit score, and I should be priced accordingly. Not just have access to loan, but also receive a fair price.
Patrick, we need to transition pretty quickly. Can you take 10 more seconds?
Yes, yes.
Okay.
Then transparency and ethical culture, in the sense that banks need to avoid situations whereby customers do no longer trust them because they feel like they're more profit-oriented. They have to show that they are also caring about the social development. Thank you.
That's great, thanks. So I got to ask 2 of my questions, and I'm happy with that. So let's see if the audience has 1 or 2 questions so that we can wrap up on time. I don't believe you. I know everyone's tired. It's the very end of our conference. Okay, then I'm going to ask my last question, which is, you know, we've been talking a lot about how do digital financial services help and potentially hurt women, and I think that that's a really interesting question because we've seen examples of both. So, you know, in 1 minute or less for each of you, tell us what mechanisms are you most hopeful about in terms of DFS helping women, and maybe which ones are you most worried about? I know we could have a whole session or a whole conference on this, but.
I mean, I'll say the obvious, which is we need more evidence on this. It's so important, but you know, in a very simple way, potentially a way of hiding money. And then, but if there's mistrust, hiding money, giving it, you know, having a way to hide money, even if you're not hiding, could actually create problems. And you know, so it's complicated. But we need to see how it, you know, we need to see how it plays out.
I think I hope it gives women a more intrinsic sense of self-worth. You know, being able to successfully, you know, save your money or get credit or, you know, pay for something that you've saved. I think that intrinsic value helps them on the path to empowerment, and that little bit of extra self-worth in positive psychology, I think that will then help reaffirm other positive seeking behaviors.
So I take a little bit of a different perspective in the sense that in terms of the efforts for making finance work for women is digital doesn't necessarily have to be the tool used because if the demand is low for various reasons, maybe there's like a social aspect of like savings in groups, for example, and I'm borrowing from groups, then maybe efforts should be geared towards optimizing those and figuring out how to bundle additional products such that the value that they derive from those groups is maximized and there's operational efficiencies rather than trying to push people towards like these digital platforms that may not work for them. They may not have equitable access to smartphones and basic phones. So I think at least in the near term, that's how I would see it and where I think the space should be moving. Thank you.
In the case of Rwanda, the gender gap has been very high in the traditional banking system compared to MFIs and digital credit market. So what do you do? First of all, recognize that women are more prevalent in informal digital finance and help them build credit history because they have good credit history. And how do you do it? Digitize them. You know, map all the informal practices and help them to digitize and have proper credit records, and then perhaps with credit history, and they will be able to be scored and then have access to credit. Thank you.
Wow, it's exactly 5:30. You guys are amazing. Thank you so much for joining the panel. Sorry we didn't have more time to have this discussion, but I know you've got my wheels turning, so thank you. I think we're at the end, so Maya, where are you? Maya's going to give some closing remarks and get us all on our way. Thank you all so much.
Hi, everyone. I'm just going to give some remarks followed by Jennifer Nyakinya, the program manager for NIERA. So thank you so much, everyone. This was our 10th summit. The network has grown so much. I'm so inspired by all the East Fellows here, all the other researchers, everybody who presented. I think we've all learned a lot. There's so much to work on in terms of agriculture, health, financial inclusion, environment, but I think we heard a lot about really promising solutions, and also really importantly, we all got together and met each other. It was a hard 2 years without reuniting with the network, but I'm feeling really energized and positive. So please stay in touch with SIGA, stay in touch with NIERA, stay in touch with us about all our opportunities for African scholars and beyond. And with each other, I hope you all chatted, exchanged business cards, and really make the network even more robust. So big round of applause for everybody who attended. And I'd like to say some thank yous. So first and foremost, I'd like to thank my colleague, Chelsea Downs, who put a lot of her heart and soul into Summit, but eventually wasn't able to make it due to an illness. So if you could all do me a favor, and when I press my video, say thank you, Chelsea, and I'll send it to her, that would be great. So I'm gonna go now. Thank you so much. A couple more thank yous before I pass to Jennifer. I'd like to thank all my colleagues, Iman, Amy, Jenna, Joe, Sam, Carson, Ted, as well as friends Katie, Navishti, Anne, Jennifer, Akilia, especially Janine and Amable, without whom this would not have been possible at all. So big round of applause to all of them. And also to everyone who created the beautiful posters that we saw outside. I learned a lot from them. I hope the rest of you did too, and I hope you'll stay in touch. And with everybody who presented. And yeah, if those of you who created posters, please feel free to take them back after this. And yeah, with that, I would love to invite Jennifer to close on behalf of NIERA. So thank you so much, everyone.
Thank you, Maya, for that. I don't want to repeat the thank yous because I think she's thanked you enough and everyone has thanked you on their behalf. Like literally, we're all awesome people. I'm just happy to see that this group, the room is full, yeah? We were able to rally together to promote what we wanted to do. And for me, I feel like we had 3 intentions for this conference. One, obviously, is to showcase the research work that we're doing in the continent, the good work that we're doing. Secondly, is to promote these narratives of translating evidence to policy and networking. I'm sure a couple of you have met new people, exchanged business cards. For myself, I have. So I think this opportunity has been awesome for people to do that and to see how you can push the agenda further. So thank you once more. Thank you to the collaborators, to the partners, NIERA, Anne, from SIGA as well, from also Janine and her organization for pulling this all together, for the plenary sessions, the presenters, NIERA and East Fellows and members, all one and the same. I want to thank you once more. And last but not least, I want to thank you for engaging everyone. I mean, without you, we'd probably have a very dull and boring summit. So thank you for your questions, thank you for the interactions and for engaging everyone. And with that, I want to officially call this to a close. One last thing. Let's regroup outside at the reception for a group photo, please, so we can just go all down there and set ourselves up for a group photo. Thank you.
Sorry, one more thing for all of those of you who are here. I forgot to thank my colleague Dan, who put together the whole TCO section of the summit. So please, another round of applause. Sorry about that.